Being the agreed time, I declare open this meeting of the Senate Committee Affairs Legislation Committee. The Senate has referred to the committee the particulars of proposed expenditure for 21-22 and related documents for the health portfolio and the social services portfolio. The committee may also examine the annual reports of the departments and agencies appearing before it. The committee would appreciate if senators could provide any written questions on notice to the Secretariat by Thursday the 4th of November 2021. The committee has fixed Thursday the 16th of December 2021 as the date for the return of answers to questions taken on notice. Under Standing Order 26, the committee must take all evidence in public session. This includes answers to questions on notice. Officers and senators are familiar with the rules of the Senate governing estimates hearings. If you need assistance, the Secretariat is available to access a copy of the rules. I draw the attention of witnesses to an order of the Senate of the 13th of May 2009 specifying the process by which a claim of public interest immunity should be raised. Witnesses are specifically reminded that a statement that information or a document is confidential or consists of advice to government is not a statement that meets the requirements of the 2009 order. Instead, witnesses are required to provide some specific indication of the harm to the public interest that could result from the disclosure of the information or document. An officer called upon for the first time to answer a question should state their full name and position for the Hansard record, and witnesses should speak clearly into the microphones. Please make sure that all mobile phones are switched off or turned to silent. I remind senators and witnesses that microphones remain live unless I instruct otherwise, for example at the suspension or adjournment. I would ask photographers and camera operators to follow the established media guidelines and the instructions of the committee secretariat. As set out in the guidelines, senators and witnesses' laptops, mobile phones, other devices and personal papers are not to be filmed or photographed. The committee's proceedings today will examine the social services portfolio, beginning with the Department of Social Services whole of portfolio corporate matters. The hearing will then follow the order set out in the circulated program. The committee's scheduled break times are also listed in the program or as required. Senators, departments and agencies have been provided with advice on the arrangements in place to ensure the budget estimates hearings are conducted in a safe manner. The committee appreciates the cooperation of all attendees in adhering to these arrangements. I now welcome the Minister for Families and Social Services and Minister for Women's Safety, the Honourable Anne Ruston, Senator Anne Ruston, and I also welcome the Secretary of the Department of Social Services, Mr Ray Griggs. Minister or Secretary, would you like to begin with any opening remarks?
No, thank you, Chair.
Thank you very much. Senator Green.
Thank you, and can I start by welcoming Mr Griggs, and thank you for the response to my letter, the correspondence that I sent, and I assume those documents been given to the whole committee. So that's helpful. We won't have to ask a lot of questions today. I just wanted to start with understanding ministerial responsibilities for the vaccine certificates, because I just want to understand how that works. It'll help with questions later on. The Services Australia is the lead agency on the domestic digital vaccine certificate. Is that right? Is that in terms of organisational capacity?
Ray Griggs, Secretary, Department of Social Services. That's correct, Senator.
Okay. And how does that interact with the Digital Transformation Agency? Are they sort of providing advice, or is there a like a cross? Is there a cross-portfolio or working group?
I'm not sure of the exact detail.
Sure.
I think when Ms Skinner comes on later today, she would be able to give you that detail. But
Yep.
The DTA obviously has a whole government approach to digital matters. That's why it exists, and the exact level of their involvement, I think Ms Skinner can probably articulate better.
Okay. Maybe you can assist then, Minister, just on the responsibilities. We asked DTA and estimates on Monday night a couple of questions about the project, and I just want to confirm the minister responsible for overseeing the vaccine certificates is Minister Robert. Is that right?
Well, You're probably asking the wrong.
Well, no, this is to
Minister.
assist to understand
Yeah,
where
no,
to
I'm-
ask questions today.
Yeah, look, the issue in relation to the vaccine certificates doesn't sit with me as the
No.
minister, so possibly Minister Reynolds. But what I might ask the officials that are watching, if they could maybe get some clarity around the questions that you're asking and get them back to us as soon as possible, Senator Green, to make sure that you do have that information so you know where to ask the questions.
Sure, okay. Happy to come back to that if there is some more
Sure,
information
yep.
that will assist those questions. Just another, on another topic, I just wanted to ask some questions about Mr. Tidswell, the Deputy CEO of Services Australia. Is that, is there anyone here who can answer those questions?
No,
about
again, I think that is very much a matter for the CEO of Services Australia when she comes on later, Senator.
Sure. This is cross-portfolio, and I've got some questions about employment contracts, but
The trouble is, Senator, there's two cross-portfolio sections in today.
Sure.
There's the Senate, there's the Services Australia cross-portfolio,
no,
and
that's
there's
fine, I
ours. So
understand.
I was a little
We're just
confused.
trying
with
to include as many,
Yep.
well, address anything that's not portfolio related in cross-portfolio, but that's all right.
Senator Green, I mean, probably the easiest thing, if you want to ask the question, and if it doesn't fit with us, then clearly it'll sit in the other place.
No, I'm happy to wait for the right people to be in the room. Just on the letter that I did send you, Mr. Griggs, and again, thank you for all of that information. In addition to the Cashless Welfare Engagement and Support Services branch, would it also be possible for you to provide the structure and cost of the Cashless Welfare Policy and Technology branch?
yes, Senator, of course.
Yep. Can you provide that to the committee today?
I will
It's a long
attempt to
day.
do. I will attempt to do that.
Yep. Thank you. That would be helpful because it means we've essentially got one number but not the other. And what is the annual cost of the Cashless Welfare Policy and Technology branch?
I will get the relevant Deputy Secretary to come forward.
Liz Heffermead, Deputy Secretary, Families and Communities. Unfortunately, I don't have the costs of that branch with me, but I can get it for you quickly, I'm sure.
Okay. Thanks, Ms. Webb. Heffron Webb. How many people are employed in the branch?
Again, if I could provide that shortly, I'm sure it won't take long to compile that information.
Okay. Do you have a ballpark figure or you don't?
I think my ballpark is that it's slightly larger, the technology branch is slightly larger than the engagement branch, so...
Okay. I'm interested to understand of the, if you can provide those numbers to me, how many of those employees are APS employees and how many are contractors. So I'm after the total number of staff and then the breakdown of the two.
Yeah,
Senator,
we'll provide
you're seeking
that.
the same format for that.
Yeah,
It's
yeah.
in the
So
letter.
we've asked you for, and you've been very helpful in providing that
So if we
information
replicate
around
that.
one branch, but we didn't. We haven't extended those questions, so essentially the same questions around the
we can do
branch. Are there any other units in the department that are solely focused on the cashless debit card?
No, there aren't.
Okay. And are you able to provide the total cost of administering the cashless debit card program, taking into account the two branches together and the departmental costs like corporate accommodation services, senior executives and communications?
Certainly we'll be able to provide the staffing costs for the two branches and items like travel, etc. I'm not sure whether we would have a corporate overhead
we need to do
attribution, but we
yeah.
could have a look.
We need to do an apportionment, Senator. We'd have to do that. That'll take a bit of time.
Yeah. I mean, it is hard to separate it, but there would be departmental costs involved.
Yeah, absolutely. There'll be an overhead, but I don't I don't know what it would be. So
Yeah.
I just need to work with our CFO to calculate
Okay.
a figure.
Yeah, if we can get that figure as well. And I'm also, well, I'd like to know what the departmental costs of the cashless debit card program have been since its inception. So not just this financial year, but going back since it was created or since the legislation was regulations were proposed.
So I'm not sure we'll get that to you today,
No,
but
that's-
we can provide that on notice.
Understandable. Thank you. Just going to, and I know I've got Senator McCarthy on the line too, Chair, and I think she was keen to ask some questions as well. I'll just make sure that she's ready to go when I'm finished. Just on the, in regards to the, I'll just make sure these are going to the right portfolio, apologies. Well, I might ask if Senator McCarthy's got some questions, and I think they probably will lead in from those that I've just asked.
Okay, so I'm going to go to Senator McCarthy and then I'm going to go to Senator Rice.
Sure.
So, sorry, did I miss
Thank you,
something?
Chair.
Senator
Can
McCarthy.
you hear me okay, Chair? Thank you. Good morning, Minister and Mr. Griggs.
Morning.
Senator?
Certainly, thank you for the information that you've provided in relation to our requests on the cashless debit card. You have provided information that the communication and advertising expenditure on the CDC since the program commenced has been over $703,000. So what does this figure include?
Senator, that figure includes advertising costs, so purchase of radio ads, newspaper ads, etc. I might ask if our communications team are here, whether they want to give any more detail.
That would be good, thank you, Ms. Hepburn.
Our coup, Mr Hudson, will be able to provide a bit more detail.
Senator, good morning. Adrian Hudson, Chief Operating Officer. So as Ms Heffron-Webb indicated, the advertising costs include radio costs. That's both in English language and also some translated language. It also
You want
includes...
to let us know what the language translations are?
yes, I can provide that detail, Senator. So in terms of the radio ads, there are 15 different Indigenous languages they were translated into. I could provide the full list on notice if that would be helpful.
Yes, please.
So the radio advertisement was 15 different community languages.
And where were they?
So they were looking at the list of languages, and I'm not familiar with all of them, but predominantly Northern Territory by the looks of it.
So we're talking about the radio ads. Can you break down just where the radio ads took place? What stations, what states?
Yeah, so I could provide that specific detail on notice, Centre, if that's helpful, across all of the 15 languages and where which stations they were played on, and we probably have indicative dates as well, I suspect, which I could provide on notice.
All right, you don't have those with you now, the table?
No, I don't have that detail, I'm afraid, Senator.
Okay, keep going.
In addition to that, there would have been print advertising in newspapers. We also produced fact sheets. Again, some of those in English and some were translated into language. There were 14 fact sheets translated into language. So they were the predominant advertising side of things that go into that $703,000 figure you mentioned.
So was there any television? So that's print and radio?
No, so we didn't have television advertising for those, just the print and radio.
Any social media?
Not that I can see on my list, Senator.
Senator, there
Would you like to
may
say
have
that?
been social media activity, but I don't think it would count in the paid advertising figure, that's all.
Correct. So if there are other forms of promotion, Senator, that weren't paid for, then that won't be included in that $703,000 figure, which is why that won't be on my list.
Okay.
Yeah.
If you could just check there and come back to us if there is extra information around that.
Yeah. So if
Is the total in?
Sorry, Sandra, I was just going to say, if the department did organise social media, I can provide that information separately, but it's just not on my list of paid departmental expenditure.
Okay. Is the total in marketing, research, communications and advertising expenditure, and are there any other elements that have not been included?
So Senator, the figure that we provided you was the advertising, so the paid advertising expenses. That's the print and radio advertising expenditure. So there would be other elements that fall outside of that. That's not paid advertising though.
Okay, so could you just provide any information on those other elements?
Yeah, so
that fall outside of it?
I can provide that on notice, Senator, with the other information you've asked for, if that's helpful.
What can you provide? Is it around marketing and research?
It's fairly broad in terms of the information I have, Senator. So I mentioned fact sheets earlier, which we've done as part of the process. Information sheets and posters, for example, that we might display in a Services Australia shop front, brochures, those sorts of things. So what we would describe, I guess, as below-the-line communication products, so not paid advertising, but more information products that people have available to them, either provided directly to the individual or accessible through, for example, a Service Australia shop front or a Service Australia agency, for example.
And how much would the cost be towards communicating and advertising that, which falls outside of the 703,000?
So in terms of, for example, the printing of fact sheets, posters and brochures, the figure I have for that is 36,363. So you're talking a substantially smaller amount of money for those sorts of information products.
Just going back to the social media, there's also YouTube videos. Are you aware of that?
So I'm not aware of YouTube specifically, Senator. So I am aware that in Services Australia shop fronts, there were some video information playing on the TVs we have in Service Australia shop fronts, but I'm not aware whether or not that extended specifically to YouTube.
Could you please take that question on notice, because I do understand there is YouTube and I'd be interested to know if that was paid for by the department.
Yep, Senator, I'll take that on notice.
With your Services Australia shop fronts, where are you talking about? Are these new shop fronts or are they existing ones?
So this would be the existing network of Service Australia offices, Senator.
Okay, so not specifically set up for the cashless debit card.
No, this would be the existing network of shop fronts we have in Service Australia, yep.
Okay, and how many of those are there again? Could you just remind me?
I don't know specifically how many Service Australia shop fronts there are nationwide, Senator. I mean, Service Australia would be able to answer that question. Rough order of magnitude, there's 300 possibly plus, but my recollection of that detail is somewhat dated. Service Australia would be able to provide exact numbers of the number of shop fronts they have around the country, noting that there will also be Service Australia agency shop fronts as well, where services are provided on their behalf in other locations.
How much has been spent on advertising and promotion in the Northern Territory since the cashless debit card was rolled out here?
Senator, the advertising materials, it's difficult to split between Northern Territory and because some of the developmental work was undertaken for both Cape York and Northern Territory. So we could probably get you a figure on the purchase of radio ads and time, but some of those costs will relate to development of materials that we would need to attribute somehow.
I've seen numerous newspaper ads up here, Ms Heffron Webb, so you have no figures with you right now as to how much that would cost?
If Mr Hudson doesn't have that split now, no, I don't have that. But we can provide that on notice for you.
If you could, we'll obviously be going through this throughout the day, so it would be important for any of your staff listening to provide that information, please, today. So how much, could I also ask them, how much of it is for every one of the 1,104 people who have been transferred onto the cashless debit card?
So, Sandra, we wouldn't break down costs at a participant level like that. So with something like advertising, for example, you would be advertising to reach a very broad audience in terms of the particular cohort who you are trying to communicate with. And whether that's one person or a million people, just for the sake of numbers, your advertising cost is about reaching a cohort. And one of the important things with a program like this is making sure that you communicate with people so they understand what the program and service is, so that where they are participating, they have as good an understanding as possible about the program.
So if you're taking out half a page in the Northern Territory News, for example, that would be around, say, $500, maybe $1,000?
I'm not sure. I'm not sure what the exact cost of a single advertisement would be, Senator.
What other areas in the Northern Territory are you advertising in?
So as indicated, both print and radio, and I've taken on notice the specific radio stations and languages for which we have translated. As I indicated earlier, in the Northern Territory, we translated the radio ads into 15 Indigenous languages.
And have you employed Indigenous people to participate in your advertising?
Senator, certainly some of the video materials employed Indigenous participants and Indigenous creative development. Again, I think that we'd have to get you more detail on notice. Is that what you're asking about, whether we've used Indigenous creative firms?
I'm curious as to how you're actually doing it. So how many Indigenous people would you have employed to do that?
We'll have to take that on notice, Senator.
So you can't tell me right now how much you've spent in the Northern Territory on advertising. I'm going to take that question on notice, although this is something I've consistently asked even previously through the Senate inquiry. Can I just ask, this money could have been used to help the community more broadly, couldn't it?
Senator, so this is implementation of a decision and of the legislation as it stands. We think it's important that people in the community have information to help them inform their choice. As you know, the legislation that passed enabled people to volunteer to transition to the cashless debit card, and so people needed information and knowledge to know to help inform their decision around that.
Can I just ask, going back to the newspaper ads, I would like a breakdown of how many ads have been placed. There seem to be at least 2 or 3 a week, but I could be corrected on that. I certainly am aware of radio. I would like confirmation on TV. Definitely have established a YouTube video around the cashless debit card and informing. I'd like to know where and how many times that ad has gone in terms of advertising the cashless debit card. Could I ask, are any community or health organisations being sponsored, or is the government placing paid ads in community newspapers or at community facilities, sporting grounds, or even with local Northern Territory councils?
I'm not aware of any paid activity with community organisations, but we will take that on notice. I have just been informed that the YouTube videos apparently are playing on the Services Australia YouTube channel. Is that right? Is that what you were referring to when you were talking about the YouTube videos?
Ms Heffron-Webb, it's a YouTube video that shows and talks about the cashless debit card. Whether it's played on your channel or not, you still have to put it together. I'm interested to know how much it cost.
Okay, yep.
So you've spent hundreds of thousands of dollars to persuade people in the Northern Territory in particular, because I imagine of the $703,000, that's a lot of money. You've tried to persuade people in the Northern Territory to go on it. You've got around just over 1,104 people who've taken it up in the NT. Are you disappointed with the low uptake?
So, Senator, just to clarify those advertising figures, that's for the period 1 July 2015 through to 30 September 2021, and that covers all 7 sites. It's not limited just to the Northern Territory. So just to provide that context, those advertising figures we provided are for the entire program over its life.
So you can talk about the 703,000 from 2015, but you can't break down from the beginning of this year to now how much of that has gone to the Northern Territory. Can I just ask why it is that you're just not contacting the 20,000 people who are on the basics card directly instead of having to spend extraordinary amounts of money advertising?
So, Senator, there has been a mail out to people who are currently utilising the basics card. There's also a process by which we've undertaken community visits. They've obviously had to cease during the pandemic, but before that, or when there was the opportunity to provide information, to hold community meetings, etc., Services Australia in their remote visits to communities will provide people with information and offer them the opportunity to transition. So we have directly engaged with the people participating in the basics card as well.
How much did those engagements cost?
Senator McCarthy, would it be, can I just maybe seek or put some clarification here? What we're referring to with the $703,000 is not just about ads, it's about communication. And also, we're not trying to persuade people in the Northern Territory to go onto the cashless debit card. What we want to do is to make sure that people in the Northern Territory who are on the basics card have the information available to them to understand the difference in the product, the basics card product and the cashless debit card product. It is merely an exercise in making sure that they are informed, so should they choose to make that decision, they have all the information. So the government is not persuading people to do anything. The government is making sure people have all of the information, factually correct information on which they can make their own decision.
Thank you, Minister. Well, just on that note, I have noted that you seem to have spent more time advertising in language, the cashless debit card, but nothing in comparison to what you should be doing around the COVID vaccine translation in languages, so we can see where your priorities are.
Senator, I would reject the premise of what you've just said, absolutely, and say that the government is absolutely focused on making sure that we support Indigenous communities through this pandemic. We understand, the sensitivities and the vulnerability of Indigenous communities. But the other thing I would say is that some of the great challenges that we've been faced has been around a really chronic scare campaign to Indigenous communities around the vaccination. But, we will continue to make sure that we work very, very hard and tirelessly to make sure that Indigenous Australians are protected. And I think, to suggest otherwise is particularly offensive.
Well, as offensive as you might feel it is, Minister, with the greatest of respect, the department, the Health Department, which I'll raise certainly tomorrow, was asked back in February in terms of translations for Aboriginal and Islander communities. Money was only received in September in order to do that. And so it is a abrogation of the federal government's responsibility in terms of having been on the front foot to get this information, in particular around COVID out there. And yet when you compare it to the work that the government wants to do on the cashless debit card, I think that is incredibly offensive. Can I just ask how much of the spend has been with First Nations media organisations?
Sorry, Senator, I didn't quite catch that question.
How much of the spend?
Could I ask how much is being spent, or how much of the spend of the 703,000 has been with First Nations media organisations?
I'll have to take that detail on notice, Senator.
All right, if you could take that on notice in terms of the $703,000 since 2015, but also if you can take that question on notice in regards to the Northern Territory.
Yes, Senator.
Senator McCarthy, there will be future opportunities to continue your line of questioning if you wish, but I'm now going to go to Senator McAllister.
Okay, thank you, Chair.
Thanks, Chair. Good morning, Minister, officials. I wanted to ask a couple of questions about the Women's Safety Summit. The agenda didn't include housing, as you know. I wanted to ask the rationale for that. On what basis did you decide to exclude that issue of safe and affordable homes for women and children fleeing violence?
Senator, I would sort of reject the fact that you would suggest that we had excluded housing. That's certainly not what the case was. We believe that housing is an issue that permeates many of the different areas of the agenda of the summit. We absolutely acknowledge that that housing is a very important factor when women make that extraordinary decision to escape a violent relationship. And as you would know, working in this area, things like the Safe Places program that we put in place, things like keeping women safe in their homes. Obviously, the Escaping Violence payment was very much focused on making sure that we would be able to give women the financial wherewithal to put a bond down on accommodation. So there was never any intent to exclude the issue from the summit. It was merely an issue that we believed permeated many different areas of the agenda of the summit.
Yes, I mean, I have to say that wasn't how it was experienced by stakeholders, and in fact 240 domestic violence and homelessness organisations signed a joint statement which highlighted their concerns about the issue and the lack of government action to provide safe homes so women and children can escape violence. Are those concerns that you share?
Well, certainly, as the overarching principle of the establishment of this next national plan to end violence against women and children has been a very complex co-design process that involves the states and the territories, the sector, and most importantly, hearing from the voices of victim survivors around what they need. And this is this has to be a whole of Australia response to all of the issues that confront us on this really confronting issue. And so, we seek to make sure that we work with our colleagues on the Women's Safety Ministers task force from the states and territories around Australia. We also seek to work with the sector to understand, and I commend your home state of New South Wales in recent weeks making an outstanding announcement in relation to additional funding to housing, crisis housing for women escaping family, domestic and sexual violence. But, you know, it is a very important issue, and we will continue to work with all of the people that need to come together if we really are collectively going to make a difference in this area. It's not going to be one government, it's not going to be one jurisdiction. Everybody in Australia needs to understand the role that they need to play, and we all need to work together in a completely non-partisan way to make sure that we actually do change the dial on this issue, Senator.
The same statement that was signed by these stakeholders called on the Morrison-Joyce government to address access to safe and affordable housing in the next national plan, and they were very specific about it, by investing in the supply of new social and affordable housing. Do you agree that Commonwealth investment in a new supply of social and affordable housing will help address this issue?
Well, Senator, in relation to the domestic violence component of what you're referring to in relation to a safe place for women to go when they escape a violent and abusive relationship, of course, we are doing a number of things at the Commonwealth level to make sure that we address those issues specifically. And I mentioned a few of them a minute ago: safe places, keeping women safe in their home, making sure that women have got access to the financial resources to be able to get access to payment. But we also have to work with our colleagues in the states and territories in encouraging them to undertake, you know, the necessary initiatives to get increased social affordable housing, because, as you know, the federal government provides $1.6 billion every year to the states and territories for this express purpose. But we also, you know, as I said, acknowledge New South Wales and the money that they have recently made available for this absolute purpose. So I think, you know, as I said, this is a whole of Australia, all levels of government response. And the federal government, I mean, we made the largest ever commitment in the budget in 2021, the $1.1 billion as a down payment towards the next national plan, to make sure that we covered all aspects of preventing, early intervention, responding and recovery of family and domestic violence. But we are working in partnership with states and territories, and the states and territories have a very strong role to play in relation to community affordable housing.
Yes, well, can I come back to that? Because I am asking a very specific question about this call for the Commonwealth to invest in an adequate supply of new social and affordable housing. Is that something that we would expect to see in the national plan?
Well, Senator, I'm not going to preempt what's in the national plan, apart from to say that, you know, the feedback and the consultation process, which was extraordinarily thorough, is clearly going to inform this plan. I mean, I think the issue of social and affordable housing is absolutely unquestionable, that you know, this is a very important issue. How and where it is provided, you know, is, you know, as I said, is it's largely a matter for the states and territories, but of course the federal government wants to take a leadership role in this plan and the overarching framework to encourage that all aspects of responses, you know, are dealt with. But I'm not saying that social and affordable housing is not a very important component of the national landscape. What I'm saying is that it is firmly the responsibility of the states and territories. The federal government will continue to work, particularly at the crisis end of accommodation, because we know when it comes to family and domestic violence, that first point of call when a woman makes that extraordinary brave decision to leave a violent relationship is about accommodation. And so once again, I'm talking about safe places where it's safe to do so, keeping her safe in her home, making sure the escaping violence payment, you know, is able to be quickly provided to someone to be able to get a bond down on a rental accommodation. You know, we will play our role, but I also call on the states and territories to play their role as well, and I acknowledge New South Wales, your home state, for having done so.
When you made your closing remarks at the summit, you did speak to housing, and you said that housing is vital to providing women and their children with safety and security. and housing responses must be appropriate for the diversity of groups, including Indigenous Australians and older women. Will housing specifically be addressed in the next national plan to reduce violence against women and their children?
Well, as I said, I'm not going to preempt what's going to be in the national plan, but I can assure you it was a very strong message that came out of the consultation about the need for housing, and you know, I would be extraordinary. I think I'd have to say yes, it will be, but you know, I don't want to sit here today and dissect everything that will be, might be, or might not be in the next national plan, because I don't want to preempt the further rounds of consultation. I mean, obviously we have to put it through all of our advisory groups. Obviously we need to make sure in terms of the response, particularly as they relate to the Indigenous response, need to be you know, put through the experts in that area, the Indigenous panel. I also need to put it through the States and Territory Women's Safety Ministers. There are a number of processes that need to occur between now and you know, the release of the plan in the coming days. So I don't want to delve into detail, but I absolutely can say that the recommendations that came out of the inquiry, the House of Representatives inquiry, the feedback and the statement that came out of the Women's Safety Summit, the consultations that have been undertaken by Monash University, particularly the consultations that they have had with victim survivors, because we had a separate program to make sure that we heard the voices of victim survivors individually. So all of these things, the recommendations and the consultation process will inform what the next national plan is. And clearly the issue that you're raising around housing and housing availability is one of those issues. But I can talk all day about, you know, the existing commitments, acknowledge some of the things that the states and territories have been doing, but I can't tell you exactly what's going to be in the next plan, because that would be preempting a process that has yet to conclude.
In your answer earlier, you indicated that in your view, social housing and affordable housing is predominantly the responsibility of states and territories. Are you saying that despite the calls from advocates and victim survivors for a new supply of permanent social housing, you consider that to be a responsibility of the states and territories?
Yes, I do, Senator, but obviously we will continue to work as a collective group of governments to resolve this issue. But states and territories do have responsibility for housing. I mean, we provide $1.6 billion every year on social community housing and homelessness payments to the states and territories. And in addition to that, there are other housing aspects of the government fund. So it's about a $9 billion a year transfer of funds from the federal government to state and territory governments in relation to housing that occurs every year in a range of areas, but specifically in our area, $1.6 billion of funding is provided to states and territories for this express purpose.
I guess I'm trying to... I think you'd acknowledge that there is a gap, that there is not enough social and affordable housing, and that gap is impacting on women and children in particular.
There is certainly evidence to suggest that housing is a significant component of the response to family and domestic violence. Yes, Senator.
But your response is that the responsibility for filling that gap is not with the Commonwealth.
That's correct, Senator. It's been a long-standing agreement between states and territories and the federal government. I mean, that's
well,
the
it's not
basis
long-standing. A Labor government takes a very different approach, but you're right. It's a long-standing coalition position that you don't take responsibility
and the
for
National
this.
Housing and Homelessness Agreement is an agreement that is currently in play between the states and territories and the Commonwealth government in relation to the provision of funding for this express purpose. But Senator, I mean, notwithstanding that, I mean, we made, the Safe Places investment that we made for 6,500 women every year and their children to be able to have a safe place to go when they're escaping violence. the investment that we've made into keeping women safe in their homes, and as I said, the investment in the escaping violence payment are just a few examples where the federal government has provided additional funding in this area. I'm not going to preempt what is going to be in the next plan, but we certainly understand the importance of this issue, particularly the importance of that crisis accommodation on the night, which it often is when a woman leaves a violent relationship.
Yeah, well, we might have to agree to disagree, Minister, because the recovery process takes a very long time, and housing is absolutely essential for that process.
I don't disagree with you, Senator.
Can I just turn to something different, which shouldn't take terribly long? Minister, have you had a chance to read Prue Goward's op-ed in the AFR last week, which was entitled "Why You Shouldn't Underestimate the Underclass"?
Yes, I have.
Yeah. Are there any aspects of Prue's, Ms Goward's article that you agree with?
I can categorically state, Senator McAllister, that the views expressed in that article do not reflect my views or the views of this government.
So when she described poorer Australians as damaged, lacking in trust and discipline and highly self-interested, you wouldn't agree with that?
Of course I don't agree with that.
Minister, she also says that since the 1950s there has been a remarkable growth in the number of proles. I mean, you would never use the word proles to describe poorer Australians, would you?
Senator, I think if you refer back to my opening statement, there is nothing in that article that reflects the views, my views or the views of the government.
Yes. Minister, you appointed Ms Goward earlier this year to be on the advisory body for the National Plan. Would you have appointed Ms Goward to the board if she'd published this op-ed prior to that appointment?
Well, that's a hypothetical question because that case didn't exist. We are where we are. One of the things I would say that, when we appoint people to boards, we don't necessarily, or we don't expect them to, necessarily conform to all government policy. We don't operate in an echo chamber. I mean, obviously a contest of views is very important to make sure that, policy delivery is important. But notwithstanding those comments, Senator, the comments that were in that article have certainly offended a number of Australians, and probably most Australians, and they do not reflect my views whatsoever in relation to the issue that she is addressing.
Have you spoken to Ms Goward about her tone and approach?
I've spoken to Ms Goward and expressed my view that the government couldn't associate itself with those comments in any way.
Did you discuss her future on the advisory board?
No, I didn't. However, I gave Ms Goward the opportunity to respond to me in relation to those comments, which she's yet to do.
Is Ms Goward's continuing participation in the National Plan Advisory Body contingent on that response?
I will reserve my decision until I've received that response, Senator. I will make a decision at that time, but as I said, the government doesn't seek to operate in an echo chamber. We don't seek to make sure that everybody that we put on a board has the same views that we do. It's about a contest of ideas, but I take this issue very seriously, and I will have more to say possibly after I've received Ms Goward and Professor Goward's response.
I understand. Just to wrap this up, did you write to Ms Goward in relation to this issue, or did you speak with her on the telephone?
I've done both.
Done both, okay. I imagine you'll take this on notice, but would it be possible for you to table the correspondence between yourself and Ms Goward on this question?
I will take it on notice, but I think it's unlikely that I will be taking that sort of correspondence. But nonetheless, I certainly I won't make the statement now that I won't. I'll take it on notice and I'll get back to you, Senator.
Thank you, Senator McAllister. Let's now go to Senator Gallagher now.
Thank you. Thank you, Chair. I've got some questions about a contract. It's actually with the Health Department, or it's under their, tag, but it seems to relate to the cashless debit card. Is this the right area to ask that question? Yep. Okay. So it's, I can give you the contract number. It's CN 3808987. The contract's with the Department of Health for temporary personnel services, and the description of the contract, it's for about $300,000, is cashless debit card consultation.
I'll have to take that on notice, Senator. I'm not aware of that contract and what that's for. I'll see if someone can advise me, and
That would
I'll
be good.
try and provide you an answer as quickly as possible
If
today.
you could. It's with 555. That's the company that the contract is with.
So Department of Health has a contract
Yeah.
for cashless debit card staff.
Yes, so I'm trying to find out, well, the description is cashless debit card consultation. So my first question is why would there be a contract with the Department of Health? Is it whole of government procurement panel or something like that? Might be the explanation. We've got some help coming.
Adrian Nelson, Chief Operating Officer. We just looked up AusTender. It's definitely a contract held by the Department of Health. It's not a contract held by social services, so we won't have any information available to us on that contract.
So why would the Department of Health be doing cashless debit card consultation without your knowledge?
I'm as mystified as you are, Senator. I will endeavour to speak to my colleagues at Health and find out.
So it's from your point of view, you have no idea. It's you don't have any work being done by 555
Not to my
on
knowledge.
the cashless debit card.
Not to my knowledge. The only thing that just occurs to me is a possibility is that there was funding in the budget for alcohol and other drug services for cashless debit card communities, and so whether there's some consultation occurring around those facilities, but it seems odd that they would have labelled it like that. So I will...
Without your knowledge?
Yes. So I will speak to colleagues in Health and endeavour to get you an answer.
Okay, so you think it may have something to do with a budget measure which went to the Department of Health around
Alcohol and other drug facilities. So there's a budget measure to provide alcohol and other drug facilities in the 4 sites.
Okay. All right. Well, if you could
I will.
clarify that
Sure.
and maybe come back, Chair. That was I had a range of questions on that, but I think we've probably reached a dead end on that.
False start.
Perhaps. Temporary.
I'll come back then. I think Senator McCarthy might have had some other questions to continue with, so I might go to Senator Rice now, and then perhaps to Senator McCarthy if you still have questions. Senator McCarthy, we'll start with Senator Rice here.
Thank you. And look, I think I want to go to the issue of the broad issue of the structure of the DSP and the need for conditions to be fully diagnosed, fully treated and fully stabilised. And want to table report within The Guardian this morning about a person suffering cancer. And so, look, Minister, you've already got it. Great. Good. Excellent. The case of George in The Guardian this morning was stark, where basically before George applied for the DSP, he was told he had a brain tumour with a 50% survivability rate over 5 years. before he applied, he had a convulsion related to this brain tumour, jerking both arms, frothing at the mouth, face had gone pale, his lips were blue according to hospital records, and they discovered a growth on the left side of his head. And doctors operated and managed to remove what turned out to be a grade 3 astrocytoma. He has been denied the disability support pension. He is absolutely struggling to survive on JobSeeker because with his medical treatment, which is ongoing, as I said, 50% chance of living. Minister, what are you going to do about the fact that people are hugely suffering because of that condition in the disability support pension, that in order to receive the DSP, that people's conditions have to be fully diagnosed, fully treated and fully stabilised?
Senator, I'm not in a position to be able to speak to this particular example, as I would not speak to the circumstances of any individual's case, because of course that would be totally inappropriate. But of course, if Mr. Upjohn believes that his determination at Centrelink is not appropriate, then certainly I would encourage him to seek a reassessment.
But Minister, the very way that the DSP is now structured, with the need for conditions to be fully diagnosed, fully treated and fully stabilised, means that according to that criteria, he in fact isn't eligible. And I mean, the guidelines in the Social Security Guide say that a person's non-terminal cancer that is still being treated by chemotherapy and for which prognosis is uncertain would not normally be regarded as fully treated. So he was rejected on those grounds. So clearly the whole basis of the need for people's conditions to be fully diagnosed, fully treated and fully stabilised means that people are suffering incredibly. I mean, what Mr Upjohn says, that, the experience has dented his faith in the country. It's the first time I realised that people in a country that I was proud to be part of would suffer needlessly, would have stress pressed onto them during the darkest days of their lives. So what are you going to do about changing that criteria so that people can be accessing the support they need when they're going through such devastating times in their lives?
Senator, I don't want to go to the specifics of the individual that you're referring to, because I don't have all of the information, and as I say, I don't want to talk about a specific case. But there is a long-standing set of principles that sit behind the disability support pension. It is a long-term payment for people, with often lifetime conditions now. But I don't want to in any way diminish what Mr Upjohn is experiencing, so I'm not going to go to the case. But it is a long-term feature of the disability support pension.
Well, my understanding is that in fact it was changed, and that in fact, we used to have sickness benefit, which was for people that were, had temporary conditions. We no longer have that. And so this condition that requiring the DSP for conditions to be fully treated, fully stabilised, means that people like Mr Upjohn are missing out. You don't want to go to his individual case, but it's true, isn't it, that it's virtually impossible for people who are receiving cancer treatment, unless they are told that, yep, almost certainly your condition's terminal, you've got less than 2 years to live, that they're not eligible for the disability support pension.
Well, Senator, there are other provisions within our system to support people with illnesses that don't meet the requirements of the disability support pension. Sickness allowance is one of the things that is available to people, but I didn't think sickness allowance doesn't exist anymore. No, that's the whole point, Minister. Sickness allowance doesn't exist anymore. Oh, so yeah, that's the same as JobSeeker. Yeah.
Yes, it's JobSeeker, and on JobSeeker, Mr Upjohn, his circumstances are that, he can't afford to pay his rent. He's not even due to his girlfriend's modest income, he's not even getting a full amount of job seeker. He's had to sell off stuff, and he's been told, "Well, maybe you need to take out a personal loan." You know, these are the circumstances that we're putting people through at this most incredibly difficult time of their life. At the same time, he's being told that he's never going to work again in his field as a commercial pilot that he's trained as. And the system is meaning that he is being absolutely left to suffer and to struggle in poverty.
Well, Senator, as I said, I'm not going to the direct circumstances of this article, but you know, we have a comprehensive support system that exists to help people, including a world-class health system, hopefully to support Mr. Upjohn through this and many others. But you know, this is the disability support pension is for a specific purpose. And has specific criteria that it's required to meet. But as I said, I would really prefer not to be having a discussion about an individual.
But it goes to the point, Minister, it's not just an individual. I mean, that's the whole point. This is across the board. People in situations like Mr. Upjohn, whose condition is not classed as fully diagnosed, fully treated and stabilised, are not eligible for the disability support pension. And that even though that they have got incredible health conditions that mean that they can't work, they are left to languish on the totally inadequate job seeker payment. That means that they can't afford, you know, we've heard all of the stories of what people trying to survive on job seeker. They can't afford to pay the rent, they end up being homeless, couch surfing, they can't afford food, they can't afford their medications. I have heard so many stories in the last month since I took on this portfolio. So that's what, and it's structural, Minister. So that's why I'm asking you, what are you going to do to change these structural problems with the system?
Senator, this is a very complex area. We constantly looking to ways that we are able to provide support to people, to Australians in need. Obviously, you know, through the pandemic as an example, you know, the support that was provided to Australians who were doing it tough, to vulnerable Australians. And, you know, we will continue to work to make sure that we do provide support. But, you know, I'll take on board, you know, what you've said.
I mean, to me, it's not very complex. It's to me that we as a country should be providing support for people, particularly when they're going through such difficult circumstances as you know, receiving treatment for brain cancer. So can I ask you then, I mean, do you have any figures on how many people are in the situation like Mr. Upjohn? How many people with cancer who've applied for the DSP are now on job seeker payments?
Senator Rice, Matt Flavel, Deputy Secretary, Social Security. I think maybe before just going to job seeker, just for the committee's benefit, as you know, because I think you're now the chair, this committee is looking into general issues around the DSP. The department made a submission, has appeared in front of that committee. We did table some information as part of our submission that looks at the primary medical conditions that people have on DSP. And as at April, there were 17,369 people who were in receipt of DSP who had cancer or tumour listed as their primary medical condition. So sadly, many people with cancer do in fact receive the DSP, and as you I think know, it can also be granted manifestly. If somebody has a terminal illness with less than 2 years to live, they can actually get DSP without going through the sort of the further assessment
Sorry,
process.
that 17,000 was people with cancer on
DSP.
On DSP,
Yes.
But how about people with cancer who have been denied DSP who are on job seeker?
Well, it's not possible to know how many people were denied, but I think we've previously at the last hearing given statistics about people on job seeker payment with a partial capacity to work, and where they have a partial capacity to work, what the first recorded medical condition or category is, and the data we have as at the 24th of September
there were 7,694 people receiving JobSeeker who had cancer or tumour listed as their primary medical condition.
So we've got over 7,000 people across the country who are struggling with cancer, being treated for cancer, who are languishing below the poverty line on JobSeeker. That's an indictment on our country.
Senator, I don't accept the entire premise of your comment.
Well, you just think of those 7,000 people who are being treated for cancer. And do you have any figures on how many of those cancer patients on JobSeeker have to undertake mutual obligations?
Senator, that's something I think has actually been asked through the DSP committee, through the committee rather, that's looking into the DSP. It's actually a matter for the Department of Employment, Skills and Education. However, my understanding is very few, if any, of those people with cancer actually have active mutual obligations requirements.
Very few, but you don't know.
Well, it's a matter for DESI, but I'm informed that it's very few.
Okay, well, I will ask the Department of Employment. Because, yes, you wouldn't expect people who are having to struggle with appointments with chemotherapy, juggling, to have to be applying for work as well, would you?
Well, the mutual obligations framework is not owned by this portfolio, so I don't think it's fair for me to comment.
Does the department have any figures of how many people have died of cancer whilst being on JobSeeker?
No, Senator, that would be a question, I think, for Services Australia. They may wish to take on notice.
And in terms of that, okay, so we had that 7,000, so they were, and I'm not, in terms of the people on JobSeeker who have got a temporary incapacity exemption to mutual obligations, how many of those have cancer as the reason for their exemption?
Again, I have to take more detailed questions about exemptions on notice, Senator.
Minister, you, in your answer before, when you said that there was sickness allowance, which is not paid anymore.
It's rolled into JobSeeker.
Yes,
It's
but
paid at the same rate, yes.
It's paid at the same rate. So that's right. So the system has changed so that for people, essentially for people who have got, serious illness, that means that they can't work, have got lots of extra costs, lots of extra stresses, we don't have a payment at the moment unless it is, and they are fully treated, fully diagnosed, fully stabilised, do we?
Well, in the sense of...
An appropriate treatment. They're basically on JobSeeker.
Well, Senator, the rolling of sickness allowance and a number of other payments when New Start became JobSeeker were a number of payments were rolled in that were paid at the same rate. And of course, in circumstances where somebody's medical condition prevents them from being able to undertake mutual obligations, but they are unable to meet the long-term requirements of being able to go into a DSP, then in almost all instances, as far as I'm aware, but obviously a matter you should ask employment, their mutual obligations would be waived. So, in effect, nothing has changed apart from the name.
Well, nothing has changed except for the level of payment that they get. Because...
No, that's not correct, Senator.
So sickness allowance was at the same rate as...
Correct,
Yes,
it was paid at the New Start rate.
So it was at the same below
Yes.
the poverty line rate,
Senator,
essentially.
it was paid at the same rate as New Start. When it became JobSeeker, the payments were all paid at the same
But
rate.
Minister, when we ask questions about how the JobSeeker payment is totally inadequate, that leaves people living in poverty, the answers we get back is that, it's not designed, people aren't designed to be on it permanently, we've got to encourage them to get off it, the best form of welfare is a job. But that's not the case for these people. Even if you accept that frame, which I completely reject, these people who are suffering with cancer, they're not able to, just go off and get a job. And so your government is essentially leaving them living in abject poverty. Do you accept that? No. I mean, do you accept that that's an appropriate thing for a rich country like Australia to be doing?
Well, certainly. When people in Australia find themselves with with serious medical conditions. Then, of course, our medical framework that is a universal healthcare model, obviously is there to support people with illness. When people's illnesses are long-term, such that they meet the requirements of the disability impairment tables, then of course they have the opportunity. Will be moved
But
to
Minister,
that. Senator, are you going to let me finish?
Well, no, because you were talking, Minister, because you were talking about the very situation that this is a gaping hole in the policy framework where people do not meet the criteria that's set out under the DSP. These people haven't got a condition which is fully treated, stabilised and diagnosed. They've only got a 50% chance of dying of brain cancer. No, what are we going to do about these people?
Well, Senator, I sort of...
Are you going to leave them languishing in poverty?
I reject the premise of what you're saying. The social security system, in conjunction with the healthcare system in Australia, is designed to support Australians through difficult situations, and of course is there in when people find themselves permanently in need of support. So I reject your premise of what you're saying.
It's not there, it's heartless. It's absolutely heartless. Thanks, Chair.
Thank you very much, Senator Rice. Senator Green.
Thank you. I've just got a couple more questions that I'm making sure that I'm not missing out on any corporate officials with these, but then Chair will probably be in a position to move to outcome 1 shortly. I was just indicating, I'm just trying to make sure that any questions that involving corporate officials I tick off, but then we'll be in a position to move to outcome 1.
Great, thank you.
If that's helpful for other senators, I think. Yep. I've got some questions about a contract that the NDIA entered into with Serco to deliver the NDIA Contract Centre. Are there people who can...
Senator, NDIA is coming on later, and I know Mr Hoffman is ready to talk to that issue.
Sure. The department officials responsible for that contract
NDIA.
as well? But the department, the people that would also have coverage of it?
From our outcome 3 officials will be here as well. Yeah.
Sure. Okay. Well then, if that's the case, Chair, we might move straight to outcome 1, and I've got questions on that.
My apologies again, Senator Green. I didn't hear what you said. Sorry. It won't happen again, I promise.
That's fine.
Probably will.
I've got questions on outcome 1.
Great. Okay. Well, if there are no more questions for whole of portfolio on corporate matters, we'll bring that to a close, and we'll now move to outcome 1. I did give Senator Rice some latitude, but I understand Senator Rice has to attend another committee.
Yes, in 15 minutes.
So we're now dealing with outcome 1 matters.
Mm-hmm. Great. Thank you very much. My first questions are in regards to the working age payments. I'm keen to understand what level of responsibility does DSS have to ensure appropriate levels of funding to Centrelink for payments to recipients made under the social security legislation? What's the role and responsibility that the department has?
Sorry, Senator, can I just clarify, this is payments made to people or the funding of Centrelink?
Well, you would need to have some sort of understanding of the level of payments required under the working age payments. So where do you sit in
recipients?
The process?
Yes. Well,
yeah.
Under the Social Security Act, the Secretary of the Department is generally the nominated official, so his or her powers are then delegated to Centrelink, Service Australia, to implement and ensure that payments are made in accordance with the Social Security Act provisions, including for working age payments.
Yep. But in terms of the funding, it goes from the department to Services Australia?
Well, funding for working age payments is made under a standing or special appropriation, the Social Security Act 1991, but also in respect of other payments such as family assistance, etc.
Okay. what visibility does DSS have about the levels of funding for each different type of payment for recipients?
If you're talking in aggregate, then there's constant information being provided about amounts being spent, and obviously we produce estimates for those payments for the purposes of budget and the mid-year update.
And they come, the estimates or the modelling comes from Treasury but are provided to the department, is that right?
I'm not quite sure what you mean by estimates of modelling.
An estimate about how much funding will be needed.
So if you take a payment like age pension, for instance, which is indexed by, well, in fact that's a trickier one because it's indexed by the higher of three possible factors, but those parameters come from Treasury or the Department of Finance. They're then run through models which the department has to give estimates of each payment that the Secretary is responsible for, and those numbers are then included in the budget.
Yep. And then once the payments are made, there would be a reconciliation at the end of that.
Yeah, I mean, reconciliation, maybe it's important to remember these are demand-driven programs. So if, in fact, there's more people who qualify for the age pension or for job seeker payment, those amounts are paid directly as a result of the special appropriation itself.
Mm-hmm. So in terms of the what appears in the budget, your department doesn't conduct the modelling but has visibility on the numbers in the forward estimates.
Well, we are responsible for constructing the estimates for those payments based on the parameters provided and any other assumptions that go in that underpin.
Okay. Just in terms, can you confirm for me what how the reconciliation works between actual funding and the estimates on the number of recipients estimated and the number of recipients that actually get a payment? I think you might have touched on that already, but...
So, yeah, could you just repeat that last bit about...
I'm interested to understand how... There's obviously a calculation of the number of recipients that will be estimated for each payment. And then at the end of that, there's a number of recipients who actually receive the payment. So what visibility does your department have on that?
Yeah, I mean, there's regular reporting of those numbers as they occur through the year.
Okay. And does the reconciliation, you said a regular reporting, but how regular is it? Every quarter, every week, every year?
It's tracked monthly.
Monthly.
Yeah.
Okay. Is the department projecting an adjustment between the estimated and the reconciliation? So the estimated funding and the reconciled funding, is the department projecting an adjustment this mid-year? Is it going to go up from what was estimated, or is it going to go down?
Well, I obviously can't comment on the way in which numbers might go up or down. Those are numbers that are aggregated and then published by the government in the mid-year economic and fiscal outlook.
But you said you get monthly reporting on it.
Sure, yeah.
So what, based on the monthly reporting, what are you expecting to happen in the mid-year?
Well,
Is it going
the
up
monthly
or is it going
reporting will
down?
inform the current year projected outcome. It will also obviously have base effects for the forward years as well. So that process will be published in MyFO.
Okay. But you don't have any sense of if the payments will be, are they going down from what was estimated?
I don't have anything to add to my previous answer, which is those numbers get aggregated and then published by the government in either the budget or the mid-year update.
In terms of the estimated projections of numbers of recipients of job seeker youth allowance for the budget and forward estimates, what are they for the next financial year and the financial years leading up to 24-25?
So the numbers of recipients themselves are not published. It's they inform our models which produce forward estimates of payments for job seeker, youth allowance and those other payments you've mentioned.
But you do have that figure.
It's given to us along with a range of other information that
That's
comes.
how you work out the amount. You need to know the number of recipients, right?
Well, it's a little bit more complicated than that, but it is an input into the construction of those estimates.
Okay, well, what is it?
Sorry, what's what?
What is the number?
Well, I just said it's not a number that the government has published previously, so I'm not...
Well,
I
I'm
don't-
not asking you to publish it on website. I'm asking you to give it to a Senate committee in a Senate estimates hearing.
I will take that on notice, Senator.
On what basis?
On the basis that I think I need to consult with the Minister about whether that information, having never not previously been released by the government, is appropriate.
On what basis? There's
No, it is available to the Minister to take a question on notice.
Yeah, and Senator, obviously...
to
this
possibly make
information-
a PII claim? I'm sorry,
So,
maybe I'm
Senator,
not following why, if you have the information, you're not able to give it to...
Senator, you're asking a very linear question that actually doesn't have a linear answer, and the information that you're asking for doesn't fall entirely within the domain of this agency. Treasury and Finance also have input into this, so if it would be possible, we're happy to take your request on notice and we'll come back to you. We're not making a PII claim, we're just asking to take it on notice to be able to get advice from other agencies that may well be impacted on the particular issue that you're asking about.
Okay, all right. How many years do the forward estimates projections extend
For, you mean in general or for these payments?
for the payments?
Yeah, so it's
Not
the
in general, like I'm obviously asking about payments.
Yeah, so 3 years of forward estimates.
Okay.
And then you review their updated purposes of planning for the next budget round every year, are they? So every year you pull in another year?
Budget, that's correct, budget and mid-year economic and fiscal outlook.
So in understanding those numbers, can we ask for the 3 years, each yearly estimate? That's what we're
So if
after.
you're asking about the recipient numbers, we've taken that on notice.
I know, and what I'm saying is, to be clear, what I'm asking for, of what you've taken on notice, is the 3 years of numbers.
The forward estimates, correct.
Yeah, that's why I've asked that. I just have some further questions about carers' payments and carer allowances. What triggers a review of an individual's carer payment or carer allowance?
Might see Mr Sloan might be able to assist with some of those questions, Senator.
Troy Sloan, Group Manager, Pensions, Housing and Homelessness. Senator, I think the main review point in the carers payment and a carers allowance is when a child turns 16. So that's a main review point for the carers allowance and carers payment.
Is that the only trigger for review?
Certainly, there can be times where if information is given to Services Australia that, there may be people are not providing the care that's necessary. There might be tip-offs and that Services Australia will look at that, but certainly both payments the pension and the carers allowance payment are ongoing apart from those, that point that I talked about in general.
Okay. How many times was a review triggered in the current financial year?
That I would have to take on notice and talk to Services Australia, Senator.
And for the period of the current financial year is what we're after. How many individuals lost their payment, either the carer payment or the carer allowance, because of the review?
Again, from total reviews, I would have to take that on notice, but certainly from the point of view of those being reviewed at age 16, I can certainly give you that number, Senator, if you bear with me. No, sorry, Senator, I haven't got that number. I have to take that on notice. I have got a different number. Apologies.
Okay. And can you provide a breakdown if people were moved across to another income payment, if they were taken off?
I can give you where, so it won't be for reviews, but I can give you the outflows from carer payment, if you wish, where they go to.
Okay.
That's a general thing. It's not obviously due to reviews. If you would like that, I can give you that, but it's up to you, Senator.
That would be helpful.
Yep.
Can you break it down in terms of reviews?
I'd have to take that on notice, but what I can tell you is between September 2020 to September 2021, the outflow from carer payment, 10,315, or just over 30%. The highest number was 16,108, or 47.6%, who went into flew into no income support, so they moved off income support. 30%, just over 10,300, moved into working age payment. A bit over 200, or just under 1%, went on to student payment. A bit over 7,000 went, or just over 21%, went on to pension. And there's a very small number who went on to other payments, and for a total of just under 34,000 people during that September 2020 to September 2021 who went off carers payment. But again, those on review, I would have to take that on notice, Senator.
Okay. Minister, does the department know the vaccine rates of carers across Australia by state and also nationally?
That wouldn't necessarily.
No, we don't have
we
data, Senator.
would have, in the case of carers, it's sort of like asking the question of how many people were on job seeker payment had been vaccinated. It would be the process of the information
Well, it's a
around
little
there.
different, isn't it? Because carers are on that payment because they provide a caring role. They're in. If a carer was to not be vaccinated, we know that there's the potential for them to get very sick if they contract COVID-19, but also the impact on the person that they care for.
Sure.
So I'm just wondering whether the department has sought to understand that information, asked state and territories to consider asking questions about whether someone is a carer when they're being vaccinated.
Yeah. Look, Senator, one of the things I would say that we do on a really regular basis is work with the peak carers body, Carers Australia, to understand particular needs, and during COVID that was very regular occurrence, and in relation to the previous topic that you were speaking to Mr. Sloan about around making sure that we have the most seamless transition when people turn 16 around, the reassessment on carers allowance and these sorts of things, things that we work very closely with Carers Australia about. So, we are, very cognisant particularly through the disability sector, to make sure that people who are caring for people with disability are vaccinated, as we are with the aged care sector and the care sector more generally. But this is a.
But you don't have visibility on the numbers.
Well, not visibility on the numbers across the entire. Like what we've sought to do through our vaccine rollout is to get everybody vaccinated, to make sure that every Australian has got access to the vaccine. Obviously, people have been categorised through the process. Obviously, that's not the case anymore. Every Australian has got access to the vaccines, but also making sure that through the networks that exist within Australia, that we understand the particular issues that sometimes come up with particular cohorts, to make sure that we're responding in the way that their sort of advocacy bodies, and in this case Carers Australia, believe is the most appropriate way. So we will continue to make sure that we work with those bodies. That's their purpose, and we absolutely acknowledge and thank them for the advocacy, support and support they give to their carers, but also the support they give to us in terms of policy development.
Okay. So you don't know how many carers are currently, well, what percentage of carers have had their second dose of vaccine?
Well, certainly, Senator, I mean, it would be a significant number of carers would be vaccinated on the basis of...
You don't know that,
but
so you can't really
Senator,
say that.
Senator, there are other mechanisms that by which we work with carers to make sure that we're addressing the specific issues that they face, and but you know, we are not going to spend all our time you know, getting bound up in red tape around trying to come up with a number. We're absolutely focused on getting the needles into people's arms to make sure that we protect Australians, the most vulnerable Australians particularly, and those that care for them.
It's not red tape to ask to try and find out how many people who are in vulnerable situations are vaccinated.
For the government...
It's just a regrettable comment, Minister.
what
additional...
Excuse me, Chair. If the Senator wishes to talk about and make a comment like that, I think I have the right to respond. I believe that the focus of this government has been absolutely around making sure that we get vulnerable people vaccinated, and in the process of doing so, making sure that the people that look after them are equally able to get access to the vaccine, and we did so early on. The most important thing is that every single Australian at the moment has access to a vaccine, and that we work with the appropriate organisations to make sure we understand how best to address the issue of protecting vulnerable Australians from COVID and making sure we protect the people that look after vulnerable Australians from COVID.
What additional support, if any, has been provided to carers during lockdowns?
Well, there are many different things that have been provided to Australians.
To carers?
To carers. There have been a number of payments that were made, additional payments that were made to carers, as they were to people on disability support pension. There were the two $500 payments that were made last year, and then two lots of the $250.
It's a little hard to hear you when you're speaking across the table, Minister.
Yeah, so there were a number of payments that were made to people who were on the carers pension as they were to the disability support pension. There were two $500 payments were made early on in the pandemic, and then there was another two by 750 and two by 250. A total of $2,000 was paid to carers to support them in their work during the pandemic. But in addition to that, we have established the Carers Gateway to provide services and support to people who are caring, so that we are able to provide them with up-to-date information and a single sort of point of information, so that they can get information about issues that relate to COVID and other issues for carers. And we certainly thank Carers Australia for the extraordinary amount of work that they and their subsidiary organisations in the states and territories have put into making sure that this gateway is absolutely fit for purpose for people who undertake caring roles.
Was the gateway a existing resource, or was it being developed before lockdowns?
The gateway was is a resource that has been developed over the last few years, okay. But because the resource was available, it gave us even though it is quite new, Senator, it did give us an immediate platform on which we were able to provide that advice to carers, and an interactive opportunity for carers to be able to ring in.
So it wasn't like it was there and it was utilised.
It was in the process of development, yes.
Developed in response to the lockdowns. When will is the gateway going to be evaluated at some stage? Since it's been up and running.
I'll try and get you an answer on that.
Okay, thanks. Just on the carer payment and carer allowance, just some probably more direct questions. Is autism and dementia included under the general category of psychological and psychiatric in the DSS payment demographic table for medical conditions of care recipients?
Would this be better in disability?
I'm sure you've got lots of charts there, Mr. Sloan.
Just looking at, I'm in the habit. I'll just check on that, Senator.
Thank you. those payments.
I'll have to take that on note, but certainly for the carer allowance, Senator, where
just got one.
for children the main condition is autism, and so on that one for carer allowance. So, yeah, so 60% of children on care allowances are due to autism, and that's bit over 110,000, Senator. For carer adult, it's again 20 autism spectrum disorder is 28,500, a bit over 5% of that population. As for dementia, I don't have that information on me at the moment, Senator, apologies, but certainly autism is listed there as a separate category, yes, and is available on data.gov.au.
As a separate category. That's for autism. What about, and dementia is a separate category as well?
As I said, I would have to take that one on notice. It's not listed in the top, I have with me the top 6. It's not listed in the top 6 categories.
Okay. If it's not listed in the top 6, what does that mean?
It just means it's not, if dementia is separately recorded by Services Australia, it's not, the numbers who are getting carers payment because of, carers allowance because of dementia isn't in the top, in respect of numbers of people claiming are not in the top 5 conditions that people are claiming it for.
How many people have applied for the carers payment and carer allowance who are members of, carers looking after family members with autism and dementia as a separate category in the last financial year, and how many people have been rejected?
So I can, for the 2021 financial year, for carer payment, I can tell you there was a bit over 80,000 claims. Nearly 48,000 were granted, and just under 33,000 were rejected, for a grant rate of just under 60%, 59.3. So,
That's a lot.
and so that's on carer payment.
So 40% of people who've applied for carers payment in the last financial year because they're taking care of someone with autism have had their
No, sorry,
application.
that's the overall number.
Oh, sorry, I thought
That's the overall number.
That's a very big number.
Yeah, and I'm just needing to check. I've got a number here, but I just want to check that it's. Yes, it would be. It would be the so a bit over, just under 20, up to September 2021. For autism, I believe just under 23,000 for carer payment were, what would you say, granted is the word I'm looking for.
Granted, but you don't have do you have the figure for how many applications were made?
No, I don't have that on me at the moment, Senator.
And how many were rejected?
Well, yeah, I
So
don't
you have
that.
the overall figures for that statistics, but not broken down by category?
Yeah, and sorry, I should make that clear, that was childcare. Sorry, it's for those children who are getting cared for, that number. While adults, I don't have a number for autism for adults.
So the 23,000 is for children with autism?
Yes.
There may be additional people in a separate cohort for adults?
Adult carers, yeah. Sorry, adults who are being cared for, Senator, yes.
Sorry, Senator, I know you were asking a very specific question about autism. I think Mr Sloan is giving figures for grant rates applications grant rates for the total number of carer allowance and carer payment
No, that's why I've asked him
applications.
to, yeah,
it's-
I am
if it's the
following
more-
along, Mr. Flavel.
Yep.
I'm just asking, that's why I'm asking which is the universal figure, which is the broken down figure.
Sorry, Senator, I'm going to
That's
have to correct the record. Apologies.
Thank you. No, it's fine. I know we're going all over the place, but I am interested in that cohort of
Yep.
people who are receiving the carer payment because they're caring for someone with
Yeah,
autism.
so that is a number. At September 2021, 22,898 children are being cared for by people on carers payment. So that's the actual stock. Sorry, it's not the flow. I haven't got the flow. I apologise for that. I
And this
misread my
might,
table.
I'm sorry for my ignorance. I don't know a lot about the payment system in regards to that condition, but when does someone stop being considered, when would the adult payment kick in? So when would
16. That was what we're
16.
talking about.
So
The
if
review
you're
point.
caring for a 16-year-old with autism, you would be in the adult, you wouldn't be in that group?
Correct.
Do you have the figure for how many people are caring for someone who is an adult with autism?
I don't believe I do. So are we talking carers payment or carers allowance? Sorry, Senator, because that last number was carer allowance. So are we talking carer payment or carer allowance?
Well, I'd like the figures for both, really.
Okay, so, yeah, I'll take that one on notice, Senator. I don't think
Okay.
I've got it with me.
Is that because it's a smaller a number, or you?
Certainly there's a reduction as you would expect, because
Okay.
as people become more mature, they can look after themselves as they age. So
Okay.
we expect that, and we do see
Sure.
that number come off, yes.
And the figure I am very interested in is how many people have applied in the last financial year, and then how many people have been
And we'll take that
rejected
on
from
notice.
those applications.
Yep.
Thanks, Chair.
Thank you, Senator Green. Senator Gallagher.
Mr Flavel, just going back to Senator Green's request around the forward projections for the numbers of recipients, I'd note that Senator Green did write to you, Mr Griggs, congratulations on the appointment, advising that we would be seeking this information, and also if coordination with the Department of Finance or others is required in order to get approval for that number. So did you understand or saw that letter?
Yes, we saw
Yeah.
that lawyer, and the consultation that we referred to earlier would be with Treasury and Finance and seeking to get their authority to release those figures.
But you didn't do it when you didn't, knowing that the committee was going to be interested in this and advising that we understood there would require further consultation with the central agencies. That didn't happen.
Well, Treasury was honoured estimates yesterday. It was actually quite hard, given the timeframe in which the letter was given to us, and with Treasury's appearance, to actually do that.
But did you
beforehand.
you did reach out to Treasury?
I will check with my staff as to whether that.
So you didn't personally, but you don't know. When did you get the letter? Sorry, it's not dated. Yesterday? When did you send the letter? No, okay.
I think it was the
It's a bit
day
late.
before yesterday.
Okay,
Tuesday, late in the afternoon.
Yeah.
okay. So we don't know if you did reach out or your area. You don't?
No, I said I will check that, whether anybody, any staff did.
Okay. But was there a discussion around what you would come prepared with and what you wouldn't? Obviously, you've got a view about forward projections being not available to be released, so you must have...
That's based on similar questions we got the last time we were here, Senator.
Okay. And so what were the reasons? Just that you've never published before, so that it's not going to be published now? Is that...
Well, it's more that what gets published in the budget is the projections, the forecasts and projections of total payments.
Yeah.
That's an accurate, the trend involved there gives a pretty accurate indication, if you want to call it that, of the direction that job seeker payment or any payment is heading in.
Yeah.
The numbers...
So you're saying extrapolate from that, basically, that you can extrapolate from that what the numbers are?
Not so much an extrapolation, that the government, or through Treasury, publishes forecasts and projections of the unemployment rate.
Yeah.
We'll update that in MyEFO. So that will give the best indication of the government's view based on Treasury's assessment of the economy about what's likely to happen to the unemployment rate over the budget and 3 forward years.
Yeah.
We take an input on unemployment benefit recipients, but there's a number of other factors that get taken into account across payments.
Okay.
So, for instance, in age pension, where you've got an assets test, movement in the value of assets is a relevant factor then to consider whether any age pensioners might fall off full rate onto part rate or off part rate altogether. So it's not as simple as saying you take the number of unemployment benefit recipients and somehow that's the figure to focus on. I think it's far more instructive to look at the total forward estimates in dollar terms for job seeker payment or any payment, combined with the global forecasts included by Treasury in their budget papers, which, as I said, in my IFO will include an updated forecast and projection for the unemployment rate.
Okay. So, I can understand with the age pension and the example you give. What about just straight job seeker or youth allowance other? What are the other factors that would influence people on that payment?
It's not so much the influences, it's when the payment dollars are constructed will include things like indexation. So for job seeker payment, CPI, most payment, in fact all payments have some form of asset test attached to them. And so things like the value of assets and general factors like that would also be taken into account.
Okay, so it seems to, this is why I'm trying to understand why you would not be prepared to give that information, or why the government is reluctant to give recipient numbers. If you're saying you can essentially read what's going to happen with the payment type based on the funding that's allocated across the forward estimates, you can sort of pick up what's happening. Obviously, if you had big fluctuations in the out years on against each payment, you would see that you were expecting something different to be happening. But if they're relatively stable with indexation going across the forward estimates, what would be the problem with providing that information? I'm genuinely trying to understand why, given the amount of reporting you do, so the funding allocated, we know what the value of the payment is each week, and we know that there are different tests like asset tests and things that would come into that, why it would be information that you would protect.
Well, it's more that it's an input to the construction of budget estimates. So the issue, of course, is taking something out of context. Because there's a whole range of inputs that are used across the full gamut of payments, and I think releasing it without the appropriate context, including other factors that are taken into consideration when establishing those estimates, does run the risk of being misleading.
Okay. I'm not sure I understand the logic. Like, you do report, and to the COVID committee, and for example, you're reporting every fortnight the number of people receiving certain payments now. So we can see the number of people in the payments plus the funding that's allocated in the budget year. So it's not a secret when we're or it's not information that's withheld when we're in the current financial year, but your argument is that it then can be misconstrued in the out years.
Well, in that particular example, I think there's a difference between actuals, which represent the total number of people who have been paid a payment in that fortnight. That's that's an absolute factor. Once you step beyond that and you're talking about forecasts and projections, they're just one factor that is taken into account when...
But it's a major factor, wouldn't it? The recipient numbers.
It's a major factor, of course.
And it is... I sort of understand... Well, I'm not sure I agree with you. I mean, the budget is a set of numbers that are actual, or you're reporting actuals, but you've got if current financial year and then a series of forecasts and estimates for the out years. I understand that for across all departments and all agencies and all programs. But, I mean, this is people receiving income support, the numbers of people receiving various payments. I just, maybe I'm missing the bit that becomes really difficult to to be upfront about, but I don't know, Minister, like why wouldn't you tell us what the government is expecting in terms of the number of unemployed people to be receiving JobSeeker next year? I just don't know why it would be.
Yeah, as I responded to the previous question, I mean, not all of this information, resides.
Yeah, fair enough.
this.
No,
And
no,
I was
I'll
more-
cop that. I'm just trying to understand why it would be so. Mr. Flavel said it's been asked before and not released. So I presume when you go back and have your consultations, the answer will be, I'm not a fortune teller, but the answer might be no, we're not going to release that information. So it's not like the first time it's been asked for and it hasn't been provided. So I'm just trying to preempt.
Yeah, I'll get back to you.
The other thing that's
It's weird.
odd, Mr. Flavel, is that often we ask for data from various departments and we receive that information, but there is context provided. And if the concern is that the context is needed to understand the document, the numbers, that's not a reason not to provide the information. It's a reason to provide the information in a table, perhaps in data, and then make sure that the answer to the question on notice has the question that we're asking today has the context attached to it. But that's not a reason, that's not an appropriate reason to not provide information. Is there another?
Senator, I haven't said we're not going to provide the information. What I've said is that I've taken
No,
it on notice.
Mr. Flavel said one of the reasons for not publishing it or providing it is that there is context to that information, but we get that information.
It's not
all
our
the time.
information. I mean, the basis of a lot of this information resides in Treasury.
The basis, but you do have the information.
And clearly, I have taken on notice that I will speak with Treasury and come back to you with a response. And at that time, perhaps that's the point in time where you prosecute these alternative arguments if they are necessary.
Well, we asked for it at the last estimates. We wrote before this estimates again, and the conversations still haven't happened.
So review. You'll have another look at it for us, Minister Ruston. Yep.
Right.
You go. Yeah.
Yes. Just wanted to get an update, Minister, on the changes to paid parental leave in regards to the work test. I know there was some recent changes, and the changes, as I understand it, exempt someone from the work test if they're escaping family violence. Where is that up to in terms of implementation? I think the legislation was introduced in May.
Yes, and that was passed in.
Yes, so the rules were actually registered yesterday. So
Oh,
the rules that
right.
support that, yeah.
Hence my questions. Right, okay. So the rules,
Are the rules available?
I assume so, yes, if they've been
So they were
registered.
approved yesterday.
No, not approved, registered yesterday.
Oh,
So the
registered.
legislation passed, I think, on the 4th of September, and the rules that support that new piece of the amendment to the PPL legislation were registered yesterday.
registered.
They're effective, it's a retrospective.
Yeah.
So back to the
Okay.
4th of September.
But they are available publicly, you reckon? Okay.
You're jumping ahead of me, Mr. Griggs. Well, the question was, so now that the rules have been made, does that mean that that exemption can be accessed and it can be accessed retrospectively?
Back to the 4th of September.
Back to the
4th of September?
this year?
Yes.
Right, so doesn't it go back any further than that?
Well, it went back because the changes related to enabling the COVID disaster payment to qualify for the work test. It went back to prior to the COVID disaster payment being available.
But the exemption isn't tied to COVID-19 going forward. It's just an exemption that will exist for the payment aside from COVID-19.
Could you maybe explain to me what you're actually asking here?
Well, just in general, if someone is suffering from family and
you
domestic
said family and
violence.
domestic violence, sorry.
No.
Yeah.
The exemption for family and domestic violence is in place now. it's not reliant on COVID payments or anything like that. It'll be there now. But it only goes back to September.
That was the date the legislation was passed.
Right, so that means that if you were receiving PPL in September, you can apply for a work test. What about
But this
anyone
is, Senator,
before that?
I think that's the point, is you're being exempt from an income test, from a work test, for qualification for PPL. So if you're already receiving PPL, by definition, you've already met a work test.
Oh, right, okay. So it won't apply for anyone. So you essentially, you have to apply for paid parental leave from the 4th of September, and if that exemption, for that exemption to then be available to you.
Correct. So the ordinary work test is for somebody to have worked for 10 out of the previous 13 months prior to the birth of their child. And I think the Minister was referring to before, there's been additional flexibility in relation to that, both last year with the concessional work test and also more recently with the crediting anybody who was on the COVID disaster payment as being qualifying for work for that period. But in relation to these special circumstances, these will apply from the 4th of September for people applying. And of course, if they're granted, then by definition, they will have been taken to have met the work test.
And there's other special circumstances, aren't there? What are those?
Natural disaster, severe medical condition are the two.
So, not to labour the point, but so if someone didn't meet the work test because of a natural disaster before September, it's only anything that happens after September that would be trapped by this exemption.
Correct.
Like if you failed the work test because of the bushfires over the last summer, that's not going to count.
No, it wouldn't, because it's always there's no retrospective application of the law. That's right.
Yeah, okay. Minister, the Labor MP Jason Clare raised this matter in Parliament in 2018 actually, and several times because of a constituent of his that was facing, who was denied PPL based on the fact that she didn't meet the work test, and she was a victim of family violence. And then in February, I think Mr. Clare wrote to you about it again because you were the new minister, highlighting the flaws in the legislation. Why did it take so long for the government to establish an exemption for women who are fleeing family and domestic violence?
Senator, obviously, as a government, we have worked on a number of fronts to make sure that we support women who are fleeing family and domestic violence. Clearly this was one of the anomalies in the system. Last year we worked particularly hard to make sure that women who were impacted by COVID-19 and were unable to meet the work test because of changes to their work circumstances were not denied the ability to be able to get access to paid parental leave because of that by changing the work test. And obviously, subsequently, we've made these additional changes at the same time as we made changes in relation to the provisions around lockdowns to make sure that women who were in lockdown areas and were unable to meet the work test because they were technically not employed to enable them to be able to use the COVID disaster payment to count towards it. And, we will continue to work, to make sure that we are, continuous improvement in these and many other areas of social policy, and pleased to be able to have made this change.
But it's pretty late for those women who didn't have access to PPL, or those parents, sorry.
As I said, Senator, the last 18 months to 2 years have been an extraordinary time, and we have, continued to work and listen to people, particularly expectant families, around the things that are important, including, improving flexibility measures within superannuation, as well as to address the particular issues that have faced women through natural disasters like bushfires, through the, the challenges of COVID, and we'll continue to do so.
Chair, I think I might get cut off by the break. Is that right?
I know you've got one minute.
But I don't have any other questions on that topic.
Thank you very much. Well, it being at almost the break time, we will break and return at 11:15, and we are still in outcome 1. Thank you very much. Hearing, and I'll turn to Senator Rice.
Thank you. And look, I think I've been kept up to date with what was covered off when I wasn't in the room, so hopefully I'm not going over stuff. You will, that's right. So look, I actually, first of all, I wanted to start off with the letter that I wrote requesting data, which I'm just wondering whether that data can be provided.
Certainly. I'll just find the letter.
Maybe I could move on and you could...
No, I'm just trying to find the right letter, Senator. Can you just refresh me with... Was that the child support?
It was a whole range of issues.
Yeah.
Yes.
About the estimates letter?
Yes, the estimates letter was requesting a range of data about a range of different programs. Maybe you could, look. Let's move on.
Yeah, no.
Flag if I could get the answers to those questions.
Yes,
That would be very helpful. Thank you.
We have been working on that.
Okay, so what I want to start with is about the removal of disaster payments, which, given as we've got to the 80 and 90% vaccination, those disaster payments are being removed. But while New South Wales and Victoria were still declared hotspots, how many people were receiving disaster payments?
Yeah, so Senator, they're actually questions that are best handled when Service Australia arrive this afternoon.
So could you just repeat the question, Senator Rice?
It's about the COVID disaster payments when New South... in fact, I don't know, has the hotspot designation officially been removed now?
Well, it's more that under those arrangements, as I understand, they're now moving to the sort of the phased approach once they've got beyond the 70 and 80%. But sorry, the Senator, those payments are actually the policy responsibility of Minister McKenzie and the National Resilience and Recovery Agency. So we don't hold policy responsibility, but Services Australia is administering those payments. And so for questions about how many, what locations, it's best for you to ask Services Australia this afternoon when they're here.
Okay, all right. The intersection is then whether there are any figures on how many people who were receiving the disaster payments, now not getting them, and now applying for JobSeeker.
Senator, I might take that on notice simply because in New South Wales, many people are still receiving the step-down rate of CDP, COVID disaster payment, and so we've actually not seen increases to the sort of the trend rates of people coming on to JobSeeker.
And we wouldn't necessarily capture the data that would say somebody had been on a CDP payment prior. You may.
Well, I'm interested to know, would you capture that data? I mean, one of the issues I've discovered about this whole area is just what data is and isn't being captured that's useful and valuable.
If somebody used the period, if they were unable to return to their place of work, because I mean obviously that's what the CDP was about, was maintaining connection to their workplace by providing them directly with that payment. If they were transitioning and they were reporting like this week's CDP payment as their income, because you obviously have to report earnings when you are on payment, then that... But we don't ask people where they earned their money. We only ask them what their earnings are. So they could... I mean, you could get an estimation, I suppose, if it was an exact amount that they were reporting as earnings. But when people apply for payment, we only ask them for earnings. We don't ask them where they got those earnings
So
from.
is there going to be a way of tracking that then, to know how many people that were on those disaster payments end up not then returning to work and end up applying for job seeker?
Yeah, it again is a question best for Services Australia as the administrator, and it's simply because it's not our policy responsibility. Therefore, we as a department don't own the data in relation to COVID disaster payment. We do for job seeker, but in terms of how many might transition, I think it's best to ask Services Australia that this afternoon.
Okay, can you tell me what data you've got about income support recipients who've got a partial capacity to work?
Yeah.
How is that broken down? Or what's the granular detail that you can provide me about people with that partial capacity to work?
Well, I've got some data, but do you have particular questions?
Well, the request has been made in the different medical capacity, so different categories of what type of illness they've got.
Would you like me to? Because I've got a list.
Okay, well maybe you could table it then. So, I mean, the question that I've got is, in the following categories, psychological, psychiatric, musculoskeletal, connective tissue, circulatory, endocrine, nervous system, intellectual, respiratory system, cancer or tumour, and sense or organs.
Yeah.
Sense organs.
Yeah, I have figures. So I provided those at the last hearings.
Right.
I have figures. They're part of something else. I'm not in a position to table it right now, but happy to arrange to get you that information.
Okay, yes. So that's, following the data provided in March. Okay. So you can get me that information. And can you actually, is that information available over the last 5 years as well to see the changes?
That would be a different data. So I've got the data as at the 24th of September 2021, but it would be I'd have to take on notice and actually get a data run done to produce that over a 5-year period if you're happy to nominate the data points or the dates upon which you're seeking it.
Well, if you've got a particular point that's easy to provide that data for at various times in each year, I'm happy to go with, the data that you've got, as long as it does give us that time series over that 5 years.
Just needs to be at a point in time, so we just need to choose a date within each of those 5 years.
Well, if it's the date that what was the date that the information's... Having us taken on this portfolio, I'm catching up on some of these things.
That's okay.
So the information that was provided in March, what was the date that was at?
So that was, I'm not quite sure, but what I've just indicated is I have data for the 24th of September 2021 as being the most up-to-date picture of the breakdown of those medical categories.
Okay, well, why don't we go for that September date then for the last 5 years? Thank you. And was the March data also, did that give the breakdown of people according to payment type, Indigenous status, gender, cold status, age, etc., the demographics?
You didn't, but I'm happy to take that on notice if you're after that information.
Yes, please. And the housing status. What data have you got about housing status?
Somebody might correct me, but I'm not sure we have housing status for that subcategory of job seeker recipients.
Okay. You mean like as whether they're renting or...
Whether, homeowners paying a mortgage in government housing, renting.
We may well have, I just haven't seen that data.
Whether
some of the other categories you've mentioned we collect and have been asked for previously. I'm just not sure the housing indicator one. It may well be that we have it. Just need to go away and check that.
Okay. And what information have you got about the vulnerability indicators of income support recipients with partial capacity to work?
That might be something we need to liaise with our colleagues at Services Australia on in terms of specific indicators that might be attached to somebody's record.
Okay, look, I've got quite a lot of detail about the various categories. So look, I will put those categories in rather than going through our time now. And if you could endeavour to get the data to us, that would be very useful for people. Okay, I then want to go to people who are about single parents, so in particular single women and single mothers who are accepting. All right, I'm trying to understand the complexity of this. Basically, where people are getting maintenance from the father of the child, and the father and child aren't lodging their tax return. So they put in provisional income, and then when they lodge their tax return, suddenly they've, shown that they've earned a lot more money, and so then the mother gets a family tax debt. So this, which is, they are then, the presumption is that they're going to get that money back from the father, but that often doesn't happen. So what I'm interested is the number of social security claimants who have a family payment debt due to the maintenance income test.
I'm not sure we've got debt. So I'm not sure we've got debt indicators. So
Did you well explain the process that this applies to? Because I think it's a suggestion.
yeah. So Senator, maybe just for clarity, as you I think would know, under the child support arrangement, about half of parents use what's known as agency collect. So that's where Services Australia, having determined the formula, acts as the collection agent between the two parents. Roughly 50% of the remaining, 50% use what's known as private collect arrangements. In other words, there's an assessment done, but the payment arrangements are made from first parent to the second parent. And in those cases, I think what you're referring to is that for family tax benefit purposes, the maintenance test assumes that the person has received the full complement, and then in some circumstances where there's an adjustment to the person's income, they might have more. That's a pretty. We'd have to go away and look at what data we have in terms of the debts. I would note though that there are provisions in the law to allow people to be exempt from the maintenance action test. So for instance, where there are indicators of family and domestic violence, they can apply and actually be exempted, in which case effectively they would get the full rate of family tax benefit payment.
Okay, well, if you could, yes, take on notice what information you've got about those debts, and in fact what that's looked like over the last 5 years as well, whether that's an increasing issue. So can you tell me about, and again, so the debt recovery, is that a question to ask Services Australia, or can you talk through me, so what are the processes of debt recovery that are employed by Services Australia when women are then faced with these debts?
Yeah, I think that's a question best asked, because it's really about the administrative arrangements that Services Australia applies.
Okay. I will ask them later on today. Have you got data on children how many children have a parent receiving a working age payment by individual payments?
We will have that, but it's quite a bit of data, because I think you're asking for all working age payments.
Yes, by individual payments.
Yeah, I think it's best, Senator, to take that on notice. It's quite detailed request.
If you could take that on notice. And I think you, the carers' payments, I think it was covered off by Labor before morning tea. So I'll presume that the questions I had have been covered off. So that's me for outcome one.
That's fantastic.
There you go.
Great. Thank you very much. I take back everything I
What was
said.
that?
No, just to confirm, Senator Green, are there any other questions?
People in
outcome one?
DSP,
Okay, we can start with
Slowly
others, yeah.
integrate.
That concludes outcome one. So we'll move now to outcome two, families and communities, and Senator Waters, Senator O'Sullivan and Senator Rice and Labor senators have indicated they'll have questions. So I might start with Senator O'Sullivan, if you're ready. And can I just check to see whether Senator Waters is on the line? Not just yet. We'll send a message to Senator.
Can I see if there's an answer to that question I asked this morning?
Sorry?
I asked a question this morning and they were going to come back with a number.
Yes, that's right, which
Yeah.
they still might do. That's right. Shall we
Just-
inquire at
And just while
1 p.m.?
Senator Sullivan gets ready.
Okay.
It's okay, I can ask it in 15 minutes.
Great. Okay, Senator Sullivan.
Thank you very much, Chair. My question is going to be about the cashless debit card. I think, Ms Heffron-Webb, you can probably answer these questions. Can you please explain the type of company that Inju is and what their role is in relation to the cashless debit card?
Yes, Senator. So Inju is a approved deposit-taking institution, so essentially a financial institution. So their role is to provide participants in the cashless debit card with access to banking services, essentially. So provision of a card, provision of online support for that card, telephone support, and in some locations they subcontract local organisations to provide face-to-face advice as well. So they effectively operate similar to a financial institution for the purposes of the cashless debit card.
So other banks like Commonwealth Bank, Westpac, ANZ, you know, to just name a few of them, they're also authorised deposit-taking institutions?
That's correct, yes.
And so Inju is just acting in the same way
Yes,
that they are?
that's right.
Has the Australian government ever been an authorised deposit-taking institution?
Not since the sale of the Commonwealth Bank, I think
Right,
is the answer
okay.
to that.
Right.
So no, we're certainly not now. I just was reminded by one of my staff
And that was decades
the other day in
ago.
another conversation that
yeah.
we used to own, the Commonwealth used to own the Commonwealth Bank. So, but
Yeah.
I can't recall when that was sold.
It was, yeah, neither can I, but I think it was decades ago. How long has the government had contracts with Inju for, and what were they for?
So the government has had contracts with Inju, to my knowledge, since about 2008.
Okay.
So Inju is the provider of the Basics card.
Yep.
So they have been contracted. Services Australia actually has the contract agreement for the Basics card,
Okay.
and this department holds the contract for the cashless debit card, but Inju provide both cards.
So okay, so the relationship with Inju, a contract with Inju, predates the cashless debit card because the Basics card is also provided by Inju.
Correct. So when the Basics card commenced, there was an approach to market undertaken at the time to determine who would be able to provide a card service.
Yep.
And Inju were successful in that procurement process.
Okay. Does Inju, as a authorised deposit-taking institution, in the same way that Commonwealth Bank or ANZ or these others are, do they have any say over what merchants or products are blocked?
No, those are decisions of the department operating under the framework of the legislation.
Right, and so it's the department that make the decision. You would then instruct Inju to put into their settings in their systems to enable or disable particular payment and transactions
Correct.
to go through.
Correct.
Okay. So how are those decisions made by the department?
So obviously there's some prima facie decisions where a merchant is selling predominantly goods that are excluded under the cashless debit card, so bottle shops, etc. The question of mixed merchants is one where we kind of examine closely the types of products that they're selling, a pattern of transactions. So we might make a decision about blocking access to a merchant if there's a pattern of unusual transactions that arises with that merchant, and discussions with that merchant haven't enabled us to satisfactorily determine that they are putting in place the proper measures to not sell restricted items.
Okay.
So it's a bit of a kind of case by case.
So if someone wants to make a purchase at a blocked merchant and they're prevented from doing so because they're blocked by the system, who do they contact and what's the process? Do they contact Inju for that?
They can contact Service Australia on the call
Right, so they
call
wouldn't contact Indu for that.
No.
They'd contact Services Australia.
Yeah,
Okay,
and they
thank
can be
you.
assisted.
So it's not Indu that are making the decision as to whether or not a transaction can be allowed.
No.
Okay, thank you. Is the cost of we're seeing reports, many online, peddled through Facebook and other mediums, saying that the cost of the CDC per participant is about $5,200 per participant. Is this correct? And if it's not, can you clarify for us what the cost per participant is?
Thank you. So obviously the cost per participant varies around according to how many participants we have, and at the moment we're in a transition phase and we're getting new participants in the Northern Territory.
Right.
But the cost per participant is approximately $1,100.
$1,100. So there was some initial sunk costs, I suppose, and is that how they're coming up with this $5,200?
I'm not 100% sure.
You
how
can't
they're
be sure
coming
where
up.
they've developed.
Is that
Okay.
data
Is
available?
it,
The analysis of what the costs are, otherwise because with these disputed figures.
So we
Sorry,
can
Peter.
certainly provide on notice more information about the costs
This morning.
as I think we've talked before, there are some sunk costs. So there's some costs that we have to incur regardless of whether we have one participant or 20 participants in a location, and then we have additional costs per participant. But we can provide some more detail about that on notice. Thank you. That would be helpful, Senator
thank
Rice.
you. Is it correct that last year the government introduced legislation into this parliament that would have given the minister the power to put all age pensioners onto the CDC?
No,
That's incorrect.
that's incorrect.
Okay. Also, we're seeing this online. People saying that that the minister has the power. So, Minister, you don't have the power to be able to do that?
No, and just for the record, because there has been a huge amount of misinformation around this card. Last year, when that legislation was actually before the Parliament, I believe it was Senator Patrick and possibly Senator Lambie was also a signatory to an amendment that was put forward that actually explicitly required that the Commonwealth could not force an aged pensioner onto the cashless debit card. And if you recall, Senator, you and I sat on the side of the chamber in support of that amendment, which actually explicitly required in legislation.
I do recall it.
To do it. And the Labor Party actually sat on the other side along with the Greens and actually voted against it. So I suppose I find it horribly disingenuous that, the Labor Party would be out there scaring pensioners, which is basically what they're doing. They're out there and running a scare campaign that is terrifying aged pensioners, that is absolutely based on a lie. They know it's based on a lie. And I find it, look, I think it is absolutely disgusting that this kind of stuff is going on. As a government, we'll always defend our policies, but it's pretty difficult to defend a policy against people who are just lying.
So there was an opportunity for Labor to actually side with the government in categorically ruling out the opportunity for you as Minister to apply, to put people on the age pension onto the cashless debit card, and Labor, for the record, voted against that.
That's correct.
But
you
can I ask?
But you voted
Still got a
against
call.
that
It's
amendment.
the whole thing.
You voted
My
against that
understanding-
amendment.
Particular amendment.
It's the whole thing.
Particular amendment.
Thank you.
It's the whole thing.
I think the chair still is giving me the call.
The other thing
my-
Is it in
Yeah.
government?
Senator O'Sullivan,
And we
I
won't
think
put
there's also another thing that I'd really like to put on the record today. The bill that we're referring to sought to continue the cashless debit card operation in the 4 sites around Australia that the communities had actually asked for this card. The Kimberley region, the Goldfields region, Ceduna in the west coast of South Australia, and in the Bundaberg area in Wide Bay. And so that was one provision, and the second provision was seeking for people who are currently on the Basics card to be able to transition across to the CDC. And I could speak for the next 3/4 of an hour about the difference between the Basics card and the CDC. The bill did not go to the substance of income management or no income management. And what we have seen subsequently is a conflation. What I would be really keen to understand is what is the official position of the opposition in relation to
That's a matter
for CDC, because we've seen a private members bill be introduced into the lower house this week. A private members bill. I'd be keen to understand what the Shadow Minister for Social Services, who has responsibility and carriage for this particular policy in the opposition, why is it that Shadow Minister Burney hasn't said anything? So I'm really interested around what the actual argument, what we're talking about here. It just seems to be there's a whole heap of issues that are being conflated. There's lies, there's misinformation, that is all adding to a completely dishonest and disingenuous presentation to the Australian public, which seems to be nothing more than political scaremongering. And the victims of this are older Australians.
Chair, just a couple more questions, if I may. Just back to the aged pensioners. So under the legislation, what circumstances are there for, can an aged pensioner be put onto the cashless debit card?
Currently, the only circumstances under which an aged pensioner could be required to go onto the cashless debit card is one of two ways, and I'll get Ms Heffron Webb to clarify this. One is if they voluntarily request to do so.
Okay.
And currently we have over 700 Australians who are on the age pension who have actually requested to go on the card. And in the transition in Cape York, where we offered the opportunity to people in the Cape York or on the basics card to go onto the cashless debit card, I'm pleased to say every single one of them has chosen to move across. And also we now have more people in Cape York who are voluntarily on the card than those that have been required through the Families Responsibilities Commission to go on there. And the only other circumstance in which a person can be required to go onto the card, age pensioner, is under the states and territories vulnerability sort of provisions, which say somebody who, for instance, may be under a child protection order and the like. So the federal government, in and of itself, has no power whatsoever to force any age pensioner onto the cashless debit card. Full stop. They are the only two circumstances under which this can happen.
Thank you. Just to the department, has the government ever considered requiring aged pensioners to be placed on the cashless debit card?
We, for the department's perspective, we've provided no advice to my knowledge.
You've never been asked for advice on whether...
Not while I've been in this role, no.
Okay, thank you. And Minister...
Can I just qualify? Yep. When I said 700 people have voluntarily gone onto the cashless debit card, they're not age pensioners, necessarily all age pensioners. Some will be age pensioners, but 700 Australians have voluntarily gone on the cashless debit card. So I just wanted to make sure.
Okay, thanks for that clarification. And so Minister, to you with regards to age pensioners, in the similar vein, is there any consideration given even into the future for age pensioners to be put onto the cashless debit card?
I can categorically say there never has, there isn't, and there never will be under this government any intention at all to require age pensioners to go onto the cashless debit card. I can repeat that all day if you'd like me to.
Thank you. Thank you, Chair.
Thank you very much, Senator O'Sullivan. I'm just going to turn to Senator McCarthy now. Yes, Senator McCarthy.
Thank you very much, Chair. Thank you. Could I just go to the product level blocking and multiple issuers? How many CDC product level blocking sites are currently in operation?
I'd like to see see if one of my colleagues could come to the table and answer specifically for you.
Actually, while we're waiting for them to come to the table, Ms Heffron Webb, I might just check with the Minister on her previous response of 700 Australians who've gone on, I think you mentioned, to the Senator. Can I just ask how many aged pensioners are on the basics card?
Patrick Bonham, branch manager, Cashless Welfare Policy and Technology branch. In relation to product...
Sorry, I missed...
Pardon?
Sorry, I missed your name.
Patrick Bonham. So in relation to product level blocking, there's two types of merchants who are involved in that. The first is the larger corporates. So that includes Woolworths, Australia Post, Coles, and a number of other corporates. They have their own product level blocking software, and that's available in around 5,800 stores at the moment. In relation to smaller merchants, we currently have around 31.
And so when I was actually going to ask how many merchants does product level blocking work at? So that's 5,800?
5,800, so that includes 3,000 from Australia Post, 180 for Big W, 800 Coles, 550 Euro garages, 200 Kmart, 280 Target, and 1,000 Woolworths, and Aldi has 8 stores as well.
Senator, I might just note that product level blocking only comes into play when we're talking about a mixed merchant that sells both restricted and unrestricted items. So the vast majority of merchants in Australia don't sell restricted items. So the cashless debit card is able to be utilised at over 1 million EFTPOS machines, and so all stores like clothing stores, food stores that don't sell alcohol, which is the vast majority, etc., it already works there. So the product level blocking really only comes into play in mixed merchant cases, and the figure that Mr Bonham's given relates to how many mixed merchants. So I just wanted to be clear, that doesn't mean that it's not used at a whole lot of other stores.
Okay, so the big supermarkets then are Woolies, Coles, Aldi?
Yeah, Aldi has 8 at the moment, and that's mainly in the CDC sites. They would be looking to roll it out to much broader. So like Coles and Woolworths do that as much more national approach later.
So where are they with Coles and Woolies now?
That would be...
space?
My understanding is that all Coles and Woolworths would have the capacity to run product level blocking.
Now, or is there a particular time frame?
My understanding is now.
So that's across Australia?
Yes. Yep. If that's
All Coles and
not
Woolies.
correct,
And is that the same?
if that's not correct, I'll let you know.
Senator, the Coles and Woolworths essentially run their own EFTPOS technology, so they don't procure it separately. So because of that, they've been able to make the relevant upgrades themselves to their EFTPOS machines to enforce product level blocking.
Okay, and you said with Australia Post there's 3,000?
Yes.
And how many Australia Post offices are there? Would you be expecting more?
Excuse me, Senator, you broke up a little bit there.
Would you be expecting more Australia Post officers to take it on board?
Once again, I'll have to check. 3,000 is quite a large number, so there could potentially be all of them already.
And are we talking about remote community Australia Post services?
I would have to confirm that as well. But I would assume at 3,000.
Could you please
Yep, we can confirm that.
Could you please identify the locations, in particular here in the Northern Territory, but in our remote regions, how many of those post offices actually are doing this?
I'll have to take that on notice, Senator.
All right, so in terms of geographic locations, what geographic locations can product level blocking currently be used?
On a nationwide
Would you say
basis?
that's right across the country?
So in relation to smaller merchants, they would be already in the CDC sites. So I'm not aware of product level blocking being rolled out in smaller merchants outside of those sites. And if it's nationwide, obviously that would be nationwide.
So it is rolled out nationwide?
In relation to Coles and Woolworths, they would just do an update in relation to what their software for all of their point of sale systems, and that would just be part of that software.
So that's national, but what about the other large stores that you've mentioned?
So the smaller merchants, is that what you're after, Senator?
No. We're talking about the larger merchants like Australia Post,
Yes.
the Euro Garage, the Woolies you've said, and Coles is doing it. Aldi, they're national?
Yeah, my understanding is that is a national rollout. And if not,
Okay.
yeah, then I will confirm that. I'll have that confirmed, Senator.
So product level blocking is being rolled out across the country?
Senator, product level blocking, as I said, only comes into play where it's a mixed merchant, and it essentially makes it a more seamless transaction for the person buying. And so it is being rolled out at mixed merchants across the country, but there is a large number of merchants where it doesn't need to be rolled out because it doesn't come into play.
I also think, Senator, that it's
That's very generous of you to roll it out across the country.
I think, Senator,
sorry.
in this case, it is cheaper for Coles, Big W, Woolworths, etc., just to do it on a national basis than to try and target the particular CDC sites. So if you have to do it once, it'd be cheaper just to do it and roll it out across their whole network across Australia. Yes.
And that would be because you're planning to roll the CDC out across Australia?
Not at all, Senator. The reason that we're doing this is that we want people who are on the CDC to be able to use their card when they travel around Australia. So their ability to use their card when they travel off country is really important, and making sure that they have a seamless experience and their card operates just the same way as any other key card that happens to be in their wallet. That's the purpose of what we're doing, Senator.
It's very generous of you, Minister, given so many problems occur around the CDC for people using it in terms of paying their rents and surviving each day. I refer to the CDC Technology Working Group agenda for the meeting held on level 27 of the Westpac Banking Corporation Tower in Barangaroo in Sydney on the 19th of February 2020. What a beautiful view that must be. How many banks are able to support product level blocking through their systems?
We are in trials with all Big Four banks. So no bank that I'm aware of, Senator, have yet fully rolled out product level blocking. There are a number of other people who also provide POS systems or PIN pads. That would include Suncorp, Tyro, and I'll have to find in my notes what the other one is. But there's about another 2 providers. So most of them are working on an ability for product level blocking to be included in their PIN pads. But the time of rollout will be different for each of those, for all of those providers.
Could you just repeat the names? You dropped out a little bit.
I'll have to
just with our
find it.
technology.
Just wait a sec.
Senator, while Mr Bonham's looking, you asked earlier, I think, how many age pensioners are on Basics card? I've been informed by my team that there are 747 age pensioners currently with a Basics card.
They're put on the basics card under a
And
previous
how many
government.
on the CDC?
How many age pensioners on the CDC? I believe there's 25.
25 age pensioners on CDC, and where are they largely based, Ms Heffron-Webb?
Largely in Cape York, as the Minister said. That was a request from the leaders and the Family Responsibilities Commission that we continue to provide that opportunity. So the 5 elsewhere would be
Thank you.
volunteers.
Yep, Senator, the only place that anybody is on the cashless debit card is at the direction of the Families Responsibility Commission in the Cape. Many of the age pensioners are voluntary up there as well, and the ones that Ms Heffron-Webb referred to in the Northern Territory would only be voluntary. You know, as I said, and I'll repeat it again, the federal government does not and will not force age pensioners, any age pensioners, onto the cashless debit card. And also, just to be very clear, the people that are on the basics card, age pensioners on the basics card, were put on the basics card under legislation that was put into this place by the previous Labor government.
So, with respect to your question, Senator, I actually don't have the names of the PIN pad providers with me. I will get someone to see if they can forward that to me so I can answer that question as soon as possible.
This was the banks, though.
Yeah, the banks.
You mentioned them.
So you would have ANZ, Commonwealth, Westpac, NAB. I understand Suncorp also has a stake in that market, that PIN pad market. There is another independent group called Tyro, and there's one or two which aren't coming to mind. One's Windshear or something like that. But I'd like to get information which I can then pass that on to you later.
The other thing that's probably worth adding to this conversation, Senator McCarthy, not specifically about what Mr Bonham's talking about, but the partnership in relation to the Traditional Credit Union, which will be an issuer of the cashless debit card. So up in your home territory of the Northern Territory, that Indigenous organisation will be also a provider of the cashless debit card.
But they're not included in these meetings currently. I'm just trying to understand the meeting that took place for Barangaroo.
No, I was just raising it because you were referring to banks, and just wanted to let you know that that they are an issuer, and so that they've actually moved first in relation to having this card available to their clients.
All right, and will they be a part of this this technology working group?
Well, they've already moved on the issuing.
No, TCU are not currently part of the TWG, and I'm not aware of any potential to include them on that.
So you don't expect that any First Nations banking organisations will be involved with this?
We've had significant consultation with the Traditional Credit Union on an ongoing basis. I've met with them and spoken to them on a number of occasions, including in person when I was in Darwin. And so we have a very close and direct working relationship with TCU, Senator. I can assure you that the level of consultation that's been undertaken about this is significantly in excess of the consultation that appears to have been undertaken by the private members bill that's been put into the other place, which there doesn't seem to have been any consultation with anyone.
Well, you've just got a technology working group that's impacting, with banks that are impacting a large proportion of First Nations people, but you can't seem to have the First Nations banking organisation on it. That was all my question was, Minister.
Sure. And I'm more than happy, Senator, to extend the invitation to the Traditional Credit Union to participate in that group. But as I said, we've been working separately with them, and they're in a much more advanced stage in relation to what they're doing with the cashless debit card in the Northern Territory. But more than happy to extend that invitation for them to participate.
So does the national payment system support product level blocking?
So, Senator, it does. That's why Coles, Woolworths, etc. have been able to roll it out. And the piece of work that we're doing in the technology working group is essentially trying to bring additional providers on board, so providers of EFTPOS systems and of merchant acquirers essentially on board with product level blocking. So I just want to clarify, part of the reason why the TCU haven't been part of that is the focus is not on the frontline banking, it's on the actually the back end kind of systems architecture. So, but yes, the payment system does support it, which is how we've been able to implement it.
Is the RBA, thank you, Ms Heffron-Webb, is the RBA involved in product level blocking at all?
I've had no conversations with the RBA. Treasury are, of course, kind of aware of the project and are kept informed about it, but not to my knowledge have we had engagement with the RBA.
Has anyone in the government had any contact with the RBA about product level blocking?
Sort of
If you
at a
can take
loss
that
to
question on,
understand,
please.
Senator McCarthy, what the basis of your question is.
Just a simple yes or no.
But I mean, why would the RBA have anything to do with product level blocking? They don't have EFTPOS machines.
Well, you tell me, Minister. It's just a question, yes or no.
There would be no reason why we would be engaging with the RBA in relation to product level blocking.
Okay, just that Ms Heffron would have mentioned the Treasury, so you might want to check with the relevant minister in terms of Treasury.
Senator McCarthy, thank you for your questions. We can come back to you, but we're going to turn to Senator Waters now.
Thank you, Chair.
Thanks very much, Chair. Hi, everyone. I hope you can hear me okay on the remote connection. It's been somewhat problematic this week, but fingers crossed. I've got some questions first off about the national plan. Noting that there was an amount of money announced in the budget that was promised to flow to frontline DB services, including legal services. When will that money get out the door? Because none of those services have received a cent yet.
Can you just, you said, were you referring to legal services? Did I hear you say
really
legal?
any?
Yeah. So in relation,
including the legal money, but any of the frontline service money, when will it actually hit those services?
Yeah, of course. So we're in the final stages of putting in place the arrangements with the states and territories in relation to the provision of the additional $260 million that was announced in the budget to help states or to provide support to states and territories around frontline service provision, particularly in the long tail of COVID, and as we know, that domestic violence is, unfortunately, we've seen an increase in that during the pandemic. So last year, in the pandemic, we provided $130 million to the states and territories, and we've subsequently announced in the budget an additional $260 million. The first 6 months, that was over a 2-year period, so 130 this year and next year. The first amount has been agreed through Women's Safety Ministers, that it will be delivered under the National Partnership Agreement on a sort of a pro rata states formula, and I believe that those documents are with the states and territories at the moment for signing to come back for the release of money, as soon as those contracts have been returned.
Okay, when are you expecting expecting that to occur? Because it's obviously been a while since the budget and those services are still waiting and the demand, as you say, has increased. What's the timeframe that your money will get out the door?
Yep. Senator, we are waiting on the contracts to come back from the states and territories, but what I would say is the states and territories have not indicated that there are any services that have had funding cut or not able to be continued on the basis of this, and we're working very productively with the states and territories and making sure that we are focusing and they are focusing the resources that they have to meet the demand in the areas that they have seen, unfortunately, an increase.
Yes, well, demand's not being met. That's part of the reason why more money was needed. Even more money is needed than that was promised. When are you expecting the money to reach those services?
As soon as we receive the contracts back from the states and territories, the national partnership agreements back from the states and territories, the money will be provided.
I understand that, but when are you expecting that to be?
That's probably a question you best direct to the states and territories, but I'm assuming it's imminent.
Well, I don't have them before me at estimates, so...
Yeah, I can't answer a question on behalf of someone else.
I might add that our first draft of our national partnership multilateral schedule was provided to the states and territories in August. They've come back with comments, a couple of rounds of comments about the scope of the services aimed as to be supported, the nature of the reporting requirements, etc. There's been a discussion about that between the states and the Commonwealth at both officials level and at ministerial level. States are all very aware of where that agreement is up to. We now have sent a final schedule for their signature, so we are awaiting their signature. Obviously, we are hoping they will get it back as soon as possible so that payments can start to flow in November, but we need a signed multilateral schedule before we can commence.
And the other thing that's probably worth just qualifying, I know Senator Waters will be well and truly aware of this, but the federal government does not in almost every instance fund frontline services. We fund them via these national partnership agreements with the states and territories, and the states and territories are the ones that have the relationship with their frontline services.
Yes, thank you. I understand that, and thank you to the officer for that greater detail about your hope being that it's November. I hope that's the case also. Can we expect any further funding announcements in this space?
Well, I think the Prime Minister's comments when we announced the $1.1 billion in the 2021 budget was that it was a down payment on the next national plan to end violence against women and their children. Obviously, we are in the very final stages of the preparation of the draft plan, which has to go through a process, obviously, of consultation with the necessary bodies that we have in place to support us in developing the plan. And, of course, it also needs to go to the Women's Safety Ministers' task force, because, of course, this is a partnership between the federal government and the states and territories as well. So, very much a very strong commitment from this government, largest ever commitment in the $1.1 billion. But as I said, the Prime Minister referred to it as a down payment on the next national plan to end violence against women and their children.
Minister, can I just pick up on a comment that I think it was the officer that made, and I'm sorry I can't see your name tag, so apologies for not referring.
Miss Heffron Webb.
Miss Heffron Webb, thank you. Thank you. I think, Ms Heffron Webb, you said that there was a discussion about the scope of services that were being funded in those discussions about finalising some of that money to get out the door. Can I ask how that was resolved? What was the outcome of that?
Senator, one of the couple of issues that we were seeking to resolve as part of this ongoing arrangement with the funding for the next 2 years with the National Partnership Agreement was trying to get greater clarity from the states and territories about the kind of areas of demand, so that we, as a Commonwealth, had a sort of a broader understanding of the services that were in demand, where they were being sought, etc., was part of it. The other thing we were very keen to do as part of this agreement was to make sure that the money was actually going to frontline services, that actually it was going to a place where people were actually, absolutely at the coalface. We didn't want it to be going to increasing the number of public servants operating in departments in the states and territories. We were very keen to make sure that that it was being used on frontline services. So I think that's possibly what Ms Heffron-Webb was referring to, but hopefully I haven't verbaled you.
No, that's right. We just were agreeing the kind of type of services, and every state and territory has slightly different architecture and structure of their domestic violence service system. So we were making sure how we defined it in the multilateral schedule would accommodate, I guess, all those variations, and to do that we needed kind of their advice back about how we'd nominated various services.
Thank you. Are there any services that hadn't previously received funding that would get it? And concomitantly, any services that had been receiving funding that now might not get it as a result of that scope examination?
Well, Senator, that is a matter for the states and territories. Obviously, they are the ones who are best placed to understand, where they want to make the investment to address the issues in their states and territories. We would not be dictating to the states and territories, because we think they're best placed to be making the decisions about how best to use the funding that we make available to them to provide the services that they see are needed in their states and territories.
Just one point of elaboration on that. So in the COVID agreement, which was developed in very rapid timeframe, we didn't preclude states and territories using it for public servants, essentially, as the Minister has said. So if you're asking, is there some types of matters that were in scope and are now out of scope, that's the only one that springs to mind, is that one.
Thank you. Can I ask how many submissions we received on the National Plan consultation?
I might ask Mr Bennett to answer that.
Good afternoon, Chair. Senators, it's Shane Bennett, Group Manager, Women's Safety. In terms of the number of submissions that we received, Senator, can I clarify? We've done 2 lots of public consultations. One was early in the process associated with the release of the plan, and one was after or around the time that we had the National Summit. I can give you both if you like, but I just wanted to point out that there is...
Please.
So the first round of consultations we had over 1,000 submissions, and the second round we had approximately 200.
Okay, was the second round an invite only or?
Senator, obviously this was a consultation process that was on top of what occurred through the parliamentary inquiry. The consultation process was open to anyone to participate. It was done through, the 2 that I'm referring to were done through a web-based service. As part of the development of the National Plan, we've also engaged Monash University, that's been running a series of other consultation events, including roundtables on different themes, plus interviews with different participants, including victim survivors.
Senator Waters, it's also worth mentioning to elaborate on the House of Representative inquiry. Every Australian had the ability to be able to make submission to that. And I understand, Mr Bennett, there was over 1,000 people made submission to that inquiry.
Unfortunately, I don't have that figure with me, but
we'll clarify that.
I'm more interested in the plan itself. We've had lots of inquiries in the Senate on this issue too, and it's great when you get some engagement on them. But obviously, is the document that's particularly apposite in this situation.
Yeah. Senator, can I just
when you say
can I just qualify that the purpose of the request by Senator Payne and myself for that particular inquiry was to inform an additional layer or level of consultation more broadly in relation to the development of the plan. So it wasn't just another inquiry; it had a specific purpose.
Oh, right, you had a House of Reps inquiry to supplement the consultation on the national plan.
We sought to, well, because we wanted to make sure that we had the widest possible scope in relation to allowing people to be able to provide their views on issues that related to this topic. Of course, we had the specific consultation, but particularly in a year with COVID, it provided us with an additional opportunity to engage when we couldn't actually go out and engage.
Were you concerned that the web-based consultation on the plan directly was inadequate?
No, not at all, Senator, but of course, you know, there can never be too much consultation, as you would, you know, I'm sure you would agree. And, you know, anything that is...
Only when one listens to the comments and doesn't use it as a delay tactic as in the ICAC, but that's another matter.
Senator, Senator, can I just actually perhaps take you to task a little bit about this? And that is that, you know, I would like to actually, you know, pay due credit to previous Prime Minister to Gillard and to the then Minister for Women, Tanya Plibersek, back when the first national plan to reduce violence against women and their children was first put forward. The one thing that we have worked over the last 10 years is, or 11 years now, is that this is not a partisan issue. Not one woman in Australia is going to be made safer by us doing political point scoring like you just did. I am committed in a completely non-partisan way to work with all people in this parliament and all people in Australia, all levels of government, to make sure that we can make Australian women safer. And I would just draw to your attention, as I would to anybody else, that party political point scoring does not make Australian women safer.
Not point scoring to suggest that the funding of the services need to be quadrupled to meet existing demand.
That is not what you just said.
That's where you could start. Well, my question was whether this is the first time a House of Reps has been used to supplement consultation on a national document. I've never heard of that process being used in that way before. I've been corrected. Has this happened before?
Senator, we use, you know, when you are going to put together something as comprehensive and as broad-reaching as this particular plan, we will seek wherever we can to be able to try and give people an opportunity to engage in the process. And of course, you know, there were a myriad of different ways that we engaged with people, with the sector, with the public, with the states and territories, to make sure that we had the very broadest, you know, opportunity for people to be able to participate in this process. I don't think there's anything unusual about that.
Perhaps if you could take that question, on notice then to answer it. I'll move on. What type of consultation is planned on the national plan?
I didn't hear a word of that, Senator Waters.
What further consultation is planned on the national plan?
So, Senator, the national plan draft is being developed now. We are still finalising some consultation that's occurring with victim survivors. So Monash is doing that consultation. So we're kind of waiting for that before we get to a kind of a draft plan. We will be engaging with our National Plan Advisory Group and our Aboriginal and Torres Strait Islander Advisory Council and with Women's Safety Ministers on that draft, and then there will be decisions about whether what further consultation is required post those processes.
Okay. Are you expecting that there would be a further round once the draft is compiled, or is that still completely up?
I think it depends a bit on the feedback we get through those processes. No decision's been made.
Okay, thank you. Your kind of timeframes are getting a bit squished. If there was to be a further round of consultation, when have that finished by in order to have the plan ready on time?
So yes, squished is a good word for it. So you're aware the current national plan runs through to June 2022. We had spoken about having the next national plan finalised by the end of this year, but obviously it's a balance between achieving that timeframe and undertaking due consultations. So those are the sort of parameters we're working in.
Okay, thank you. You mentioned that Monash is doing some further consultation with victim survivors, and certainly I welcome that, as I'm sure victim survivors would. The Women's Safety Summit statement emphasised the importance of centring victim survivor lived experiences. Will the government establish a victim survivor advisory group to participate in both the development and then the implementation of the next plan?
Yeah, Senator Waters, just one clarification, just to be really, really clear. The next national plan will be in place in time for the expiry of the existing national plan on the 1st of July 2022. So, whilst, we have, because of COVID, sort of had some time pressures put onto us, we will have the plan ready to go so that there is no lapse at all in the time between this one concluding and the next one starting. In relation to your comment,
certainly hopeful. I hadn't envisaged that you might not do that. So thank you for reassuring me that. Senator, to be on time.
That is one of my priority focuses, is to make sure that happens. And I know that everybody that sits around this table at the moment on this particular project is equally committed, as are the states and territories, the sector, and hopefully Australia more broadly. But to your point around centering the voices of victim survivors and the very core of the next national plan, that is absolutely the case. And as Ms Heffron-Webb explained around the Monash engagement and consultation to make sure that was the case. But we are also working with a number of victim survivors and including a fantastic group of women who I've spent some time with recently around making sure that we have a mechanism so whereby the voices of victim survivors not only inform the development of this plan, but also continue to be a voice as the plan is rolled out over the next 10 years and is implemented. It is absolutely a fundamental and core element of it.
Thank you. Will those grouping of women that you mentioned be formalised into an advisory group as such?
Excuse me, Senator Waters, your time has expired.
Can I just quickly answer that, because I want to get it on the record?
No, we can come back to it most definitely. So just going to go to Senator Green.
Thanks, Chair. I'm keen to have another go when it's.
Yeah, absolutely. No, most definitely. That's right. I'm just trying to keep the time as best we can. To Senator,
I'm happy.
and we can come back to it.
Okay.
Yeah, I'm the chair. You can be the chair with it. Thank you.
Thanks, Dean.
No, sorry.
No, I'm in the chair's hands. I'm in the chair's hands. I apologise.
We'll all come
back to
unstuck.
Senator.
We don't respect the
We'll
chair.
all come back unstuck. Thank you, Senator Gallagher.
Smith.
And Senator Waters will definitely have the call again. Yes.
Gives me plenty of time to get a great answer sorted, doesn't it?
Exactly right. Yes.
It'll be very rehearsed.
Thank
okay. I just want to refer to a couple of departmental file lists relating to the cashless debit card cost benefit analysis. I've got the list here, but there's two particular documents, EF 20/44652. It's the Social Welfare Services Planning Routine Operational Cashless Debit Card Program Monitoring Cost Benefit Analysis. And then a second document, EF 21/3982. Social Welfare Services Reporting Routine Operational Cashless Debit Card Monitoring Cost Benefit Analysis 2020 to 2021. What cost benefit analysis has been undertaken?
So this arose out of a recommendation from an ANAO report that was provided in 2018. There was a recommendation that the department commission a cost benefit analysis of the cashless debit card. There was a company engaged to undertake a cost benefit analysis. We ran into issues with a lack of data to inform that piece of analysis. So that work will be progressed once we're we're currently building a data repository, essentially, because the cashless debit card data, it's not just Commonwealth data that we need to be looking at, state territory data. And so we are pulling together a data repository, and then the cost-benefit project will be progressed.
So there was a company
Engaged.
Correct. Do you have the contract number for that
Someone
engagement? Someone can find it,
will
I'm
have
sure.
Yeah.
Are they still engaged?
I don't believe we're still engaged with them, but we may then go back to them once we have the data.
Sure. How much? What was the cost of that contract?
Marion Clardy, Acting Group Manager Communities. I don't have the cost of that contract here, and Ms Heffernan Webb's right. That contract has been finalised.
I think I might have it actually.
When was that? When was it finalised?
17th of March 2021. So I do have the cost. Sorry, I've just found it. 172,390.90. And it was CN 3709745, and the provider is the Centre for International Economics.
And did the Centre for International Economics undertake any analysis?
Yes, they took some analysis, but they ran into the issue that the data wasn't sufficient to really provide a cost-benefit kind of figure, and so we've agreed we will do more work compiling data, including from the states and territories, and then recommence the project.
Who made that decision that there wasn't enough data to undertake the analysis? Was it the Centre for International Economics, or did you receive the analysis? Oh, so the department made that decision.
The department made that decision.
So what analysis and findings did the Centre of International Economics make before that decision was made?
I'd have to take on notice what their specific findings were.
What the specific
findings were. I don't have...
You don't remember?
I mean, essentially the findings
were
that there's insufficient data to undertake an accurate cost-benefit analysis, but beyond that, I would need to take that on notice.
Senator Green, one of the things I would say is that when I came into this job, that was singularly one of the things I was most disappointed was the lack of quantitative data on which to base this, and that's why we're seeking to get better data.
Why is there a lack of quantitative data, Minister?
Much of the data that we would be seeking to be getting is held within the states and territories, but it's also collected by the states and territories in a format that doesn't necessarily provide us with the information in the format or in the geographical location that would necessarily make any sense. But I'm sure Ms Heffernan Webb would have probably a more detailed response to that, but that's certainly been my concern.
Because there's the recommendation from the Audit Office was made in 2018.
Yes.
That's right. So you've known since then that not comply, but to fulfil that recommendation, you would need data. You'd need information to be able to develop a cost-benefit analysis. Why isn't there enough data?
So it's the states, the data that we're looking for, most of it is actually coming through.
You're quite capable, Minister, I'm sure, of working with the states and territories to make sure that they are collecting the data that you need, that it is in a format that you need to be able to make sure that this program that you are running has a cost-benefit analysis associated with it.
I might just note that there was a large multi-stage evaluation undertaken over the course of 2018, 19 and 20 by University of South Australia.
Adelaide.
Was it Adelaide or South
Is that the one they didn't make?
And we were hopeful that the process of that evaluation, where the researchers were engaging directly with state territory jurisdictions to obtain administrative data, would enable us, would provide essentially the data sources to then undertake the cost-benefit analysis. So that's why we didn't commence the cost-benefit analysis straight away. When you read that evaluation, essentially the issue that they raised, which is the issue the Minister alluded to, is matters such as police data, alcohol and other drug data, hospitalisation data. It's often collected on a different regional or geographical basis. It's not always easy to track back to a particular community. People might have an alcohol-related issue in Ceduna, but they may be treated in another regional hospital, or, you know, they essentially struggle to find relevant administrative data beyond the Commonwealth.
I remember the
data.
evaluation and what it was and what it said, and the findings were
And Senator Green,
not very conclusive actually about the
Senator Green, you know,
about the
to your
benefit.
point about, you know, getting, you know, data from the states and territories, they are often reluctant to provide this data.
Have they been reluctant to provide this data to you? Is that what you're saying, Minister?
I think, you know, states are often reluctant to provide data more generally.
That's a very general statement, but I'm asking specifically
No.
about this.
If you'd let me have the opportunity to explain. You know, one of the things that we, you know, for instance, housing data, and Senator McAllister asked at the last estimates about why the federal government didn't have information around housing data. It's simply a matter that the states and territories guard this data very closely and are very reluctant to provide it. And I don't think that's an issue of a particular government. I think that is generally what happens between information provision between states and territories and the federal government.
And is that what has happened in this? Have you made a request for data and there's been reluctancy? So you're trying to equate two different situations, I think. And
No, we obviously have sought to get this data. And look, they are working, you know, we are working on the issues as we speak, but, you know, it has not been the simple process that you may think it is.
Can I just go to the Senate Order of Production of Documents? Last week, Senators Chisholm and McCarthy sponsored the OPD, which the Minister supported, asking for certain cashless debit card documents. The only documents provided in relation to the technology working group were agendas. But there are other documents relating to the technology working group in the department's possession. That's right, isn't it?
You're referring to the minutes of the meetings?
For the OPD, the only documents that were provided under the OPD in relation to the technology working group were the agendas of those meetings. Yeah. But there are other documents available.
Yeah, so Senator, I think you're referring to the minutes of the meetings. In the case of those meetings, there are third parties that attend, and so we would clearly be requiring to seek with them about the release of information that relates to them. There also could well be information in those documents that may need to be redacted because it actually names individuals. And to be fair, you provided us with 2 days to come back with, and you know I'm more than happy. I'm more than happy to work with you for the provision of this kind of information. But you know, to be perfectly honest, when you give somebody 2 days to provide a whole heap of information, you know, a huge body of information, you know, it does suggest that you're not being particularly genuine if you are only providing 2 days' notice to be able to provide it in.
Minister, I'm just referring to the order of production of documents.
2 days.
Yep.
2 days.
And I'm sure that you've been asked for similar type of information before. But
well, Senator, if you were genuine, or your party was genuine about getting these documents, you would give us a reasonable time. We have to read through every one of those documents to make sure that we're not disclosing information that may impact on a third party or could be a commercial in confidence piece of information. To make sure that we are actually meeting our requirements in terms of the release of documents. I have no issue whatsoever in releasing documents, but you know there is a process that has to be gone through.
So you haven't provided any emails, letters, minutes. You are checking, though, with third parties whether you're able to provide those documents.
We are going through a process at the moment, yes.
And any other documents related to those to the technology working group, you are requesting that permission from third parties. Is that right?
Well, I've just said that.
Yep. It appears that there were no documents provided in relation to the product level that were not already public. Is that correct?
I'm sorry?
The information that you provided under the order of production of documents in relation to product level banning,
Blocking.
the information that you provided was already public. Is that right?
I will have to check.
I believe that's correct.
They were already provided under questions of notice and fact sheets to providers.
Actually, the really strange thing is that you often do request OPDs on things that are publicly available. And it, yeah, I mean the amount of times that we've had requests for information that you could have just gone online and got.
So the documents that we requested.
Should run a how to use Google course.
The documents we requested, if you'd read the OPD, says that documents relating to product level blocking using the cashless debit card or other payments, including in relation to product level blocking trials. There are no other documents relating to product level blocking that is in the possession of the department?
Yeah, yes.
Yeah, of course there is.
So as the Minister said in her answer to the order of production, the other documents include commercial in confidence.
Yeah, that's
material.
why we asked for those documents.
And what we've
And
said,
you haven't provided them under the OPD. What is the reason for that?
Due to the commercial in confidence nature of the material in the documents.
When there is a document that is commercial in confidence, there are ways to provide that document without hampering in commercial in confidence. Are you taking those steps so you can comply with the order of production of documents?
you asked for something in 2 days.
No,
To
that's
read
not.
through all these documents, to seek third-party...
That is not my question.
And to redact.
Minister, you're trying to deflect from the question that I'm asking. Are you doing the work to make sure that you can comply with the order, to ensure that all the documents relating to product level testing, all the information in those documents that can be released are provided to the Senate? Is that work being undertaken? It's a pretty simple question.
Well,
I don't
we
really...
think
I
we
know you're
complied.
sensitive about this
No,
information, but I just
actually,
want to
I'm
know
not.
what work's being done to make sure that we can get the information we've
Senator,
asked, so
I
that we
am
don't have to
not.
go through the Senate chamber again and ask for these documents again.
Well, Senator, we think we complied with the OPD. I made the 2 points around the fact that you gave us 2 days, which was in an impossible timeframe, to undertake some of the things that you were requesting. We think we have agreed. If you'd like to put another OPD or you would like to request other information, I'm more than happy to consider that. And to suggest that I'm hiding anything, I'm absolutely not hiding anything.
You haven't complied with the OPD.
Well, I think I have.
And my question was actually pretty fair to ask if there are additional documents that were required under the OPD that need to be assessed for in commercial confidence. Is that work being done?
If you wish to ask, I believe we complied with your OPD, but if you wish to ask for additional documents, you're more than welcome to do so.
Can you answer my question, please?
I did. I just answered. I believe I complied.
So we're not going to get any further documents in regards to product level blocking?
I mean, ask me what you actually want. It was just a blanket spray.
Sorry, can I ask Ms Heffron-Webb, and I don't need interjections from people who have invested. Ms Heffron-Webb, can I ask you, because you seem to be a little more across what documents are available, the in commercial in confidence documents that haven't been provided under the order of production of documents that are in possession of the department, are you taking steps to assess those documents individually?
So the process, as I understood it, is we identified the documents, we identified the sensitivity related to those documents, and we provided those to the Minister, and the Minister has made a decision about the production of documents.
Right. So it's the Minister's decision to...
No, as always, the order of production related to the minister, not to the department, as I understand it. So we went through the process of identifying documents as best we could in the time frame and the sensitivities associated with those documents, and provided those to the minister, who made a decision on, in the time frame, what could best be provided.
You're welcome to ask me for some more.
You could have asked for an extension as well, Minister. I'm sure that.
You could have also given me a reasonable time frame.
Yeah. Did you ask for an extension in the chamber? I don't
Did
think
you give me a
did.
reasonable time frame?
I don't think you raised it.
Available before we hit.
I just have one last
lunch
question on
break.
this
Oh,
topic.
great.
Actually two, but I'll try to make it
You
into
did say
one because
one.
I think that'll help. In your letter to the President of the Senate, you outlined that you wouldn't be providing the contracts for delivery of this cashless debit card for commercial reasons. Is this the only contract that DSS holds that is currently secret?
I'm not aware, Senator. I would have to ask our legal area whether there's other documents that have commercial in confidence.
Yes.
Sure, it's not.
When I think when there are other contracts that have sensitive material in them, that material is often redacted. Why hasn't that decision been made in this instance? Is the contract like a matter of national security that we can't see the parts of the contract that aren't sensitive?
6, I understand, reported as having confidentiality.
But the whole
arrangements.
contract, we can't see part of it? I mean, the Senate's asked for the contracts.
I'd have to ask corporate to see whether they could provide additional information, but there are certainly 6 in the department that are reported as having confidential
Are all
clauses
6 of
in
those
them.
contracts related to the cashless debit card?
No.
No.
All right.
Thank you,
Can I
Senator Green.
finish that or?
I think you finished that.
Well, I've got one last question and I don't
You
have
had
to come
one
back.
last question
Yeah.
a moment ago. Is this one
Yeah, Minister, will the cashless debit card be proof of voter identification under the voter suppression laws you've just introduced into the House of Representatives?
I'll have to take that on notice, Senator.
You don't know. You didn't think to find that out before you passed a law or put a law into the House of Reps that'll stop a lot of
Senator,
participants actually voting?
Senator, you've just asked me a question that is not within my portfolio. I'm more than happy to take it on notice for you.
Thank you.
Thank you much, Senator Green. Now, Senator Gallagher, did you have some questions? To defer to Senator Rice? Okay.
Thank you. Thanks. And look, I'm going to continue the questioning about the cashless debit card. So we had a conclusion of the contract for the cost-benefit analysis in March because of insufficient data. What's the timing? So we currently haven't got a contract underway that's looking at putting the data together that's needed for the cashless debit card. How's that being done?
Yes, we do. We have a contract with Deloitte,
Yes.
I believe, to help us assist with building the data capability.
Right. And so what's the timing then of that
Can I
contract?
ask Ms McClarty to speak to that?
I'll have to check the contract period. Deloitte are in helping us to build the data asset, so a combination of administered data and then data from the states and territories, but I'll just see if I can find the contract period for that.
And the
piece of
contract
work.
number too, please.
Yep. It doesn't look like I've got that information. I can get that for you.
Okay, if you could get that back to me as soon as you can, that would be good. So then, okay, we've got this unknown period that we're going to have this data collection analysis done by Deloitte, and that includes actually collecting that data as well, or is it that just planning what data needs to be collected?
So it will be doing the technical work to put the data into a usable format and assisting us with identifying data gaps and And we've also been engaging as a department with states and territories to get state and territory data to support that work.
Okay, so it is actually collecting that data, putting it in a usable form for you.
I don't think they won't be collecting data for us. We will source the data,
Yeah.
and they will support us into putting it into a usable form.
Okay.
Yep.
And so you say you haven't got the time period, but are we talking? Is it 6 months? Is it 12 months? Somebody must know approximately what your expectation is as to how long that sorting out your data period is going to be.
My recollection is that it's till about March, but I just want to confirm that before I. Okay. Yep. So it's the contract number is CN 378 83966. And it's the maximum contract value is 674,830, and it actually goes through till December 2021. So the work,
the end of the year.
Yeah.
Okay. And so then, is there, once you've then done that work on the data, is there then another contract that is then expected to be issued for somebody to actually do the cost-benefit analysis?
So, as I indicated, there's no final decision on that, but one option may be to return to the provider who commenced the work with the additional data and ask them to include that data in their analysis.
So it might be a continuation of that previous contract or a variation to the previous contract?
I'm just technically not sure whether you'd do a new contract or I think you might have to do a new one.
And you haven't decided whether to necessarily go back to that previous provider or in fact put it out to tender for a new provider as yet?
Correct.
Okay. Going back to the data, so what data is being collected?
So from states and territories?
Yes, well, wherever. What's the data that Deloitte's are now working on at sort of putting together into that data repository?
So currently Deloitte's are working on administered data, so income support data. And in parallel, the department is working with states and territories to source data from them. So as Ms Heffron-Webb said earlier, things like drug and alcohol, hospital attendance, police, those sorts of...
Can you give me the comprehensive list of the data that is being sourced?
I can take on notice.
Okay, thank you. And how complete would you say that the data collection is going to be by the time that contract is finished at the end of the year?
In terms of the administered data, obviously the income support data, it will be quite complete. In terms of the state and territory data, as the Minister has said and Ms Heffron-Webb, it's a negotiation with states and territories to get that data. So we don't have a definitive timeframe from them yet. So we're working with them, and it's a collaborative process, but it's not...
I presume that you will delay beginning the cost-benefit analysis, though, until you have resolved getting all of the data that you need to do that cost-benefit analysis.
Yes, we would need that data to do the cost-benefit analysis.
Yes, okay. You've got... Is people's experience of being on the cards, data being collected about that as well?
So this, the second impact evaluation collected survey data on how people felt about being on the card. So that was released, I think, in February this year, publicly released.
And so over what period of time was that?
We can get you that on notice, Senator, but there was an extensive participant survey as well as detailed participant interviews with quite a number of participants in the card.
So is there further surveying going to be done as part of the cost-benefit analysis of people's experience of being on the card?
Not as part of the cost-benefit analysis, no.
So will that data of people's experience of being on the card will feed into the cost-benefit analysis,
Correct.
though?
Yes.
But you're not planning on doing any further?
Not at this stage, no.
Okay.
It was a fairly extensive set of participant interviews and surveys. There was a significant number collected, so...
Okay, and so that's it in terms of incorporating people's lived experience and in terms of the data that's going to be available for the cost-benefit analysis.
As at this point, yes, that's right, yeah.
Okay. Are you going to wait on the cost-benefit analysis before any further rollout of the card, Minister?
There's no plan to do any further rollout of the card. We're currently in the process of providing the opportunity for people who are on the basics card to move across to this improved technology.
Okay. In fact, but there's no current plans, but potentially there could be further plans.
Well, I can only tell you what's currently on the table.
I mean, given what we've got this data collection period, we've got then the cost-benefit analysis that presumably will begin next year. What's the timing on the cost-benefit analysis expected?
So, Ms McClarty said we obviously will have completed our analysis of the administrative data we get from Services Australia by the end of this year, but the state territory data, it's a negotiation, and it's a bit difficult to put a time frame on it. But then, I'm hopeful and that we would get a solid piece of data analysis we could provide to someone for a further cost-benefit analysis, potentially March next year, and then that piece of work would occur.
And what's your expectation then of how long that piece of work would take?
I mean, these things are usually 4 to 5 months in my experience.
So sometime mid-2022 we'd
Correct.
be looking at having a cost-benefit analysis. Okay, just rounding that off, could you provide me please with the relevant approach to market and the contract documents for the data collection contract, please?
I could take that on notice and provide it on notice.
Yes, thank you. Okay, I now want to go to the issues where the card doesn't work for people and the risk management strategies that you have and plans, where I've had people contacting me where they have just been left basically desperate because their card hasn't worked during power outages and where merchants simply just don't accept their card. That's particularly for people travelling out of their regions, I think, and they're in different regions and the people don't know the card and it's just not accepted.
So the cashless debit card is accepted at anywhere EFTPOS is accepted unless you're a merchant that sells restricted items. So that shouldn't be occurring. If there's any specific instances you want to bring to our attention, we're more than happy to investigate those, Senator Rice.
Well, I've heard of people that have tried to, that basically their card hasn't been accepted and then they have had incredible difficulties of getting onto people to actually work out what to do. And basically getting resolution promptly has not been possible. People have been waiting hours, days or even weeks for resolution of why their card isn't being accepted by a merchant.
Well, Senator, if you have got a particular example where this has happened, then we would be more than happy to investigate it. But are you turning up here and anecdotally saying, I have heard, doesn't provide us with any opportunity to be able to...
I'm actually pretty sure that the people that have provided this to me have already provided it to government.
Yeah, but you come in here and you make these statements. I have got no way of being able to go and do anything about it. You're just saying.
My question was basically about. My question was about the risk management plans. Clearly, we have instances where the card doesn't work. I have then had people telling me they've had their card not working. They've tried to resolve it, and they have had to wait sometimes
we have no
days or
of
weeks.
That, Senator
so
Rice.
Senator,
can I just let me finish this? I'm sorry. No, Senator Rice. We have no evidence of what you have just said, that there's some suggestion that places don't accept the card. Now, if you actually have an example or examples of this that has happened, then I would respectfully suggest that you should provide us with that information and we will investigate the situation that we're referring to, because it makes it very difficult for us to be able to do anything when you just come in here and say, I have heard and people have told me, I would like to investigate it, because if this is the case, I want to fix it.
Okay, well, I'm
Sorry,
very
Ms.
happy to
Effenweb.
provide you with the information.
Thank you.
My question was the broader one, given that there are instances where the card
Well, we
doesn't
don't
work.
know. We don't know
Come
this.
on, I mean, the department must be able to say, are there instances where people have had their card not work? For example, during power outages, or for example, where their card has been rejected by a
Nobody's
merchant.
card works in a power outage. Doesn't matter what card it is. Yeah, whether it, your bank card or
But
your
if you are desperate and this is the whole issue. You've got people that are basically living in poverty with not enough to live on. They are desperate. They've got no food, and their card doesn't. And they are then limited to use their card at that store. This is the whole issue of the limitation of the card.
Senator Rice, you're not making any sense at all. You're limited to use their card at that store. I mean, if you have
If
a power
you're in a
outage,
remote community, for
if you
example.
have in a remote community, the community will probably know exactly who you are. There is often somebody in that community who is able to support you and provide advances and the like. So I think, Senator Rice, you probably need to dig a little bit deeper into what you're saying, because actually what you're saying is not making any sense.
The people who have informed me of this, I think, will be outraged at the response I've just gotten, because these are real examples which I'm very happy to get to you.
Yeah,
but can I get to
please.
the high-level issue of what are the risk management strategies where the cards aren't working?
Income management contingency arrangements apply where a card isn't being able to be used in a store. So I think it's 4 hours if POS has been down for 4 hours. People can get effectively a store credit of $50 a day per person and dependent, and then that Services Australia assist with recouping that money once it's up and running. There's also the ability to have your money put into your transferred into your regular account through Services Australia if there's a
And how
problem
long?
with access.
And what's the
That's
what's
just
the
a
timing
phone
of
call.
that?
You'd have to ask Services Australia those questions.
It's a phone call.
Yeah,
And
it's
so
a phone
if
call.
people ring, that can be arranged immediately on the phone call. And we do not have significant wait times on that call line. We can get you details, though, about the wait times, but the average wait time is very, very small.
Okay.
So if people are saying that they can't get through, it'd be great to have details so we can investigate that.
Okay. And is that if the power is down, FPOS outage, is that automatic after that 4 hours that they would be eligible for a store credit?
The store makes the arrangement with Services Australia, and then.
But is it automatic?
It's provided where it's
yes.
needed. So,
But if there's a power outage and somebody's got their card, they can't use their card because of the 4 hours, they would automatically, that store would be able to give them with a credit, or would there have to be some approval process to go through?
I mean, there would be an internal process in Services Australia, but it would be managed locally on the ground, where Services Australia would have a process to receive a request from a store. They would say, yes, go ahead. That it's not approved at my level or at ministerial level or anything like that. It's managed locally, so it can be responded to quickly.
Okay, I've got two quick questions which you may or may not have an answer to. Is the government considering allowing other companies to also operate the cashless debit card apart from Indue?
I've already put on the record today that the Traditional Credit Union will be an issuer of the cashless debit card as of this morning.
Okay, and that's the only other one?
Yes, at the moment, yes.
And how many people have been moved off the cashless debit card since it was introduced because they found work?
So we would have to take that on notice. I think we can provide you with details of people who've come off payment, but whether they've come off payment because of employment or they've gone off payment for another reason, we just need to disaggregate that. So we can provide that on notice, if that's
Okay,
all right, Senator
thank you.
Rice.
Yep, thank you. Thanks, Chair.
Thank you very much, Senator Rice. It being 1 o'clock, we are going to suspend for an hour and return at 2 p.m. And we are just going to have a private meeting just to discuss and reconfirm the arrangements for the remainder of the day and the evening. Thank you.
Sure, mate.
Welcome. We'll resume this hearing of the Senate Estimates Committee process. Just for the interests of witnesses and senators, I'll just update people in regards to how we'll proceed for the remainder of the afternoon and this evening. So we will now continue with outcome 2, and I'm advised that there are questions from Senators McAllister, Senators Waters and Thorpe. At approximately 2:45, 3 p.m, we will then move to Services Australia, and Senator Reynolds, the appropriate minister, will attend, and we'll deal with whole of portfolio corporate matters and proceed with outcome 1 in Services Australia. We'll proceed with that until the dinner break. At 8 p.m, which is immediately following the dinner break, we will then proceed with any remaining questions in outcome 2, then proceed to outcome 3 and outcome 4. If there are questions still remaining for Services Australia at the point where Senator Reynolds departs, those questions can still be asked. So after 8 p.m, we can continue with Services Australia if those questions haven't been completed by senators. So I'll continue to update people as we proceed. But for the next 45 minutes to an hour, we're continuing with outcome 2, and I'll invite Senator McAllister to begin.
Thanks very much, Chair. Minister, I have quite a number of questions around the escaping violence payments, so I will try and get through them as quickly as I can, and any assistance you can provide I would appreciate.
Short answers.
Yes, how long will a woman have to wait after making an application to receive the payment?
Okay, could I perhaps ask if the either Ms Heffron-Webb or Mr Bennett might be able to answer some of these more detailed questions just to make sure we're absolutely correct?
I'll pass over to Mr Bennett.
Good afternoon, Senator. So it will depend on the situation associated with when they contact Uniting Care in circumstances where they need immediate assistance. Uniting Care has the ability to provide up to $500. Part of the process with the escaping violence payment is that the period of time that the support is available is up to 12 weeks, and the way that the payment has been set up is that Uniting Care will work with the recipient associated with what their needs are, taking into account the potential to provide support over a 12-week period. So why I say that is that depending on what the circumstances are associated with the need, it's difficult to say immediately when someone might receive something, but if they are in urgent need, then Uniting Care has the ability to provide up to $500.
Right, and are there any goals in terms of responsiveness to applications embedded within the service contracts?
So the service arrangement, as I said, if there is an immediate need, someone will be supported, depending on the nature of the inquiry, taking into account that Uniting Care will need to triage. It'll be somewhere between immediate up to 2 days.
Yes, the reason I ask is because I've had a disturbing case brought to me, and I'm conscious that we're in the early stage of the program, but on Saturday, 4 days after the program opened, a woman in Western Australia applied for a payment, and I'm withholding her identifying details at her request. But she didn't hear anything from the service provider until Tuesday, and they allegedly told her that they were inundated, and so they couldn't tell her when an emergency payment would be approved. I'm concerned that the arrangements don't appear to be adequately resourced to deliver against that service standard.
Senator McAllister, what you've just said is quite concerning to me, and I understand why you're not going to publicly name the person who's contacted you, but I would be particularly keen to work with you to actually deal with the detail of what you've just put forward to see, well, to get to the bottom of it. because, this is a trial, and one of the most important things in trial and the evaluation is to get to understand, what the issues are, to make sure that this program is meeting and supporting, the needs of victim survivors. So whilst I obviously understand that you're not going to discuss it here, I would be very keen to discuss it with you to make sure that this person that you're referring to, the issues that you're raising are resolved as quickly as possible, not just for her, but for anyone else.
So the payment is structured, thank you, Minister, the payment is structured to be paid out over as many as 12 weeks by the evidence provided by Mr Bennett. Your media release, Minister, said that the payments will assist people who need financial support to leave. That crisis point, that emergency point, is important, isn't it? Having support at that moment of departure when, as you say, a person may put themselves, their children, maybe their dog into the car. I think they were the words you've used publicly. That is the moment in time. It's not the only moment in time, but it is a moment in time when resources are desperately needed, is it not?
Yeah, look, absolutely, Senator McAllister. And I think, one of the things that we were seeking to do by this program was to make sure that it was another tool that was available to women, because one of the feedback was that additional money for putting a bond down on a place to stay. Obviously, all of the other services that are provided and the wraparound services and those immediate crisis point services that are provided by those fantastic frontline service providers that we have around the country, still remain in place. But clearly, it is that, I suppose, as you would know, sometimes not being able to have that money once you've gone through that immediate crisis point of actually you've left, to be able to have the money to be able to set up a safe place for you to stay is often the reason that women go back or maybe don't leave in the first place. And so we were trying to fill in a gap that was perhaps the reason why women were returning to violent relationships.
Okay, but so the expectation is based on the advice from Mr Bennett that in most circumstances an application will be resolved one way or the other within 2 days.
Senator, I come back to the point associated with triage where I don't want to say in most circumstances, because depending on how people present themselves, they can get immediate support. So I'm just reflecting that you have situations where people who need the support will immediately get it. Depending on their circumstances, it could be associated with that triaging process up to 2 days.
Sorry, I think that's made it less clear for me, Mr Bennett. You're expecting that every applicant will be assessed under a triaging process within 2 days so that all people who are in an emergency situation will receive a payment within 2 days. Is that what you're saying?
Senator, I might try and add. So as Minister Ruston said, it might be that someone applies and they apply for the funding because they've left and they've gone to a shelter, for example, but they wish to rent a property, they need the money for a bond, they're not applying for the emergency $500. So in that case, I think what Mr Bennett was trying to say, that group, it's not necessarily a 2-day turnaround, but for people who are applying for that immediate cash of $500, there's a 2-day
I see.
Sort of KPI around.
And will they self-identify, or is that a process that determining which category they fall into, whether they are to be determined within 2 days or whether they may be left for a longer period, is that something that the provider will do or that the applicant will do?
Well, obviously the applicant will come forward with their situation and the provider will ask them what do they need. Do they need something immediately? Are they looking for longer term support? So that would be determined in a conversation between the applicant and the provider.
So to meet this goal, all applicants are going to need to have such a conversation within 2 days?
Yes, it would need to be obvious to the provider who needs to be supported in that way, correct?
Right, so some kind of assessment needs to be undertaken by the provider within 2 days of an application, in all cases, so as to ensure that people who require emergency support may be assisted within that timeframe. Is that a fair statement of the requirement?
Yes.
Okay, and that's built into the service delivery contract with Uniting Care?
Without having the exact clause in front of me, that is my recollection.
Okay. I'm interested in understanding how you came to the figure of $5,000 for the payment. Was there any analysis undertaken about the average expenses incurred by a person leaving violence?
My understanding was that at the advice of of a number of people in the sector, that this additional support was the kind of quantum and the decision around the breakup between the $1,500 in cash as opposed to the $3,500 in kind was to make sure that the woman, in most instances, who is getting this, the payments could be made directly on her behalf. So there wasn't another course of action of potential financial abuse through this process. But Senator, the reason we've set it up as a trial is obviously we want to assess this and work out whether this really is meeting the needs, whether the way it is has been designed, and we'll be working through an evaluation process that will run concurrently with the trial, so that we can make any changes as we see as we go forward.
Can I ask about the cash component? Your media release minister says women will receive financial assistance of up to $1,500 cash. The application page from the service provider says up to $1,500 in financial assistance, such as vouchers. Is it cash or vouchers or both? How does that component work?
Senator, it'll depend on the circumstances. So it'll be a mixture between vouchers, it can be cash, it can be an electronic funds transfer. So it'll depend on the circumstances. Financial assistance was used in the broad because I think a better expression is cash equivalent.
Okay, so a cash equivalent of up to $1,500. What is the balance of the $5,000 allowance imagined to be available for?
In terms of the other aspects, it would be if they needed to, for example, have support with bonds or school fees. It's still financial support. It would be a case, though, for example, if it was a bond that Uniting Care would make arrangements to pay for the bond, etc., rather than paying the person who pays for the bond.
But Senator McAllister, just to be clear, there is no defined list as to what the particular person could use the $3,500. That's why we've got Uniting Care. They would work with the person to determine what were going to be the things that they believed were going to be able to provide them with the best pathway to establish a new safe place for them and, in many instances, for their children. So what the things that we are using as examples are just that, they're examples, and we will rely very heavily on Uniting Care's extraordinary experience in this particular field to determine what is, and work with the client or the person who's escaping violence to work with them about what their needs are.
That is an interesting explanation. I'm a little confused as to why the program is described as having a cap of $1,500 on financial assistance. How is that distinguished from the broader $5,000 allowance?
I'm sorry, without knowing exactly the reference to financial assistance.
That was the term you... let me step you through it.
Yeah, okay.
The media release says women will receive financial assistance of up to $1,500 in cash.
Yes.
The service provider says women will receive up to $1,500 in financial assistance, such as vouchers. So we have a tension between the minister's position, which says cash, and the web page, which says vouchers. The minister, I think, has explained that it's going to be able to be either up to $1,500 in cash or vouchers.
Cash or cash equivalent.
Cash or cash equivalent. Why only $1,500? Why not the full $5,000? What was the rationale for putting that $1,500 cap within the allowance?
I think I just answered that a minute ago. One of the things that we often see that we wanted to make sure that we avoided was that financial abuse. We didn't want financial abuse. In some instances, we don't. Women, when they really are in a very dangerous situation, we don't even want them to use their bank accounts because we don't. In case they are actually tracked and traced as to where they are. So the cash component or the cash equivalent component was about being able to, go down and be able to, maybe buy the kids the school lunch boxes or new toothbrushes or, that really sort of upfront stuff. The $3,500 up to $3,500 where Uniting Care on behalf of the individual will actually pay the amount. It's about firstly not allowing an opportunity where the abusive partner could actually continue the financial abuse to try and get their hands on that money. Clearly builds a removal of the traceability of the expenditure because, of course, if we're putting money into the person's account, then there is a possibility that they could be traced by it. So there are a number of reasons why that division was put in place. But as I said, we certainly will be monitoring the whole way through to make sure that we've got the settings right.
Does the service provider have discretion to spend as much as $5,000 on every applicant, or are there some constraints that you've placed on the service provider in terms of how much of that allocation they might utilise for each person?
We've placed no constraints on the service provider.
Great. Can the funding be used to cross-subsidise a service that would otherwise be provided?
Senator, could you just expand that for me?
Okay, so on the Uniting Care application website, they say you could be eligible for up to $1,500 in financial assistance, such as vouchers, goods and services such as removalist bonds and basics for a new home. And their third dot point is wraparound support, including casework from the EVP provider. Is the casework to be funded from within the $5,000 allocation?
The way that the system was working was that taking into account the people would need support, as I said, during a 12-week period, there would be links to other services, etc. The question that you've asked is, are those other services deducted from the $5,000? No, it's a referral. It's a connection to rather than a deduction from.
And Senator McAllister, it's also worth pointing out that it's not taxable, it's not reportable.
Yes, right, understood. Are there any directives to service providers to use vouchers where possible? Have you provided any guidance about a preference for cash or for vouchers?
No.
No. Is there any circumstance where something like a cashless debit card would be given to an applicant?
No.
No.
And can you guarantee that the government will not be attempting to put domestic violence victims onto a cashless debit card?
Yes.
If a person who is on the cashless debit card were to apply, would they be treated any differently to another applicant?
No.
No, so they would be eligible to receive a cash payment. The media release described this as a one-off payment. The service provider's website says that the payment is available to anyone who hasn't accessed it in the previous 12 months. Which is it? Would it be available more than once for an applicant?
It's available once a year.
Right.
So and at this stage it's a 2-year pilot, so potentially people will qualify twice.
But Senator McAllister, clearly we're hoping that that's not the case.
Of course. No, I understand that. I'm trying to understand the parameters of the program. Are there any circumstances where the program, where the provider might seek to recover a payment from an applicant?
I'm not aware of any such
not aware of-
circumstances.
no.
Unless there was some
I mean, unless there
evidence
was a
of
fraudulent
Yeah.
kind of situation, but
somebody who clearly wasn't, they just lied.
But if someone, you know, subsequently, you know, changes their plan about what they're going to do, no, there'll be no recovery of the payment.
Yeah, right. I understand. Thank you. That is, in fact, the answer to my question. And are men eligible for this payment?
Yes.
The
Right.
pay-
Thank you.
if it's been answered. Sorry, was it answered?
Yes.
Yes, okay.
So any person may apply?
Correct.
Yes. But as you'd understand, Senator McAllister, the overwhelming number of people in this situation are women.
I do understand. We have talked about the program being demand-driven previously. You'll confirm that, Minister. And you've budgeted around 73 million this year and the following year. You assess, I think, that you're going to be able to assist 12,000 women a year, roughly on that basis. How did you arrive at that assessment? What's the basis for assessing that there'll be around 12,000 people a year seeking support?
Mr Bennett might be able to provide more detail, but essentially we looked at applications for crisis payment, so total numbers of those, noting you can get that multiple times a year, data from the ABS around people who reported that they'd had to leave home due to violence. So we used a couple of data sources, but obviously it's an estimate, and part of the trial will be sort of finding out whether that estimate was right or not.
But Senator McAllister, as you rightly pointed out, it is demand-driven.
So if double the demand emerges, you will meet the demand. Ms Heffron-Webb, is it possible for you to table the analysis that you undertook to make that estimate, appreciating that it is an estimate?
Yeah, we certainly should be able to refer you to the data sources that we utilised. I don't know that there's formal modelling, but we looked at a couple of data sources, so we will furnish you with the detail of that.
Yeah, if I can ask it in this way, if the department is able to, can the department please table documentation that was developed to support the estimate of 12,000 women a year? Can the department please provide information about the data sources that were utilised to develop the estimate? Thank you. I just want to go back to this decision, Minister, to rely reasonably heavily in the program design on vouchers. And the reason I'm asking is that I have had some feedback from service providers that their concern is that it creates a situation where a person may not feel in control of their own circumstances. And you've explained to me, and I appreciate the explanation, that the basis for building vouchers into the system in the way that you have is to mitigate any risks of financial abuse, or to create options to mitigate risks for financial abuse. Can I just confirm that you did receive advice about the risk of financial abuse being present in these circumstances, and from whom?
Well, obviously, financial abuse is one of the new and emerging areas that we have been doing quite a lot of work on, as you'd be aware, obviously, with your involvement with the plan. But we don't have, and have not sort of impressed on Uniting Care, that we have a preference for vouchers as opposed to cash. What we would be seeking to do would be to use the expertise of Uniting Care to assess the situation and work with the individual in relation to what best fits their circumstance. We have no view about cash, about a preference for vouchers. So I will certainly follow that back up, or Mr Bennett will follow up with Uniting Care around that, because that is not the position of the government in relation to this payment.
Okay.
And as well, not the design element of it. It may just be something that Uniting Care, as a matter of course, because they do deal with domestic and family violence victims regularly, it may be something that they have sought for the reasons that you also pointed out around financial abuse. So I'll follow that up and I'll get back to you offline.
So essentially, it's a recommendation from the provider about the structure.
Well, I
of the
want to check
program.
that because of what you've just said, because it is certainly not my understanding that we have indicated any preference for vouchers.
Okay. Just a final couple of questions, I hope, around the selection of Uniting Care. Did this go to tender?
Yes, it went to a restricted tender.
Right, so it's a restricted tender. I note on the what is routinely called the Harradine file list, there is a document titled EF21 Social Welfare Development Reporting Routine Operational Transitional Measures Team Escaping Violence Program Grant Management, and it talks about grant opportunity guidelines. Is there a grant process associated aside from the tender?
Sorry, it was a grant. It wasn't technically a tender, so it wasn't a procurement.
It
was a grant process, but it was a competitive, restricted grant process. So we approached a select number of providers who have a national footprint that are involved with our emergency relief program, and invited them to apply under grant opportunity guidelines. So that's what that
Right.
is referring to.
My team may have just missed this, but were the guidelines published at any point? We couldn't find anything on the Community Grants Hub.
I believe it may have been an ad hoc process because of the time frame and because it's just a trial. So under the grant guidelines, where you're doing a short-term and a trial sort of project, you can do an ad hoc grant. And so I believe that might be why the grant guidelines aren't published.
Okay, can they be tabled?
I'll take that on notice.
Is there any public documentation you can point me to about how the program would work other than the material that's on the provider's website?
And the budget material, I'm not aware of other material.
I would be interested in understanding how the number of service providers that were invited to compete for the grant.
I'm just checking. Mr. Bennett might have that.
So 7 organisations were contacted.
And how many responded? How many submitted an application?
Can we take that on notice?
Yeah.
I'm just not sure whether that whether we're allowed to disclose that, whether the organisations would want us to disclose how many applied. I could be wrong.
Look, Chair, I can see where this is going in the take things on notice, and to save everybody the time, I will, and keep the Chair happy, can I please ask that the department provide the documentation that was provided to eligible applicants for this grant, the documentation that was provided to confirm the grant with the successful applicant, and in particular, I am interested in understanding the performance standards and the KPIs, whichever terminology you presently use, that have been put around the grant to secure performance.
Yeah, we'll get you as much as we possibly can.
Okay, thank you very much. Thanks, Chair. I appreciate it.
Yes.
Minister, I understood, and I'm sorry I missed this, that Senator McAllister started off with a constituent issue.
So in Western Australia, yeah.
Yeah, I just want to understand that or someone is following that up.
Yes, yes. So I asked Senator McAllister, understanding that obviously you don't want to disclose who it is. I don't know whether it's you or whether it's you from Western Australia, but I would be very keen to get to the bottom of this situation because clearly we don't. I don't want it to happen again.
But does that mean someone from your office will follow it up?
Probably on me.
Yeah, sure.
Okay.
Yep.
I just wanted to be very clear on where the status lay. That's all.
Yeah, sure.
In whose court the ball lies.
Yes.
Okay. I will leave it to you. You contact me directly. You've got my number.
Sure. Thanks.
Thank you very much.
Chair.
We'll now turn to Senator Waters.
Thanks very much, Chair. Thanks, everyone. Just sticking with the escaping violence grants, of those 7 that you said were invited to apply for the grant, how many of those were religious organisations?
Senator, I'd probably take that on notice. The 7 that were approached were in the operations within emergency relief, and I would just need to go back and have a look at what would be classified as religious.
Thank you. If you are able to do that while we're in session today, that would be really great. Thank you. Before we were speaking, I was asking the Minister about the victim survivor consultation process with the National Plan, and the Minister was partway. She was consulting with a group of victim survivors, both in the development of the National Plan and intended to continue through its implementation and operation. And my question was, will the Minister be finalising that such that there is in fact an advisory group of victim survivors?
Yeah, thanks very much, Senator Waters. In response to that specific issue, we have added. I was telling you about the group victim survivors who I have met with recently, an amazing group of over 20 women who had extraordinary stories to tell. We've subsequently invited the spokesperson for that group to join the NPAG, so that we have a specific and dedicated spot on the NPAG for that group. And it is my intention through Women's Safety Ministers is to put forward a proposal for a formalised consultation and reference to victim survivors as part of the ongoing sort of operation and implementation of the plan. But as this is a co-design process, I'll be taking it through the formal channels of taking it back through Women's Safety Ministers, but I intend to put a proposal forward for a formalised sort of ongoing consultative role and information and informative role of victim survivors, and using, amongst other things, this group of amazing women who came forward and have put their stories on the record for us.
Thanks, Minister. When do you intend to put that proposal to the Women's Safety Ministers?
I believe, I'm not sure whether we've got a confirmation of the next date for the next meeting, but my understanding is in November.
Late November. Yep.
Okay, thank you. That's going to be one of my questions. When is the next meeting of the Women's Safety Ministers Task Force? Is that the same grouping? Yes. So was that November, did you say?
Yeah, November.
Okay, and is there an agenda for that meeting as yet?
Not at this stage.
Thank you.
But clearly, Senator, one of the most important things that will be addressed at that meeting will be the draft of the next National Plan to End Violence Against Women and their Children.
Yes, thank you. And hopefully getting the money out the door to frontline service providers, also hearkening to our earlier discussion.
Hopefully that'll already be done.
Indeed. Segueing back to the Women's Safety Summit, what feedback was requested or received from participants about the way the summit was designed and delivered?
So we consulted with the National Plan Advisory Group and the Aboriginal and Torres Strait Islander Advisory Council on the summit program, the sessions and the suggestions for topics for panels and roundtables. We also consulted Women's Safety Ministers for key themes. Obviously, when we were required to move it from a face-to-face to an online summit, we had further check-ins with members of our advisory bodies, as well as a range of other stakeholders, just trying to ensure that we could make that work and work effectively, and that it could be accessible, and that we had sort of all the right infrastructure in place.
Thank you. Now that the summit is done, as opposed to the preparation for it, what feedback have you received about the summit? And have you asked for any, or has it been proffered?
I'll let the agency answer from their respect. Overwhelmingly, Senator Waters, we've had very positive response from people. I think obviously there's a very strong expectation around the embedding of many of the recommendations from the summit statement. Forming a strong structure and framework around the next national plan. I think there's overwhelmingly people have I think felt that it was an extremely useful tool in the consultation process. I mean, obviously we're all bitterly disappointed that we weren't able to hold it in person because, as you know, when you do these kinds of things, half of it's around the fantastic presentations that are done formally, but the other half of it's the opportunity to network behind the scenes, which unfortunately is missed in a virtual situation. But very, very positive. But clearly now we need to make sure that the plan reflects the outcomes that have come from all of the various consultation methods that we've put in place to develop this plan. And very comprehensive consultation that's gone to it under some pretty difficult circumstances, as you would be well aware.
Okay, I'll just put on record that I've received the opposite feedback, but
please provide that feedback to us, Senator Waters. I'm not somebody who only wants to hear good news. I'm more than happy to receive your feedback as to things that.
Farcical was the word that was used the most often. Anyway, I'll write to you separately about that. Just one last question on this line of questioning, then I've got a handful of others which I'll try to move through as quickly as possible. On Monday, the Office for Women indicated that a stocktake or a gap analysis of women's economic security initiatives was tabled at the meeting in August of the Women's Task Force, but that analysis was National Cabinet in confidence. Now, obviously, the position of the AAT is that there is no such thing. Will those Women's Task Force documents be provided, or will they be withheld?
Senator, I'm the Minister for Women's Safety, not the Minister for Women's Economic Security. These questions are probably best directed to Senator Hume.
Okay, right, I'll do that. Let's hope that she's wanting to put that in the public domain. Now, on respectful relationships, the line was offline for many a year, and if my book feed is anything to go by, it seems they are now back online. When did the government, if that's correct, when did the government sign off on that? And were there any stipulations made about content or ongoing government oversight?
I'll let the agency give you some detail around the process that we went through with Our Watch, and can I acknowledge what a positive process that it was with Our Watch, because obviously we are always very concerned and very focused on making sure that any material of this nature that is directed is age appropriate. And so the formal mechanism that was put in place through the consultation process around that material, was very thorough. But I'm happy to, if Mr Bennett or Ms Heffernan-Weft would like to give you some specific details around how that process was put in place to ensure the age appropriateness of the material that is contained on the site.
Thank you. I'm particularly interested in any sort of ongoing oversight or government parameters that have been placed and can use, create.
Senator, sometimes you coming through, there's been an odd word miss. I'll try and answer what I thought you asked. In terms of the process that was undertaken, we worked with Our Watch, and Our Watch went through a process where it had the University of Melbourne's Youth Research Centre consider the content for different age groups and different points of developmental stages. They also worked with Quantum Research to inform the future direction of the brand and understand the direction that the content should go as it goes forward. So, as you mentioned, Our Watch has been reinstated from the 9th of September. As part of that process, the content is orientated towards an age group that is 14 plus, and as part of that process, as you go into the website, there are various points associated with reflecting what is the target age for the content.
Okay, thank you. So is there any ongoing oversight of that content by government?
Well, we work with Our Watch constantly associated with the development of the website as we go forward, and as part of that process, we would have ongoing contact with Our Watch.
Okay, but are you telling them what they can and can't post, or do they need to make that decision given that they're the expert?
I wouldn't use the expression of we tell them what they can and cannot post, but as part of the Our Watch has the line through funding from government. We work with them, and this is part of the process that we have associated with the materials that are being developed. So I think.
Do you check and clear the posts before they're made?
Senator Waters, if you're suggesting that the department or myself is making decisions about what goes up and what doesn't go up, then that is not the process. That's not the process. However, you know, I remain very engaged, and you know, if I thought something on the website didn't seem to be age appropriate, I certainly would raise my concerns with Our Watch, as I would expect the department will as well. You know, but the process that's been undertaken over the period that the line was down, I think it was a very thorough and very rigorous process that enabled us to, I suppose, everybody to have a rethink about the clarity around what was age appropriate on this website, because it is a valuable tool for young people, and we wanted to make sure that the tool was meeting the expectations of, you know, whether it you know, be you know, providing the kind of information that children or young people want to engage with, making sure that it was age appropriate, and you know, obviously their families were happy with the information that was contained, that the experts in the field had run their eye over it. So I think, you know, the process that has occurred has been a very, very rigorous one, and we look forward to the line being an ongoing tool for young people to be able to get information about this really important issue.
Thanks, Minister, and thanks for the officer there. If you could provide me on notice with which details you can about the process, that would be very helpful. I've noted that you said it's 14 plus now, and we talked in last estimates about the process for educating and informing younger people about respectful relationships and consent and all of these vital concepts to keep them safe. You advised at that stage that the department was in the process of commissioning research to inform new programs for young people, I presume that means under 14, on consent. Has that been commissioned? Research, and if so, from whom?
So, yes, there's been a piece of developmental research undertaken. I might just see if our comms communication colleagues are here. Sorry, I just don't know the name of the company who undertook the research. It would have been one of the panellists that we use for developmental research for communications. Mr. Hudson's coming to the table.
So, Senator, in terms of the progress of that particular piece of work, as Ms Heverin-Webb indicated, initial desktop research has been conducted between June and July 21, and we have conducted in September 2021 initial developmental research, and we're now reviewing that information we've been provided in order to make recommendations about next steps to government.
Okay, do you have a time frame on developing material that will be useful for under 14 about respectful relationships and consent?
So, obviously, pending the review of the information we've been provided and pending decisions of government, we'd estimate that during 2022 we'd undertake that work. But I don't have a more specific date than that, I'm afraid, Senator. It's still in the early stages of that, of understanding the issues to inform the sorts of communication approaches we should take and recommend to government. But we would anticipate that the outcome of that work would be delivered in 2022.
Thank you. And has any work been done as part of the ACARA review, liaison consent training within the curriculum?
We haven't been involved in work with ACARA. The Department of Education may have.
Okay, so you're not into any of that curriculum-based respectful relationship education?
So that's a measure that sits in the Department of Education for implementation?
Yes, for implementation, but for the design of the content and updating it and going collaboration.
Yep,
No?
Senator, I can confirm that I work very closely with Minister Tudge on this particular issue, as well as obviously broadly consulting with the sector around this particular issue, because as you rightly point out, there is a very close connection around respect and issues that drive domestic, family and sexual violence. And so this is a particularly important early intervention prevention measure, making sure that young people understand what respectful relationships are. And certainly through the Stop It at the Start campaign, we have over various iterations of the campaign sought to make sure that we are focusing and targeting our messaging to make sure that we are addressing this issue with young people through that, but we also acknowledge that consent and respectful relationships in the being taught through schools is also another very important means by which we can hopefully stop domestic, family and sexual violence from happening in the first place.
Thanks, Minister. I'll take that up with the Department of Education for the detail. Two other things I'll whip through very quickly. The CEASE funding, the Coordinated Enforcement and Support to Eliminate DV trial, you allocated $4.2 million to gather data on perpetrators' use of violence and focus on deterrence. In a response to a Quan, you said that 4 sites would be selected in consultation with the states and territories. Have they been chosen yet? And is the trial still expected to commence this year?
The sites haven't been chosen yet. We've entered into an agreement with ANROS, who are implementing the project in consultation with the AIC. I understand there's been discussions with various states and territories, but in terms of site selection, that hasn't occurred yet. And so I guess it depends when the sites are selected as to when the trial will commence.
Okay, and I've just got a message here from the Chair. Chair, I've probably only got about 2 more minutes, and if that would be okay for me to just knock that off and I'm done.
Is that 2 more minutes or 2 more questions? If it's 2 more minutes, that's correct, yep.
2 more minutes.
Yep, correct.
Thank you.
That's right, yep.
Okay, well, I'm not too sure whether the trials will still commence this year. Could you take on notice, please, whether there'll be interim reports? And then my last questioning is the 18.9 million allocated.
Senator Waters, as a piece of side advice in relation to that CEASE program you were just asking, we've had strong interest from the South Australian Police in regards to it, but we'll certainly get back to you because we would very much like to have the program commenced this year because it has been so tremendously successful in another jurisdiction. So we're very keen to see whether it will work here in Australia.
Great, thank you. So the 18.9 million allocated to the Institute of Health and Welfare to create a nationally consistent data set of sexual, family and domestic violence. Obviously, it was allocated in the budget. I asked the Institute last night and they're still in contract negotiations with the DSS. Can you confirm whether there's any time frame for finalising that so that the Institute can start that work?
So I believe that we have provided a letter of offer to the Institute. I'll just confirm with Mr Bennett, but that's my memory.
I'm not quite sure whether there's been the letter of offer, but certainly there's been constant contact associated with working up the proposal with AIHW, and it is taking into account what the activity is proposed. It's running on track. There are no issues that have been identified, and we would expect that those arrangements would be finalised in the ordinary course of events.
All right. Perhaps you better pick up the phone to them because they seem to be labouring under a different expression. Thank you very much, Chair, for the length of the call. I'm finished now.
Great, thank you very much, Senator Waters. So we're going to go to Senator Thorpe and then Senator Lyons, and then I expect us to suspend outcome to later in the day and then move to Services Australia. Senator Thorpe, are you available? Senator Thorpe, are you available? I might then go to Senator Lyons if you're ready. Yep.
Be super quick. So, Minister or the Department, Wiyana Thangi, how will the findings of that report be incorporated into the Women's Safety Summit? That's my first question. And my second question, I'm happy for you to take this one on notice, is what's the planning for the First Nations group and their very strong call for their own standalone domestic violence strategy?
Well, as you'd be aware, June Oscar participated in the summit, and the findings and the voices of the women that made up that report that the commissioner, the commissioner did was certainly very loudly heard. We will be working through the Aboriginal and Torres Strait Islander Council that's been established, which is chaired by Sandra Creamer, but also with people like June Oscar, Marsha Langdon, who's absolutely recognised as an expert in academia in this space, to make sure that the voices of Indigenous women and Indigenous people are embedded in the plan that is the action plan that is specifically designed to respond to domestic and family and sexual violence in Indigenous communities and for Indigenous people. So I'm actually meeting with June Oscar next week along with Maurice Payne, and I understand that the council has already met and are undertaking a workshop around how they would like to proceed to design this action plan that is particularly targeted at them. But I don't know whether Ms Heffron-Webb or Mr Bennett has any...
I guess I was after a specific response about how Wiyana Thangi report is incorporated into the Women's Safety Summit.
The Women's Safety Summit is now concluded, and so we're now working on the development of the next national plan.
Development part.
Yep, and as part of the decision, following the consultation, the decision has been made to have a separate action plan that's got real and tangible outcomes on the ground to address issues that face Indigenous people in Australia around this particular issue. And so we will be seeking to work with the council, but also, those people like June Oscar and who is at the forefront of this, and as you rightly point out through her book, I won't insult the Indigenous language by trying to pronounce it, but our voices, their voices, but the women's voices that she spoke to. Obviously, it will be up to that council and the consultation process that operates around that council about how they wish to proceed, but we certainly, would expect that there be a strong linkage to those voices in the development of that.
But I mean, correct me if I'm wrong. This was done through the Commissioner Oscar's role, and it's a formal report to government. I understand there has not been a response to that report.
So, Senator, the report obviously encompasses a range of issues beyond safety.
Sure.
NIAA has carriage of advising government about responding to that report. We've been working closely with them, obviously, to progress the findings of that report in the women's safety domain across the work of the national plan. There's material in there about women's economic security. NIAA is working with other agencies on those elements. No, there hasn't been a formal government response, but we are taking the outcome and the findings of that report into consideration in the policy work we're doing.
All right, thank
and
you.
certainly Minister White will also be attending the meeting that Minister Payne and I are having with June Oscar next week to make sure that, that we have a proper co-design process or ensuring that the appropriate people are there.
Sure, thank you, thanks.
Thank you, Senator Lyons. We'll turn to Senator Thorpe and then we'll move to Services Australia. Senator Thorpe, are you on the line now? Okay. We're just trying to reach Senator Thorpe, but I have been communicating with her, so she's...
Hello?
Hello, we can hear you, Senator Thorpe.
Great. Thank you for that, Chair.
Over to you.
And thank you, Minister. My questions are in relation to the First Nations National Safety Plan. For a First Nations National Safety Plan to be self-determined, Aboriginal and Torres Strait Islander women, community-controlled organisations, the Family Violence Prevention Legal Service and their elected peak bodies must lead its development. Minister, will the government facilitate a self-determined process as per the principles outlined in the Closing the Gap process?
Thank you, Senator Thorpe. Well, certainly one of the very key principles that operates across everything that we do is embedded in the Closing the Gap statements, and so of course we will be making sure that that what we do is consistent and with other decisions that have been made in conjunction with the leadership group. So we will be working, obviously, as I said, with the Aboriginal and Torres Strait Islander Council, but also community leaders to make sure that this safety plan, as you refer to it, action plan, that is the specific Aboriginal and Torres Strait Islander action plan, is reflective of what Australia's Indigenous people are desiring to deal with this very important issue.
Thank you, Minister. As a survivor of family violence who has a daughter trapped in a family violence situation as we speak, and many, many other sisters and cousins and Aboriginal women that I know trapped in family violence situations right now while I ask you these questions, a hand-picked advisory council is not self-determination, Minister. And a government-determined process is not self-determination, Minister. So how does the government propose to ensure that Aboriginal and Torres Strait Islander victim survivors of family violence and the Family Violence Prevention and Legal Services delivering frontline services? And can I also remind you or tell you that GIRA, being the Family Violence Prevention Legal Service in Victoria, helped me escape family violence, I wouldn't be able to even ask you this question today, Minister, without these services on the ground who are struggling for funding and a seat at the table. They're not even included in the hand-picked advisory council that you are mentioning and speaking very highly of. So how is your government, based on what I've just said, real-life reality, how is your government going to support these frontline services, particularly family violence prevention legal services, to deliver more services across the country to help and support people like me do what we want to do as free black women?
Yeah, well, thank you very much, Senator. And one of the things that I think came out really loud and clear through the consultation and particularly through the summit was that there was a desire for the capability and the capacity building within the Aboriginal controlled sector in terms of making sure that that happens, so that a move towards, as you rightly point out, the self-determination part of it was so tremendously important. But I would say, Senator, that the fantastic group of people who have agreed to work on the Aboriginal and Torres Strait Islander Council, the people who participated in the summit, the people like June Oscar and Marsha Langdon, the people that have engaged through the whole consultation process, people like Emily Carter, who is with the Family Violence Legal Service. There are so many fantastic people who have come forward to put their ideas on the table, but of course, not everybody can be on an advisory council, but that's not to say that the advisory council and the consultation process that sits around the development of this specific Aboriginal and Torres Strait Islander plan can't be informed by input from people and the fantastic service providers that you rightly have just mentioned. So, we are absolutely committed to stand side by side to make sure that we make this process a process that Australia's First Nations people want, and it delivers the outcomes that they're asking for.
Thanks, Minister. And I kind of believe you, but not entirely, because you haven't got the National Family Violence Prevention and Legal Services Forum on your advisory group. And to be honest, I'm not taking away anything from the people that you've handpicked to put on your advisory, but tell me why you've excluded the National Family Violence Prevention and Legal Service Forum. Like, you can't exclude people from this, particularly those that are fighting on the ground every day and who have told you personally and throughout the summit that they want to be on your advisory group. I just don't understand why you wouldn't include this very, very important frontline service group. And could you please tell me why you've excluded them?
Well, Senator, we haven't excluded them. Emily Carter is a frontline service provider from the Family Violence Legal Services. She is a member of that organisation, and she is also a member of the Aboriginal and Torres Strait Islander Council. So they are represented on the council.
Thank you, Minister, and I appreciate that. Maybe we need to get some clarification from those groups, about, well, who is representing who, because I'm hearing differently, and I'd really like to work with you on how we can ensure that this is grassroots and has all the right people around the table. And in saying this, will the government commit to resourcing a national Aboriginal and Torres Strait Islander women's gathering or summit to bring women and services together to set the agenda for the national plan? Because, we get overshadowed by mainstream processes and summits. We'd like to have our own, given everyone's screaming out that family violence is such a problem in all of our communities that we want to address. So, Minister, can you please tell me if you'd either commit or will you consider in bringing together Aboriginal and Torres Strait Islander women from around the country to inform you and set the agenda for the national plan going forward? It's a bit like you can't speak about us without us, right?
Well, certainly, Senator, that is the purpose of the Aboriginal and Torres Strait Islander Council, is exactly your last sentiment. But look, I would be delighted to meet with you to discuss your views on this particular issue. And equally, I'm sure that the Aboriginal and Torres Strait Islander Council would be more than happy to hear your views around this particular issue as one of their representatives in this place. So if you're willing, I will arrange a meeting where we can sit down and work through how we can best facilitate the outcome that clearly we both want going forward.
Fantastic. Minister, I'm really, really pleased to hear that, and I won't even ask any further questions because I'd rather take those questions to that meeting. So I won't have any further questions. I appreciate your response.
Thanks, Senator Thorpe.
Thank you
very much, Senator Thorpe. So that suspends our consideration of outcome 2. We will return to outcome 2 later in the day or in the evening. So we'll now turn to Services Australia.
Great, Alexander.
And we will attend to whole of portfolio and corporate matters and outcome 1 in Services Australia. I welcome the Minister for the National Disability Insurance Scheme and Minister for Government Services, Senator the Honourable Linda Reynolds. I also extend a welcome to Ms Rebecca Skinner, Chief Executive of Services Australia. Minister or Ms Skinner, would you like to make an opening statement?
I won't, thank you, Chair, but I believe the CEO does.
Has that been, Ms Skinner, has that been made available to the
Yes, it has been made available.
Great, excellent. So we'll circulate that to committee members now.
Yep.
Ms Skinner.
Okay. Thank you.
Honestly, we've only got...
No.
Because of the Minister's
having been in
strict
your
availability.
position, I know what you're about to say.
Yeah.
So we will just wait a few moments, Ms Skinner, so the document can be in front of us, so then we can read and hear from you at the same time.
Well, I think our position was going to be just circulate it so we can refer back to it in light of the fact that because of the Minister's availability, we have a shortened, condensed program.
Let me just be clear about when is the tabling statement or the statement going to be circulated to? Is it on its way?
How long is the opening statement?
It's a few minutes, but if it's tabling, it's 1 week late.
So just for the interest of witnesses, the order of the call that I have at the moment is Senator Gallagher, Senator O'Neill, Senator Hughes, Senator Green, and then I have some questions later as well. So we'll begin with Senator Gallagher.
Thank you very much, Chair. I have some questions about the closure of the Centrelink Service Centre in Braddon. People can get the right officials for that. That would be excellent.
Yep.
Okay, so can someone tell me who made the decision to close this service centre and when?
Senator Rebecca Skinner, CEO, Services Australia. On advice, in my opening statement, which you will receive, I talk about the changing nature of the services that we need to provide to the Australian people, and it's very important that we continue to contemporise the sort of services that we have, and as part of our ongoing and continual review to make sure that we are able to provide services where our customers are, we've provided advice to the Minister that we should close the Braddon Service Centre and that we can amalgamate that with an enhanced and service offer from our Gungahlin Service Centre, and remains with 96% of all people in the Canberra region being within 7 kilometres of a service centre, and actually that sort of exceeds the general average distance that most Australians are, which is about 89% of people are within about 7 kilometres of a service centre. We have, as the agency spokesperson has also said, it's a very changing nature of the demographic around that Braddon area. And one of the benefits of the sort of work we've been doing in adjusting our service offer is the opportunity for us to tailor our services to meet the community needs in a more sort of specific way. So, for example, as you'd be aware, a lot of the public housing and things like that, where we had a large customer base, has now been, that demographic has changed, but we do have particular customer groups, for example, at Ainslie Village, where we will provide, and we have in the past, and we will continue to provide a very tailored and dedicated service that goes out to that centre on a sort of fortnightly basis. Of course, because of the COVID situation, we haven't been able to do that service, but we have done outreach services to that facility through the company or the body that runs it.
Okay, so there's a lot to unpack in that. Yep. You do. So, is an ongoing outreach service to Ainslie Village part of the consequence of shutting the Braddon office? You're going to put in a dedicated outreach service to Ainslie Village ongoing in a permanent way?
We have, my understanding of the history of the organisation is that we have always had a tailored service that goes there. We're going to ensure that that continues.
Right.
The other point I would make, some of that is to also help customers engage digitally, and on top of that, we can also provide some of our enhanced service offers around online appointments and things like that, virtual service centres, so that we can support customers with specific needs accessing the sort of specialist staff we have across the country.
So my original question was, when was the decision taken and by whom? So I think from your evidence, the Minister took the decision on advice from you. When was that decision taken?
Senator, I'll have to, I don't think I've got the actual date. The current lease was ending on the 28th of February, and we understand as part of that there wasn't a sort of an opportunity for us to remain in that centre.
Sorry?
I think that there's not
so
a...
You were going to be moved out by the landlord,
Well,
were
what
you?
we do, I think it's really important that we are not consider ourselves and our service offer based around lease dates and things like that. So the lease was coming to an end. There was an opportunity to review at that point whether we needed, whether the service offer in that location, in that sort of facility was appropriate.
Okay.
And given the lease was coming to an end, we took the decision based on all of our research and study about where the customer set is. So at the end of that lease, we have not entered into a discussion with the landlord to stay.
Okay, so sorry to cut you off, it's just we have 15-minute blocks and the Minister is only available for 4 hours.
Sure.
So if we're going to have long answers, we're going to be having to have a long recall. But so you weren't, the landlord didn't say you're not welcome. You made the decision to leave in terms of reviewing the lease that was coming up on the 28th of February.
Yeah.
Yep. Okay. So... Okay, I think I misheard you say that you weren't able to continue on. Okay, so in the letter, I think I've seen a letter where you cite, the advice is you cite a 40% reduction in the Braddon Service Centre. Mm-hmm. Can you just explain 40% reduction of what? What to what?
So
what is that a measure of?
It's a measure of how many customer contacts we have coming into the centre. So between 2016, so I think it is also important not to compare this year and last year, for example, where there has been restrictions on people's ability to get going. So between 2016 and 2020, we have seen a 40% decrease in the number of customer contacts that come into the centre.
Okay.
I think it's important that we have also, of course, had significant reductions while there's been the COVID restrictions.
Sure.
And at the same time, it hasn't inhibited our ability to service those customers.
Yeah, sure. It's all right. I'm just trying to get some information. So 40% of what, though?
Oh, well, if we take at the data point would be how many contacts you would have at the Braddon Centre in, let's say, take at the beginning of 2016, and then over that next 4-year period, we have a 40% decrease.
Okay, but can you give me the number of what it?
I don't have that with me, Senator.
Okay, because it could be 40% of 10, or it
No, I
could
can
be
assure you
40%
it's
of
not-
400,000.
I
I don't know.
understand that. It's not. I can assure you it's not 40% of 400,000, but I will get those
well,
details for you.
That's why it's sort of relevant though, because that 40% doesn't necessarily give me a picture. Okay. So you're, is it only on numbers of people coming in or contacts? Was that the only measure?
No,
What
Senator.
were the other measures,
the other
if
measure,
there were any?
So
Yeah.
we take a collective view of how the broader community can be serviced and is serviced. So in this case, we have service centres, as you would be aware, in all of the other all of the town centres and
All of them
in
except-
Queanbeyan. In Queanbeyan.
Except north, instead of the city centre, which is a bit odd to me. But is your advice that Canberra, compared to the nation, is over-serviced?
My advice just is that the current footprint has an additional, which is high. It has got higher service access to those centres than most metropolitan centres in Australia.
Probably because of the way the city's planned.
Quite possibly.
You would imagine, because
quite possibly.
They are sort of town centres rather than a built-up urban, like Sydney or Melbourne. It is quite differently planned.
And certainly, and I think the original plans would be based were certainly in place prior to things like the light rail access to Gungahlin.
Okay. Do you know what the people that were using the Braddon Centrelink, where were they coming from?
I think mainly the customers who had high vulnerability and complex needs were in a great deal of the density of public housing that was in and around that city centre, the civic area.
Yeah, and that wasn't the question I asked though, but the people who are currently accessing Braddon, where are they coming from? They're not coming from Tuggeranong or Gungahlin, are they?
I'll see if one of our other witnesses has any of that particular demographic data, but I think the point I've made is that we do look at the measure of how many percentage of people are within 7 kilometres of a service centre, and with the Braddon closure we're still looking at 96% of everyone in the Canberra region being within 7 kilometres of a service centre.
But you would
But I can take on notice exactly where those customers are coming from, and they do come from a range of places, including some people who will very readily go to the Gungahlin Centre. Others would likely go to Woden.
It would be useful to know where I would imagine most would be coming from that inner
Yes, we
city-
do all that demographic study.
city
I don't
area,
have that
yeah.
with me though, Senator.
I mean, and again, the ACT is quite different to other major metro places. Like, there aren't too many where you would have, essentially 7 kilometres of nothing, of no, if I'm thinking about heading out from Braddon to Gungahlin, unless, it is quite difficult to access that. I guess the tram's there now for people, but it is quite different to other major metro areas,
I think
in terms of accessing.
Braddon it is a retail and restaurant area generally now. The parking for people is extremely poor. So the accessibility of Braddon is not in the favour of people who we need to support either.
Okay, so the accessibility formed part of the test, was it?
Yes, Senator.
Was there anything else? So we've got contacts were down, the lease was up, accessibility was down.
Accessibility is down. The customers aren't really there compared to what they were before, which is the decrease in the number of people who come into the service offer. The ability for us to provide services also in other ways, and a range of those factors. I can take on notice additional detail of the sorts of things we examine, if you like.
Yeah, I would like that. And did you assess whether a smaller footprint, you know, was possible in, you know, if you didn't need a full service centre. I mean, do you have other models that you could, just to keep a presence up in the area?
We certainly have access and agent types of opportunities, but again, in this particular case, that wasn't seen as being necessary given the other density of service and the other ways in which we can make a service offer to customers, including the Ainslie Village, for example.
Rightio. So you do have sort of ways of having like a smaller presence, but you assess that as not being needed either.
Yes, that's right, Senator. Yes.
Is there any, could you provide as much information as you can about the assessment that goes into closing down a service centre? I presume it's the same everywhere you go. You apply the same assessment criteria?
Yes, we have a very extensive study of where customers are, what sort of services they need, what sort of change in demographic we expect over time, where the current services are. We focus on how we can provide the customer service to the best of our ability, as opposed to being locked into an idea that just because there's bricks and mortar today, that 20 years from now that's the right bricks and mortar. We want to make sure we keep the service offer contemporary.
I don't think anyone's suggesting that. I mean, I think the question is about how you ensure that vulnerable Canberrans are still going to be able to access a Centrelink service, considering the importance that Centrelink plays in their life. I'm not questioning different models of service provision.
Yeah, and we are as committed to that, Senator.
Yeah. So was the lease going up? Like as you say, the Braddon area is changing with, you know, the nature of it has changed almost completely over the last 10 years or so. Was price of the lease a factor?
I would need to, I'm not aware of the lease costs in that sense. I could ask one of the other witnesses if you would like particular detail now, or I can take that on notice.
Are you making any, sorry. Oh, sorry.
Senator, it's Grant Tidswell here, Deputy CEO, Strategy and Performance. Ms Skinner has outlined, you know, the essential criteria. As you know, Braddon, retail, entertainment district, landlords, looking at other alternative options and opportunities. And so in that context, we would have expected, you know, an increase in lease costs. It's too big for our purpose. And as the CEO has outlined, 40% decline. The other factor that you know well is that the Territory Government has moved more of its services to the town centres. So Access Canberra's down the road. It's no longer in you know, civic in that sense. So we're following a similar pattern. The other indicator that you mentioned was, where do the people come from? We're quite surprised a lot of people coming from Belconnen to go to Braddon. So that didn't make much sense to us in that way.
Chair, can I just clarify something that's been discussed? I think there was some inference that, as the Minister, I'm the decision maker. I'm not. I get noting advice from Services Australia on all of these matters.
That's my error. Sorry, Senator.
Well, sorry, I took it, Ms Skinner.
Yes, no, that was my error.
On advice.
On advice. Yeah, we've advised the Minister that we're closing the centre.
I note,
but as Minister, you could easily note on that brief, as I've done it in previous lives, I do not accept this advice. So there is a...
No, absolutely. So in this case, it is a noting brief. I noted it and I was very comfortable with their decision for all of the reasons that the CEO has outlined.
Okay. Did you note that
apologies, it's Sandy Mamo, Acting Deputy CEO for Customer Service Delivery Group. I've just had a quick look into those, a couple of those questions and just confirming Grant Tidswell's comments. We also do get a number of customers come from, typical workers in the city may use that service. But they're often people that, potentially live in a place like Gungahlin or Belconnen, just confirming, as Grant said. So they are often swing between utilisation of either one of those centres.
Yeah.
And I do also have some numbers for you, yearly totals. So we're just looking at 15-16, for instance, and we had 58,175 customers coming through at that point. compared to the year 1920, 27,250. Now, I don't know if that adds up quite to 40%, but it is certainly evidence of a significant drop in the customer traffic that we've seen in that sort of, in the Braddon location. Thank you.
And it would include 1/4 in that, presumably, of the lockdown that existed, so that would impact somewhat in those figures.
Somewhat, but it has been sustained.
But that's
those
still
low levels.
30,000. It's not as if it was sitting there doing nothing, is it? Thank you for that advice. Can I just go, so are there savings associated with this, and what are they?
I'll just see if Mr Tidswell has some savings.
Look, Senator, I don't have those figures with me. Happy
Really?
to provide those on notice.
Okay.
It's part of a broader program of work. What we're trying to do is repurpose and reimagine the face-to-face network so it lives within the envelope of resourcing and capability that we've got. We're trying to, go right through the service centre network and put in a contemporary look and a better look and feel, greater customer experience. So it's all one part of a total package of reform and moving forward as we sort of look at the right shape of the service delivery network.
Okay. Well, I think, again, whatever information you can provide us on the repurpose and reimagining that you're doing, I mean, that your repurpose and your reimagining might be someone else's inability to access a service. So, I think it'd be interesting to know what the broader work that you are doing on that front. I did have a couple of questions about that, whether there was going to be more closures in Canberra, and now with Mr.
Tidswell?
Tiswell.
Yeah, Mr. Tiswell, whether you have other closures planned around Australia, and how are they going to be announced and when?
Look, we're looking right across the board at all of our service centres to try to get the right mix, and we're using kind of an evidence-based model to determine the right look and feel and approach and access, and looking at all the demographic factors, as you can imagine. Just like Braddon, communities change and people move. So we're looking at the best approach to have a purpose-built, fit-for-purpose delivery network that's modern and transformational. We have no more plans in Canberra. We're progressively going through the service centres in Canberra, and we'll be modernising them and making them more fit for purpose in this current age.
Okay. And when's that work going to be complete?
Our goal, which is very ambitious, is to try to get that finished by the end of 2023. As you can imagine, there's a number of sites to consider and to review, and often we have to rely on the natural flow of leaseholds and patterns. Now, in some instances, landlords, just like in Braddon, don't want us there, so we're challenged sometimes to find suitable premises around the country.
Okay. Well, I don't think I've got time to go into that anymore, but do you have a target then of how many of these service centres you will close down as part of that repurposing, reimagining work?
No, we don't have a target, Senator. We want to actually, as Mr Tidswell said, by the end of 2023, have a contemporary, strong service offer across the country, which includes face-to-face, to best meet the needs of the Australian people.
Okay. So you'll take on notice the savings associated with Braddon. What about any jobs for people who work there?
There are no reduction in positions. Those staff are relocating to Gungahlin as part of the amalgamation of the service offer.
Okay. And Minister, did you get any representations from Senator Seselja about keeping the Braddon Centrelink service centre open?
Did I?
Yeah.
Yes, I did.
Okay. And so he lobbied you to keep it open?
I wouldn't say, well, I'll have to go back and take that on notice, to having a look at the exact nature of the correspondence. But yes, he did contact me about it. And we have had discussions about it.
But you'd made your decision. Did he accept
that?
that?
As I said, Senator Gallagher, it was not my decision, but I know...
Well, it is in the sense that you didn't do anything. I mean, that is a decision in itself.
Senator Gallagher, as the CEO has said, Service Australia manage a multi-billion-dollar property portfolio, nearly 400 properties and 319 service centres. And as they've said, they are constantly looking a rolling series of properties that leases expire, having a look at how they right-size, how they contemporise through that process of service centres. And I was given a noting brief, I think in May, about the decision and the rationale that the CEO has gone through in some detail. And I think it makes perfect sense, particularly as in Gungahlin and Belconnen, the service centres there are being upgraded. And perhaps, Chair, I'd extend an offer, so if anybody on the committee hasn't seen the new service centres and how they've contemporised them to make them digitally accessible, they now make appointments. So the old Centrelink that some of us had been to, you know, the big old, you know, 70s, 80s, 19 buildings, which were quite confronting, perhaps, and old style, are progressively going. And so this is all part of that process. And having seen a number of these centres, I absolutely agreed with the CEO's and the organisation's decision.
There's still 30,000 around contacts that would have used Braddon that are going to have to go elsewhere, but your argument is it'll be nicer wherever they go.
Well, one of the things that I've been briefed on by Services Australia, and I've seen for myself, is that they are contemporising very effectively the service offering for all Service Australia clients. And you now go into the new facilities, they're smaller because obviously we don't have as many people coming in size, but they're really pleasant to walk in. So you go up and there's a concierge. If you've got an appointment, they will meet you, so they can go and have that appointment. If they haven't got an appointment, they will facilitate that then and there. There's online facilities that Services Australia staff can go and assist them with actually getting online. So it's just a very different service offering from the past, and that's what they're going to be doing, as I understand it, particularly in Gungahlin, where the Territory Government, I think has been mentioned, is now seeking to consolidate all of these sort of similar Commonwealth and Territory services. So it's more of a one-stop shop using the public transport available.
And so in your view, Minister, you're comfortable that and can give a guarantee that for those people that were accessing the Braddon Centrelink service, if they are unable to get to Gungahlin or Woden or Belconnen, that they will be able to access services in a way that they can do?
Well, Senator Gallagher, the majority of interactions are now online, and Services Australia are putting a lot of effort not only online but also on the phone. So there are millions of Australians who are supported both ways, I think pretty much every week. So not only have they got by phone, online, they still do have, as you said, it's quite hard for a lot of people around Braddon necessarily to access the current facility, whereas Gungahlin, the Territory Government has made it far easier for people to access public transport, including the light rail to Gungahlin.
There's also an Access Canberra services in Civic, like you can access. Not in Dixon, no, that one's gone. But they central Canberra is, you know, the heart of the city, and now there isn't a Centrelink office there. It is a place where a lot of people meet. But I guess the guarantee I'm after is for those that, you know, there was 30,000 contacts in that service centre, like that there be a guarantee that for those that they will be supported, even they're dislocated from Braddon.
Senator Gallagher,
they're obviously not using the phone or the online all the time because they've been around for years.
No, Senator Gallagher, I don't think you can make that assumption. Certainly, from my observation about Services Australia, is that people do access online through MyGov and through now on the apps, Medicare apps and others. There are hundreds of millions of calls every year, and they're dealt with very professionally on the phone, and people still do come in. So it's not an either or. Sometimes there are still people who like to come in personally for a whole variety of reasons, but there are many ways that Australians who need help from Services Australia can get it.
Okay.
I think one of the important parts of the new service offer is we don't want people wasting their time having to queue up. They can make an appointment and expect to be served at the time that they arrive at the centre, particularly if they've got some sort of more complex needs. And just in relation to things like those 30,000 contacts, They can vary from very, very straightforward, what we call express things. And just one day last week, I had a look at some data and, I think 9 people had been into Braddon. 8 of them had been in for an express purpose, which at this point in time is probably printing a certificate or dropping a document off. 1 person had been in for some sort of more complex requirement, which we could have assisted by making an appointment for them.
And Senator Gallagher, just on your point, it is a very important point in terms of vulnerable sectors in the community. And I know, for example, Ainslie Village is one such village, but Services Australia regularly do outreach as well.
Yeah.
So they don't just do
Ms.
outreach.
Skinner said that at the
so
beginning.
I think that's sort of important that they are very cognisant of that, not just in remote areas, but also in urban areas.
Yeah. Okay, thank you.
Thank you, Senator Gallagher. Just for the information of colleagues, the opening statement from Ms Skinner has now been circulated. So, Senator O'Neill.
Thanks very much, Chair. I'm interested in the closures of the kind that Senator Gallagher has been prosecuting for the state of New South Wales. And I know that there's been great concern amongst the community on the Central Coast for exactly the same sort of access reasons. And although literacy hasn't been mentioned too much, that is one of the significant disadvantages many people, the further away from the cities you go, seem to have. So I'd be very keen for a map and indication of closures and proposed closures across New South Wales. My questions go to a matter that I have been prosecuting for a very long time in this committee, and that is the matter of robo-debt. I believe the government still continue to call it Centrelink Income Compliance Program, but it's clearly resulted in approximately 347,000 Australians being pursued for debts that they did not owe, based on an inaccurate calculation of their income, totalling up to $1 billion. On the 14th of July, Services Australia advised that $726 million had been paid in refunds, and about 418,000 people had received a refund from their own government or had their debts zeroed. I'm interested in that language too. Their debts zeroed is words attempting to cover up the fact that this government illegally raised debts against its own citizens and was forced to repay or recant. The income compliance program has been subject of legal challenges. And on the 11th of June, very importantly, I note, in 2021, the class action was settled in the federal court with the Commonwealth agreeing to pay a further $112 million in compensation. This has been a disaster, and from a public policy point of view, Labor has been pursuing this to find out what's been going on and how the scheme was established. So, Minister, I'm calling for, once again, revised responses to all questions relating to legal advice and the income compliance program, which have been subject to rejected claims of public interest immunity during the Community Affairs Reference Committee inquiry into the Centrelink compliance program, and a copy of the executive minute to the Minister for Social Services dated on the 12th of February 2015, as referenced in the Commonwealth Ombudsman's April 2017 report into Centrelink's automated debt raising and recovery system, be provided to this committee.
Well, thank you very much, Senator O'Neill. And as the committee is aware, recently I provided an explanation in the Senate in relation to the government's claim of public interest immunity in relation to this matter. And this was in addition to the correspondence to this committee on the 10th of August, reiterating the PII claims made by my predecessor, the Honourable Stuart Robert MP. It has been long-standing practice of successive Australian governments of both political persuasions not to disclose the fact or content of privileged legal advice. In fact, I'd like to remind Senator O'Neill that your former ministerial colleague, Senator Joe Ludwig, told the Senate estimates that he would refuse to provide the Labor government's legal advice for the exact same reason that I have outlined. Now, just one other further point I think that is relevant, which I have already mentioned in my response in the Senate, is that the Federal Court on the 11th of June noted that there remains individuals whose potential claims against the Commonwealth have not yet been extinguished. And that, I think, is another reason.
No, sorry, Senator Kitching. The custom at this committee has been to do blocks of time, so I'll go to Senator O'Neill until she extinguishes her block of time, and then I'm happy to come to you on the same matter. Yes.
Thank you. And look, I'll take that question from Senator Kitching and ask, if you can't provide it immediately, how many claims in reference to your last point. But can I remind you, Senator Reynolds, although you have much used the Ludwig example, there are many, many examples now on the floor of the Senate of this matter being debated, and I urge you to acknowledge that the Senate has now rejected your PII claim on multiple occasions. And this is now hitting the point where it's absolutely obstructive to the work of the Senate on behalf of the Australian people. We're not talking about a few people here. Hundreds of thousands of Australians were served an illegal debt by your government. This is not an unreasonable request. Your PII claim, which you've restated today, has already been rejected on multiple occasions, and I call on you, Minister, to provide those answers to questions relating to legal advice, income compliance program, as requested previously, along with the executive minute that has been requested as well.
Senator O'Neill, I thank you for reiterating that again, and I just, again, reiterate the PII claim and the reasons for it, and the fact that the High Court itself, the Federal Court, has also acknowledged that there remains individuals who have potential claims against the Commonwealth and whose rights have not been extinguished. But in relation to the question that Senator Kitching asked, which you reiterated, I don't have the numbers, but I might defer to Mr Birra, who might have the numbers for you.
Thank you, Minister. Senator Chris Birra, Acting Deputy CEO for Payments and Integrity. 5,426 people have opted out of the class action.
Thank you very much. Can I indicate? Can I just finish and then I'll hand to you if you have questions?
No, you'll go back to the chair.
Okay, thank you. Perhaps, Chair, you might allow Senator Kitching to
That'll be a
ask some
decision
follow-up
for the
questions.
chair.
Yes, that's right. So, can I indicate, with the strength of the Senate having rejected the claims that you've just reasserted again today on multiple occasions, that the Senate will again reject your claims, and I urge you, against the trend of this government, to transparency and to provide the Senate with the documentation so that we can see what bad advice you received that allowed you to concoct such a scheme where you actually served illegal debts on the Australian people. We need to know. We need to know what you did.
Senator Smith, I'll take that as a statement rather than a question, because I think I've been very clear that we still, for the many reasons that I've reasserted the PII claim, including over 5,000 people who still potentially have a claim against the Commonwealth.
Thank you, Senator Reynolds. Senator O'Neill, are there any other questions?
Well, can I just say that claim, that the final claim that Senator Reynolds has just made was also rejected in the inquiries by
Thank you very much.
the committee, and I would encourage you to
Senator
allow
O'Neill.
Senator Kitching to
I'll
have
just
follow
remind
questions.
senators that the purpose of this particular process is for senators to ask questions and for witnesses to give answers. So I just encourage senators to refrain from making lengthy statements, providing excessive commentary or entering into debate. So I'm happy to repeat that as we go through the course of the afternoon and this evening. But is that the conclusion of your line of questioning, Senator O'Neill?
For clarity purposes, will you provide the documents that I have requested, Senator Reynolds?
I think I have been very clear, and I've answered that a number of times, about the reasons that I've reaffirmed the PII claim.
So that means no?
Yes.
Thank you. Senator Kitching.
Is Mr Tidswell here?
He's online.
Senator, yes, he is. But if it's regarding employment matters, if you could direct the question to me.
Is Mr Tidswell a contractor?
Senator Kitching, you will have to speak up.
Is Mr Tidswell a contractor?
Senator, yes, Mr Tidswell is working with Services Australia at the current time under a contract. He returned to the agency at the beginning of as the COVID situation arose at the beginning of March last year. We are very grateful for his 40 years of experience in social security, welfare and justice, and being prepared to come back from his his work to work with us at a time where we're in an unprecedented situation regarding the sorts of demands on an agency. And in particular, we had, in my view, a relatively a new leadership team in the organisation, and the collective leadership of the organisation, including the contributions that have been made by Mr Tiswell, have assisted us to steward the agency delivering the sorts of outcomes for the Australian people that we have done over the last 18 months. He has filled a deputy role for us. So not only has he provided an advice role, he has provided mentoring and guidance for the development of other public servants.
Are you able to table the position description?
Absolutely, Senator. I don't have it right now, but I have no problems with tabling the role that he performs for us.
And was that with so you created the position description for the employment agency?
Senator, he is directly contracted to us. I don't have a contract with an employment agency. I have a contract with Mr Tiswell directly.
Is he doing any other work? So is he contracted for a full-time role, but if one is contracted, one can have another role because it's not an employment contract?
Mr Tidwell is contracted to us for the work that is provided, and he currently is contracted to us 4 days a week. I would add, though, over the last 18 months, we have regularly worked 7 days a week, and Mr Tidwell, as part of our leadership team, has been there all the way.
I'm not saying that it hasn't been, I would say very busy and very possibly also very stressful time in terms of the amount of work.
Senator.
Yes, demanding is a good word. And you'll be pleased to know that my vaccine certificate was uploaded to my Victorian government.
Excellent. It's a good process, that Victorian one.
Now, can I just ask on that? So, do you know if he's doing any other work?
I think Mr Tiswell is there, and I think he does some work with DSS.
Senator,
Mr Tidswell.
He is there.
Yeah, Senator, look, I'm not at the moment. We are, obviously there's been a lot of work on with Services Australia, and yes, I am working 4 days a week, but I'm not working anywhere else on top of that, other than assisting occasionally with an implementation committee with the Department of Social Services, for which I'm not billing the department. So, my sole income is
what body is it in DSS?
It's the implementation committee of the department, Senator.
Thank you. Could I ask you, maybe Ms Skinner, so who approved Mr Tidswell's base salary?
I did, Senator.
Okay, and that base salary is $716,332.
As a standing contracting rate, it's a per day rate, Senator. I don't actually have the actual rate with me, but and we would take any of those specific questions around his contract on notice, because we have a right to an individual's privacy related to their remuneration on those contractual arrangements. I think we've been extremely transparent in ensuring that the costs of Mr Tidswell's contract have been clearly articulated in the annual report last year, the annual report this year. We've sought to be transparent about them being a key management personnel, and of course the value of the contract is available on AusTender as well.
Yes. So when I look at the AusTender contract notices, there's three. There's one that's described strategic advice and review services. There's another, that's CN 3657145. That's been revised on 2 occasions. It was published with an original value of $76,100, then varied to $233,300, and then a second time to $762,420. And that supplier was Mr Tidswell. Can you explain what management advisory services were performed?
I think yes, Senator. So as I've said, Mr. Tidswell has been responsible for the strategic sort of centre of the agency, which leads the strategy, governance, performance, communications, data, and transformation. So under his advisory services, if you like, he has not only led a group of many hundreds of people, but has also delivered the plan for our transformation, which includes a range of achievements, as we've heard too about the face-to-face work that he's been doing. And we can, I have a list of things that include driving the performance of the organisation through a strong sense of data.
Is it standard practice that one of the most senior executive officers is a contractor?
It is not particularly usual, Senator, but we were not in a particularly usual situation facing into a once-in-a-lifetime event around the pandemic, and in many ways we've continued to have new and unprecedented demand for change. I think it's worth pointing out at the time that Mr. Tidswell came to assist the agency, a number of other senior executives came as well. Mr. McCarty came to assist as an ongoing public servant from the Department of Veteran Affairs. Mr. Patrick Hetherington came from Defence, he's now at the Public Service Commission, and there was a handful of other SES officers who assisted the organisation to support the need to deliver the sort of scale of outcomes in the timeframes we needed. It's important that when you have those sorts of demands that you engage additional leadership as well as additional staffing resources. And I can assure, I never wanted to be the CEO who was not prepared to accept help from others at a time of such unprecedented demand. So I was very grateful for Mr. Tidswell's preparedness to assist.
Thank you. Chair, can I just ask how many minutes? Are you doing this by minutes?
We're doing this by what we call blocks of 15 minutes.
Okay, good. Can you tell me when I've just got some questions for the Minister.
I'm a notorious timekeeper, so I can let you know at the 5 minutes or the 2 minutes. What would you prefer?
Sorry?
I can let you know at the 5 minute mark or the 2 minute mark.
The 5 minute mark. We'll do a bell. Yeah, a little bell would be good. Yeah. No, now, can I just ask Ms Skinner, what was it that you couldn't, or maybe I can ask Mr Tidswell, what was it that you didn't want to become an employee, that you wanted to be a contractor? Or why didn't, because if you started last March, sometimes that happens where people are contractors and then they convert to an employee status, particularly if it's really, if it's the only entity with which they are doing work. And obviously there are different tax treatments that can apply if one is a contractor as opposed to an employee, and if one is deriving income from only one source. So could I ask you why you're not an employee?
Senator, let me probably... I didn't offer Mr Tidswell the opportunity to be re-employed. As you've noted, we've extended that contract a number of times, and it has suited us to extend the contract based on the emerging or demanding requirements at the time. You would note we do have a Deputy CEO recruitment process at the moment. That will settle ongoing arrangements for the agency, and at some point Mr Tidswell will conclude his contract with us, and being in a contractual situation makes that a simpler process for myself as the employer.
Yes, great.
Senator Kitching, there's 5 minutes remaining.
Okay. I'll put some questions on notice. Can I now, Minister, I would think I could only need 2 minutes because I'm only going to talk about one question on notice, but you do tend to obfuscate. So can I go to question on notice 4129? And this is in relation, this one went to you on the 10th of September. You have not answered it. It was due back on the 10th of October.
Could I just ask, sorry, Senator Kitching, you've asked me so many questions on notice. I've got a huge stack of them here. Which number was it again? And I'll get it out.
It was 4129, but I think you'll remember it because it relates to Ms Banks.
Oh, yes.
Yeah. Good news. You haven't answered it. Why not?
Well,
do you think you're somehow excluded from answering questions on notice? This is not the first or the second or the third discussion we have had about questions on
Senator
notice.
Kitching, you've asked the Minister a question, so the custom is for the Minister to provide an answer and then you can ask a question.
That is the custom, Chair. Unfortunately, this
That's
Minister
right. No, sorry.
tends not to really answer anything.
Excuse me.
And when she does,
I beg your pardon.
she is
Senator
mendacious.
Kitching, Senator Kitching, I've
Go on.
invited the Minister to provide a response to your question.
Thank you, Chair. And thank you very much, Senator Kitching. As I recall, you did ask me about what was reported in the Seven West media about
Right.
an allegation, and the way you framed it about the allegation that Seven West media had said, I actually did answer you and actually asked for you to provide that media because I was not aware of any
You didn't
such
answer
statement.
Me. You said, please provide
Can
the
I
transcript,
answer?
and I did. I provided the transcript, and you didn't answer it from there. You have
Senator
the transcript.
Kitching, Minister, do you want to complete your answer?
Yes, very much so. Thank you, Senator Smith.
Don't let her run down the clock. Go on.
I'll chair the meeting. Thank you, Senator Kitching.
Go on.
I think I Chair is.
Minister.
Thank you.
please.
So as I was saying, from recollection, I got the first question from Senator Kitching about some allegations that she said that Ms Banks had made about me, which were reported in Seven West.
Point of order.
Senator Reynolds.
Given that Senator Reynolds is not telling the truth, which of course she tends not to do, I would. So what happened was I gave her some set of quans.
Do you have a copy of the question that you
Yes,
might
I
get
do.
a table to the committee?
I do, and in fact, what I will do is actually read the questions.
You'll have to excuse my ignorance on this. I've not followed in any detail.
I do have
the
about 15,000
extensive
questions on
exchange
notice in
between
this
you two.
Parliament. That's
So,
true.
Chair, would it
But
be
I
fine
think
if
she
I
does
answer the
remember
first
it.
question?
ladies, senators.
Would you like to answer?
Senators, please. Have you finished your question to Senator Kitching, Minister Reynolds?
No, Chair, I haven't. I'm still answering the first question.
Okay,
The
continue.
first question was, former Member of
Senator
Parliament Ms Julia
Kitching,
Banks
it's
recently
not very
revealed that she
becoming of
shared
you.
claims of
This is not a
sexual
style
harassment
that
with the
you
Minister.
It's not a style you need to employ, Senator Kitching. It's not a style you need to employ. I'm chairing this meeting. Senator Reynolds, please use brevity. Provide a response to Senator Kitching, please.
So, Senator Smith, Chair, thank you. In relation to the question that I was asked by Senator Kitching, Senator Kitching has asked me two questions about that issue. The first question I responded and asked for further information because what she'd actually asked me I could find no evidence of. So I asked her to provide the evidence of the Seven West story, which she did. But that actually makes... So Senator Kitching had made assertions about something that
on the 14th of
Julia
July,
Banks was reported to have said by Seven West. Now, I asked for a primary source of that because what was reported in Seven West was not actually true.
No, that is not.
Sorry?
So I was seeking from, because it was a serious allegation that Senator Kitching had
Chair,
made
I think this
in
would be
that
better if
question. So I answered to say, please give me the primary source of where Ms Banks actually
And we gave
said
you two
that.
transcripts of Ms
And that
Banks
did
speaking
not-
on the Sunrise Show, and
Senator
what she
Reynolds,
said that she had
continue to
confided
answer
in you.
the question and
She
direct
had
it to me,
confided in
please.
you,
Senator
and you
Kitching,
ignored her,
Senator
as you did
Kitching,
with Brittany
this is
Higgins.
very,
That's
Senator,
what happened.
Senator Kitching,
You
that
got a
behaviour,
promotion. That's what
that
happened. You got a
behaviour,
promotion.
we
and
have
you
not.
thought, I'll throw her under the
we
bus,
have-
like you did with Brittany Higgins as well. That's what you do.
Senator Kitching, I'm prepared to go into a private meeting to give you a bit of space if you would like. Or would you like to?
Well,
This is
I'm about
not-
to go on Patricia Cavella, so why don't I go and talk about the minister here, whose
Senator
colleague she
Kitching.
threw under the bus. That's what happened.
Senator Kitching.
And you won't
that
answer my questions on notice.
That behaviour we have not witnessed during the course of this Senator Estimates hearings yesterday, nor today.
Yeah,
It is
well,
not
let me tell you what
necessary-
she... Do you want to go through what she did last
It is not necessary for
time?
you to prosecute your case in that manner. It is
So
not
I
necessary.
want to ask, because I don't have...
So
I
would
need
you
to
like
go.
me to move into a private meeting?
I need to go. So this is Chair.
Could I
I put
answer
in
the question,
questions on
Chair?
notice
We
to the
will,
Minister.
Could I finish answering the
we
The
will
Minister on the
suspend- We
14th...
will suspend for 5 minutes. Thank you very much. Australia, and we're in the whole of portfolio on corporate matters. Just remind colleagues that these are committee hearings of the Parliament and they are public. So just remind colleagues to keep that at the forefront of their mind. Senator Reynolds, I think you completed your answer to Senator Kitching.
I hadn't actually, no, because I was interrupted several times. So if I could actually answer the question, it'll be very brief. But I would like to actually...
Brief would be very much appreciated.
Well, yes, if I can do it uninterrupted, Chair, it'll be very, very brief. Thank you. So in relation to the matters that, the questions that Senator Kitching asked me, the first time the question in relation to the matters that Senator Kitching raised was actually on question number 3925 on the 14th of July 2021. Now, in that quan, there were 12 separate questions about the matters that Senator Kitching has indicated, and there was an allegation, and I was unaware of this allegation, and so in my response to that, I did ask Senator Kitching to provide the transcript of the primary source so that I could actually see and respond to that allegation. Now, I did get, in a follow-up quan 4129, which I understand is the one in question, I did get provided a newspaper article from the West Australian, but that wasn't the primary source that actually made that allegation from the person that was asserted who made that allegation. So I'm still unable to answer the question because I haven't been provided with the primary source so that I'm in a position to do that. I'm very happy to do it, but the premise of the question is incorrect. I can't answer a question that I don't have a primary source for the matter concerned.
Is that your answer completed?
It is, thank you.
Thank you very much, Minister. Senator Kitching.
I'm going to read out. So I did, in the 14th of July, so many months ago, I provided Senator Reynolds with a question on notice. She asked me for a transcript. I gave her the West Australian article, which contains Julia Banks's allegations. The good news is I've sent to her office one clip from Sunrise and one clip from Today, and I've sent it to the Secretariat as well, just so that we can all see it, where Julia Banks said, and I'll read from the West Australian article, and I'm sure the West Australian went to you for comment, but I'm sure you ignored it.
No.
They didn't.
Sorry.
There were, at least 5 other Liberal MPs who'd called
Senator
it out.
Kitching,
it's just that
is
the
there
women
a
who stayed in
question?
Parliament then went underground, such as
Senator
Linda
Kitching,
Reynolds, and she
Senator
didn't want to
Kitching,
comment.
I have to insist.
Yes,
Is there a
so I'm going to read
question
out my questions on notice.
So you'll read out
so that
some
the Minister
questions.
can actually take note and actually maybe answer them. 1. Former Member of Parliament Ms Julia Banks recently revealed that she shared claims of sexual harassment with the Minister. Is that correct? 2. Former Member of Parliament Ms Julia Banks recently revealed that a then male Cabinet Minister put his hand on, quote, put his hand on my knee and ran it up my leg on my inner thigh, and that Ms Banks revealed the sexual harassment to the Minister. Which male Cabinet Minister did Ms Banks allege to the Minister put his hands on her knee and ran it up her leg on her inner thigh? Question 3. On the report of sexual harassment by Ms Julia Banks, what steps did the Minister take to support Ms Banks and for how long?
They are questions
So I'd
you
like
put on
that,
note.
and the good news, Chair, just to clarify, she has the primary material of Julia Banks being interviewed.
My question is, are those questions you have now put on notice?
Yes, well, I put them on notice in September, and she hasn't chosen to answer them.
Thank you, Senator Kitching.
I've got more questions on notice she hasn't answered as well, but we'll get to those at some
I'll turn now to
point.
Senator Rice.
Thank you.
In whole of portfolio.
Yes, in whole of portfolio. Okay, I'll first of all start, Ms Skinner, I sent you a letter asking for information whenever.
You sent it to me, Senator, on Tuesday, I believe.
Yes, and I don't think I've got a response to it.
So your letter asked for us to be prepared to table the items. So if you'd like, I can go through the requests that you made, and some things I can provide, and some things we're not in a position to provide the level of detail. So
go through them. That would be excellent.
And my the staff here can table. You asked for the telephony report. We will table that telephony report.
Great.
I think that is a very long-standing practice to table the telephony report, Senator, and I'm very comfortable to continue to do so. What I do think is that as we're moving away from the concept that the customer experience and the customer's outcome is correlated to an average speed of answer, I think we're really in a situation where those two things over time don't really correlate. You'd want to have the customer's issues dealt with and things like that. So we think over time we can find a different sort of
well, if you've got different metrics, I know plenty of people who are accessing income support who rely on the phone and get very frustrated with being on hold for a very long time.
So we can happy to support that. We'll provide those. I'll provide that to left in your report. In relation to updates to the questions 1 to 7 and 1 to 8, I thought I would ask Mr. Birra if he could provide that detail to you. You asked for updates to the questions on notice that took us out to 31 July, so we'll get Mr. Birra to cover those items for you.
Oh, sorry, the date. You said 31 July?
Yep, 31 July, and I think you had some figures at 30 September.
Yeah, so Senator Chris Birra, Acting Deputy CEO, Payments and Integrity. So in relation to the update to question 127, in terms of the 31st of July, as at 31 July 2021, 15,824 customers had a debt raised after the completion of a review of their income support payments and the JobKeeper income that was paid to them by their employer. Approximately $47.8 million in debt has been raised through those completed reviews, and the average overpayment amount for these customers is $3,018. As of the 30th of September 2021, 16,303 customers have a debt raised after the completion of a review of their income support payments in the JobKeeper income that was paid to them by their employer. Approximately $50.1 million in debt has been raised through those completed reviews, and the average overpayment amount for these customers is $3,072. In relation to the update to question on notice 128, those numbers about the customers, number of customers who are at high risk of incurring a debt as a result of not reporting correctly their JobKeeper income as part of their ordinary income during the life of the JobKeeper program remains the same, and that is at approximately 79,000 individuals were identified at the time as being at risk of having incorrectly reporting their income to Services Australia, with approximately 57,000 considered high risk because they were reporting sort of either no income or limited income when their employers had nominated them as being eligible for the JobKeeper payment subsidy, and supported through a review process by our staff.
And do you have a breakdown by JobKeeper status?
So yeah,
Sorry, Senator, could you repeat the question?
The question of 1 to 8, I asked for any breakdown by JobKeeper status.
JobKeeper status. All of those customers, Senator, were nominated by their employer as receiving JobKeeper payments at that point in time.
Okay, all right.
The way JobKeeper worked, Senator, was that the employer nominated employees to the Australian Taxation Office, and the JobKeeper payment was an arrears payment to the employer on the basis that JobKeeper payment had then been passed on as ordinary income under Social Security law to the employees, who should then report it as part of their Social Security obligations as part of their ordinary income for the calculation of their income support payment.
Okay, so they were all receiving JobKeeper
and Job Seeker.
And Job Seeker, and I certainly know
at least at some period of time.
A number of people that then, that told me that they tried to tell the department that was the case and to stop getting Job Seeker, and it was difficult for them to do that. But, okay, I won't go into those details.
So I think that information then covers covers the information you were seeking in relation to the question on notice 138.
It was, yes,
Yes.
at the June hearing. And then, Senator, you also asked about an update for a question on notice 221, which Senator Siewert had asked at the 6th of September hearing about debts repaid as a result of the reviews. And I think there's a bit of context there, Senator. These are the overpayments that resulted in debts from the reviews. At the time that the JobKeeper wage subsidy was in place, a number of customers did correctly report their income and so had adjustments made to their income support payments at that point in time. But these are the in respect to overpayments. So as at the 31 July 2021, $13.34 million had been repaid in respect to overpayments that were identified during the JobKeeper and income support payment intersection reviews. And as at the 30th of September 2021, $16.26 million had been repaid in respect to overpayments that were identified during the JobKeeper and income support payment intersection reviews.
And then, Senator, you asked for we will table 3 documents for you, which is the childcare subsidy reconciliation data. You asked for that around gender and a few particular indicators. You also asked for that in relation to the disaster payments. We'll table that. And crisis payments. So those 3 documents, which have got a good amount of detail in them, will be tabled.
Okay.
You also did ask about the Celebrite contract.
No, can we, before we move on to the Celebrite contract, so in fact, let's probably, in terms of the debts, thank you for that information about the debts for those who received JobKeeper. How many debts have been waived? Yeah. Thank you.
I'll get Mr. Bill.
Senator, I have to take that on notice. As a result of the reviews that have been undertaken, and like with all of the income support payment compliance reviews, that we seek to do those with the customer and to obtain information from customers. And in some cases, in those discussions with customers, they've indicated difficulties in sourcing information, so we have to go back on their behalf either to employers or financial institutions. And so we've been working through those reviews. A number of have sort of continued, and some have also been paused, particularly as a result of the debt pauses put in place in relation to the government's response to COVID.
Okay. So you can take on notice.
We'll take on notice what information we have around that, noting that some of the reviews are still underway.
All right. And how many people still have not paid, who you have issued that debt with, haven't repaid it now? I mean, so how many people have still got outstanding debts?
Yeah, we can take that on notice, Senator, but one thing, and it was in the Minister's press release in August in relation to the debt pause in those areas that were impacted by the COVID disaster payment or the previous natural disaster payments. Customers could, if they experienced financial difficulty, contact the agency and adjust or pause repayment arrangements. And so there will be a number of customers who have paused or adjusted their repayment arrangements given the circumstances over the last few months. But we'll take what details we can and provide on notice, Senator.
Okay. So with relation to the disaster payments and the figures that I've asked for there, so you're able to, because you just, you're able to table...
Those documents have been arranged for those to be tabled as well.
Okay. And look, I'll ask some more questions about disaster payments in addition to those.
Certainly.
And it's in particular people who only applied for disaster payments once. So that because they had to, for the disaster payments, people had to apply for them weekly, didn't they?
Senator, there was a range of arrangements. So some activations And a good example was the Tasmanian activation just recently. It was a 3-day lockdown. If people lost their hours, they would make one claim because that wasn't a continuing situation. If it was a continuing situation, they would have been put on repeated payments. And there was some... I'll get Mr Egan if you've got particular detailed questions about the activations. There was some reapplication at the beginning of the process, but that was adjusted to ensure that people could just maintain their payment status to support them through that, particularly that very long New South Wales lockdown and the Victorian lockdown. So people could continue on payment if their payment circumstance had not changed.
So they didn't have to reapply for it?
They didn't have to reapply. They may sometimes cancel their payment if they had been getting some hours. So some weeks I would be aware of a customer who would have no work at all and they would get a $750 payment. If their normal working hours meant that they got they only lost a smaller number of hours the next week, they might change their circumstance and apply for a $450 payment, or in the reverse. So some people, if they change their circumstance, would reapply. Others whose circumstances didn't change would go through just be on an ongoing payment. As the 70% double vaccination rate came into effect, then people have been reapplying based on their continuing need for those payments, and that is through to 80%, and then at 80%, it's that 2-week step down.
Right. So since that 70%, though, they've had to reapply. People have had to reapply on a weekly basis.
Yes, since when their jurisdiction or when their activation area meets that 70%.
So I think it's since that time, have you got statistics of people who have only reapplied once? And I want to go to the barriers in people actually accessing these payments, and people who decide it's just not worth it, and basically go through it once and then decide it's just not worth it.
I might see if Mr Egan has any of that data. I will hunt through my pack here. The reapplication process is very straightforward. So if there is no need for any person to believe there was a barrier to reapplication. 94% of all COVID disaster payments claims were made online, and most people were paid within a 24-hour window. Most people were actually paid within the day of which they applied.
Okay.
So if you have any particular customers who feel there's a barrier, we'd be happy to talk to them.
All right. And do you have data on people whose payments were rejected, or people who applied and then were rejected?
Yes, we do have some. I don't have that data with me right now. We can take that on notice. People would have been rejected if they were unable to meet the requirements of the payment, the lost hours and things like that. The online application form actually takes customers through those questions and tries to support them to identify that they may or may not be eligible based on their answers, but they are still able to submit. And then if their claim, and a staff member will then look at any of those claims where a customer does not appear to meet the criteria of the payment.
Okay, if you could take on notice then providing that information.
Yep.
Is there a reason why the Department of Health has stopped including the disaster payment figures in their daily updates? Have you stopped providing them to them, or have they decided that they shouldn't be included given they're being phased out? The last daily update. We collect and provide that data, so Senator, I'll need to take that on notice. It is the final page or one of the last pages in the daily report. Mr Tidswell, he might have some insights on that. Thank you. The last daily report, I'm told that those
statistics were in the daily report was the 21st of October, so over a week ago.
Okay, Mr Tidswell, do you have a...
So Senator Grant Tidswell here, Deputy CEO Strategy and Performance. I didn't know that because we supply that information, so we'll take that on notice to find out what's occurring, because we dutifully collect the information every day, and you've been able to see it and citizens have been able to see it, and so we'll come back with some advice about what's going on.
So you have been providing the information, as far as you know.
Senator Rice, almost time.
Okay, you can come back to me later.
Yep, absolutely, great.
All right. I think that's it on the disaster repayments. Look, I'll leave it there because I want to go on to another topic now.
Great,
so.
thanks very much. Ms Skinner, I was impressed with your level of understanding about the Braddon matter.
Yes, Senator.
And if Mr Tidswell is still available, how familiar are you in regards to the leasing disputes around the Joondalup site?
The Joondalup site, that's Western Australia, I believe.
It is Western Australia, yes.
I know anything ending in an up is Western Australia. Mr
Not very?
Tidswell?
No, there's
I'm
quite...
personally not particularly... I'm aware of a different dispute with a bit more detail, but not Mr Tidswell might. Mr
Tidswell, do you know anything? It's not a trick question.
Look,
I've had some representations from her.
Senator, it hasn't come along on my radar, but we have Sandy Marmo, I think, online, who's a Western Australian who may have some more recent information, but it is not in an issue that has come across my desk.
Yep.
Okay. Ms. Marmo, if you are still on the line, are you familiar with the leasing dispute in regards to the Joondalup site?
Thank you, Senator. No, I'm not, and I'm curious about what you might know about it.
If you are now curious, my job is done.
Yes, we will...
I'll make my representation.
We are on to that, Senator.
Great. I'll make my representations in the normal way. Thanks very much. Senator Green.
Thanks, Chair. I just wanted to ask some questions about vaccine certificates and the way that they're interacting at the moment with the state and territory apps. As far as I understand, and I haven't actually accessed my vaccine certificate yet, but I do have one.
Do you need some assistance, Senator?
I don't need some assistance. I have a very handy how-to guide that we are sharing with our constituents.
Good.
But just in regards to how it works with the apps around the country, if someone travels around Australia, well, as much as they possibly can at the moment, does it essentially mean they're going to have all the different apps for all the different states to be able to use their vaccine certificate when they go to a venue or go to somewhere that needs to see that vaccine certificate?
I think, Senator, the first point to make is that each of the states and territories developed their own check-in apps.
Yes.
So regardless, Australians complying with the state health order in relation to that. What our role has been is to support states and territories consistent with their public health orders if they wish to integrate them into those check-in apps, and that is really the extent of our role. The point you're making, though, is that is correct. The way in which those apps are directed and used is actually a matter for the state and the state health order.
Okay. But the vaccine certificates are from the Commonwealth.
That's right.
Other countries, such as the UK, have a national app for digital vaccine certificates. Is there a reason we haven't gone down that path of just having an option for people to have that vaccine certificate on maybe even the COVID app that
Senator,
everyone was told to download?
Senator, we are a federation. We do have
national government delivering
the
national
Medicare
services.
Express Plus app. The Medicare Express Plus app enables you to download your Medicare certificate. So there is a national Medicare app that enables you to download that certificate. It also enables you to connect with your international certificate. You can store both of those items in an offline mode, and they're available at any time, anywhere in Australia, and as far as I understand, all the states and territories accept that version as well as evidence of vaccination. So to your question, we already do have that, Senator.
Okay. In terms of what having one country app, was that ever given any consideration of developing something like that?
So
did any states and territories ask for the Commonwealth to consider doing that to make things easier for people?
We've not in terms of not really, Senator. They've all had their existing apps. We've worked with them to integrate them into their existing infrastructure. They've used the facility available in the Medicare Express Plus app. And as part of some of the future investments in MyGov, we'll be developing over time a MyGov app that will integrate some of those features that we have in the Centrelink app, in the Medicare app, for example, and allow citizens to collect and work and do their business with government from the basis of a MyGov app in due course.
Okay, and New South Wales and Victoria are now linked to the National Vaccine Certificate. Yes. Which is through MyGov.
So a citizen consents to share their immunisation record with the state-based app. That's right, Senator.
And how many other states and territories have been linked?
So at the moment we've got New South Wales and Victoria, and just now we've got 4.4 million connections of people in Victoria and New South Wales using their Medicare certificate integrated with the local check-in app, and that's occurred in just sort of 15 days.
But that's only for NewTh Wales and Victoria?
No, New South Wales and Victoria. So Mr McCarty or Mr Howard can go through the rollout of other integrations with other state-based apps if you wish. Well, we are assisting all the states if they require our assistance.
I'm so sorry, we have such a limited time today. The question was just New South Wales and Victoria?
At the moment, yes.
Okay.
But
then in terms of the other states, is it Mr Howard is the
in that terms of other states, yep.
So is your question
we are helping
all states and territories? Yes, they are all in the process of doing this.
Yeah. So every state and territory with two having been done.
Let Mr Howard answer that question.
Senator Jared Howard, General Manager, Health Programs. Services Australia was ready on the 27th of September with the work that we needed to do to integrate with the states and territories. Now it's the states working through their processes to be able to hook up with our system. All states and territories are in the process at various stages of hooking up.
But from a Services Australia point of view, that's all ready to go. It's just the states just need to say we're ready to link.
That's correct, Senator. So there's testing and stuff that we will do as states become available, but our part in relation to being able to be ready was completed at the end of September.
Yeah. So the idea eventually is, I certainly probably don't travel as much as a minister would, but I do quite a bit of travel across the country, is that I would have to download each different app, a Queensland one, an ACT one, a New South Wales one, if I'm going to be doing committee hearing, and have all the different apps with my certificate uploaded in each one.
No, Senator. So at the moment, the ACT leads a number of jurisdictions where their check-in app is available and you can use across multiple states. So ACT, Northern Territory, Tasmania and Queensland, you can currently use your check-in app in any of those states to be able to check into another one of those states. So when they integrate the certificate in at various points, you should be able to then still access via. So the ACT app, I can go to Queensland and check in using my ACT check-in app. There are also conversations occurring. There are also conversations occurring with New South Wales and Victoria about integrating. More broadly, so that, while that's not a role the Commonwealth is participating in, there are conversations occurring to attempt to mitigate that very issue, Senator.
Okay. No, it's fine.
Clarify just on New South Wales.
Of course.
With this, sorry. With the Service New South Wales one, it actually directs you to Medicare to then share your Medicare Express certificate to then go to Service New South Wales. So you actually end up with both of them?
Yeah, so Senator, you need to log in to either your Medicare Express Plus app or the MyGov Onlines to be able to push your certificate into the Service New South Wales app.
But so you have to have the national one
So
to then push it into the New South Wales
That is
one.
right. And Senator Hughes, one of the reasons for that is to leave you in control of the certificate. So instead of just giving New South Wales authorities the access to your certificate, you actually have to put it in and give permission for that to happen. So it's also for your privacy and control.
Yeah, okay, because I know all the states, thank you Senator Green, because just all the states seem to be doing it differently.
Yeah, so on the data sharing and privacy, as Senator Hughes has just asked about the New South Wales Services app, is there an encrypted token with basic ID details and vaccination details that get passed across from one app to the other? Is that how it works?
So the token is encrypted as it moves across into the Service New South Wales app, Senator, yes.
And what ID details are shared across under the token?
So the data, so there is an agreement in relation to what data can be shared, and I can give the specifics on notice, Senator, in relation to what we push across from Services Australia to Service New South Wales, but it's the sort of data that you can see on your certificate. So name, date of birth, vaccinations, status, that sort of data.
Okay. The information that's on the token, if I put my vaccine certificate in my Apple or Google wallet, does that information get shared with those companies and providers as well?
So if you are consenting to put the certificate into the commercial wallet, then that information is stored with those companies as well. Now, they're slightly different but based on the sort of company settings. And with Google, it's stored on your phone, so it's not actually kept on their databases, although it may move through their servers in order to land on your phone. Apple shares slightly differently, and you are consenting to share data with Apple.
Okay, and just in general, the system for hard copy vaccine certificates, that's quite simply just print it.
You can print it.
Simple for some people.
You can print it, or you can phone us and we'll print it, or you can go into a service centre and we'll print it there for you.
So if so you can just print it off. Would you need to have a print? If you didn't want to use the digital app for whatever reason, privacy, data, just not into it. If you wanted to just print off the hard copy, you could take that around to your different venues that you're going to. Is that right?
Yes, Senator.
Yeah.
Yeah.
Based on the health order of the states, and that's what we understand. They accept that.
Okay. What has Service Australia's cost so far for the digital vaccine certificate?
It is. It's part of a broader. It's part of the budget that was provided for our contribution to the vaccine rollout. So it'll be a grossed up number.
So, Senator, there is under the COVID response package for vaccination and treatment in financial year 2021. Service Australia was budgeted just over $35 million, and in 21-22 just over $4 million. And as the CEO just mentioned, it was for a number of different things, so not just the certificate. It was for critical enhancements around performance and system capacity of the immunisation register, the ability to add new COVID vaccinations to the register as advised by the Department of Health, enhancements to vaccination provider lodgement channels, an enhanced data feed to the Department of Health, the creation of the domestic certificate, and increased sort of channels available for individuals to obtain a copy of the proof of vaccination via MyGov Medicare Express Plus app, the IOH service for those non-Australians or non-Medicare eligible individuals, and My Health Record.
Okay, thank you. And Minister, I just wanted to check, in terms of ministerial responsibilities, I mean, obviously Service Australia is leading this project, or managing it at the very least, and there's a lot that has gone into it, quite a lot of money as well. Are you the Minister responsible for the vaccine certificates?
Look, thank you very much, Senator Green, for the question. Minister Roberts actually has responsibility for the whole of government data and digital portfolio agenda, including the DTA, and he has sort of oversight. He has that sort of broader oversight. We obviously work very collaboratively together, as does Services Australia and DTA, in sort of all of these matters.
We asked DTA about, in estimates on Monday night, about the differences in their role and Services Australia's role. It seems like the responsibility for DTA is changing. They're not going to be quite as involved in broader digital policy. Is the responsibility for the COVID vaccinations going to come back to yourself with that change occurring?
So vaccinations or certificate?
Yeah, vaccination certificates.
So I think the best way to perhaps look at this is that the policy, sort of the whole of government policy for digital technology rests with Mr. Robert, the strategy, rests with Minister Robert and also DTA, whereas Services Australia are the implementers of this and many other sort of government policies across many different agencies.
So it just seems strange that you're not responsible for the vaccine certificates then as an overarching thing. Is there a reason why this has sort of been allocated to Minister Robert?
Well, he was previously, he was the Minister for the DTA and for digital policy, whereas now he's obviously moved portfolio.
Yes, he's
and
not,
that has gone
not responsible for that anymore. That's why I'm asking.
No,
I should have said that
I
at
think
the beginning.
Is the policy, so
only the policy.
He's got the policy, the whole of government
implementation.
policy to bring it together, and really Services Australia and my involvement is in how we actually implement that, and is sort of the technical side and also the actual delivery.
Right.
So policy and delivery, and that's pretty much what Services Australia do across the board.
So, and Senator, I could just add that the policy that we implement on those certificates, there's digital policy, but there's also the health policy. So the health department does set the policy parameters of what is the certificate, the business rules around the certificate.
So the health policy
informs that as well.
well.
Health policy is informed.
Yes.
There's a digital overlay, and Minister Robert, of course, is the chair of the Digital and Data Ministers, which is the engagement with things like the states over the check-in apps. And then our role is we deliver the stuff. We are the deliverer.
Yeah, the
tech deliverer.
The grunt work.
We do it.
So Minister Roberts goes out and does all the breakfast television telling people how great the vaccine certificate is, and then it's your job to actually implement it and deliver it and land it and make sure
that as a
if anyone has any
comment,
complaints, they've got
Senator
to come
Green.
to Minister Reynolds about it.
So they do the strategy and we do the delivery.
That seems fair.
But also the policy. So the policy, in terms of the micro policy that's required to develop the app, and also everything from the CDP payments.
Sure.
Is some of it is Minister Mackenzie in terms of disaster recovery policy, some of it's health policy. So it's really a whole of government approach.
Sounds like a mess. Just last questions on the vaccine certificate, just to make sure we understand. For Australians who will travel overseas, the international vaccine certificate. I guess that they'll use when they go overseas. What's the Services Australia's role in that?
So Services Australia has worked with Foreign Affairs and Home Affairs on the delivery of that certificate. Our role is to enable the production of that certificate and provide it to citizens after, and we engage, citizens engage digitally with the Passports Office, not that they can see that. So they push their passport details through the Medicare Express Plus app. We pair that up with the vaccination status, and they receive in return an international certificate that they can then, as I said, save in an offline way, print and use for international travel. And we have 535,000 Australians who have already done that.
So for returning Australian citizens, what will they need to show in terms of proof of vaccination to return home?
So that's really a matter for Home Affairs, but I think Mr Howard's got some information there.
It would depend on the country in which their citizen was immunised. So If they've been immunised here in Australia, then they would be able to access their international certificate. If they've been immunised in another country and are coming to Australia, then they would, my understanding is they would need to attest that they've been vaccinated in accordance with the rules here in Australia, and then they would get their certificate or a version of proof from the country in which those vaccinations occurred.
Okay. And Australian citizens that are departing Australia and then coming back, will they just need the vaccine certificate, the Medicare one?
So they'll need the international certificate. Yes.
Oh, they need an extra one. They can't just
two different. You can
just
store
show
two
the
different
app.
certificates.
They need two different ones.
You can store two different ones in that Medicare Express app.
And so you get the international certificate, Senator, through the same process. You can hop into the Medicare Express Plus app. It's a slightly different sort of process, but it's actually all done in the same place, and they can be stored in the same place.
You just need your passport number and to make sure that your name's the same on your passport as it is on your Medicare records.
Does it also include the name of the vaccine you had? Because I know some countries have different rules over what vaccine
It's
you
done
have.
based on an internationally agreed standard, Senator. So it actually includes the name of the vaccination and the batch number of
Thank
the.
you, Chair. Sorry.
Just, Minister, just on that last point about the significance of having your passport name exactly the same as your the name on your vaccination, how common has that problem been, and is it now corrected, or how does that issue arise?
I think we can probably know there's a couple of issues in there. So one is if you're hooking your Medicare to your MyGov, some people have had name mismatches there.
Right.
We've done some work to try to smooth that out. Some customers will in the end need to call us either because they've changed their name for whatever reason and they need tailored support to hook that up.
So there's a tailored solution. You call,
yes,
and then it gets
call,
correct. Yep.
And we can assist people. In the international certificate, we try to remind people if maybe your Medicare just had the middle initial or your middle name was not there. The app asks you to put your middle name in there because that's needed as it goes across to the passport office. So we have made people make sure they put their proper name in, and we've had less mismatches of those as well. We've had quite low numbers of rejections of the international certificate.
Okay, so if your Medicare card doesn't have your middle name...
Yep, that is okay.
That is okay, as long as you put your middle name into the app?
Yep.
Okay.
That is exactly right, Senator.
And you'll know, Senator, if you don't...
More questions, sorry, and then because I'm eager to get to outcome 3 and I just want to quickly wrap this up.
No, Senator, if you don't, because as part of the process we do a quick identity verification check. So if you haven't got your name matched exactly against a passport, then it will bounce back and tell you to contact the agency.
Fantastic, thank you.
What about for non-residents in Australia who don't have a Medicare account? How will they prove their vaccination, particularly if they are going home or going overseas?
Senator, if they've been immunised here in Australia, then they can access proof of vaccination through their individual health identifier. So they can apply for an IHI, which they can do online through MyGov. Once they've got that IHI, then they can get proof of vaccination domestically and get a domestic certificate. But it also, if they then have their visa, an Australian visa on their foreign passport, they can apply for their international certificate digitally and through that process. If they don't have a visa, then they can ring the agency and the agency will assist in stepping through that process.
In getting them an IHI if they don't have a visa?
So if they don't have a visa, the agency will assist. They can already ask for an IHI without a visa. But if they have a foreign passport with no visa and they've been vaccinated in Australia, then they can ring the agency and we will assist in the checks that are required to get them their international certificate.
Okay, thanks.
Could I just have a couple of questions? It's just actually about the disaster payments. Can I go back to that? So I've just seen what you've tabled, and I'm sorry if I missed it when Senator Rice was asking, but whether you have the data by electorate or by state for disaster payments. I know we're getting it in the COVID committee fortnightly as a cumulative figure, but is that figure available or is that data available?
Yes, we can. Yeah, I don't have that here, but we can break that down. I've got Mr. Egan or Mr. Tidswell who can tell you exactly the ways we can break that down.
Okay.
Mr. Egan or Grant?
Look, a Deputy CEO.
Oh, you got a dodgy connection, one of
We
you.
might ask Mr Tiswell. Grant, can you help us?
Senator, we can break that data down for you. If you can supply us just exactly what you need, we've got those materials for you.
Okay, it was just by electorate and by federal electorate and by state and territory. Yep.
It's harder by electorate.
Okay, so maybe you say, what do you do, SA4?
Local government area.
Local
By
government
LGA.
area. Okay, I'll take that, if you can do that.
And can we have a week-by-week breakdown so that we can see the time series of that over the last periods of months?
I'm sure that's... add that on?
We'll add that on and see how that goes. I think we do have reports that we've already provided to the COVID committee, but we'll just check.
We've certainly at the COVID committee, Senator Rice, we have fortnightly cumulative data.
Yeah.
We just don't have it broken down by local government or state
area,
and
which we
territory.
can do.
Yeah.
And Senator, may I also just come back to a question that was asked a little while ago about provision of data to the daily VAX data set? Can I just inform the committee that we continue to do that every day? We just had a problem last Sunday where we missed the deadline because we did some systems upgrades. We didn't get the data ready in time, and so we missed out the data set for Sunday. But I've just got online. It's all there and available with the health data and the data for the CDP payments from midnight last night.
I'll just check with Senator Rice. I think Senator Rice wanted one more block. Is that correct?
Yeah, I've pulled the remaining questions on outcome 1 we'll put on notice so that we can get to outcome 3. I think that's...
One more block will do me.
Yeah, okay.
So it would be 5:15. Thank you, Senator Rice.
Okay, thank you. And just my final clarity around data and what you've got. So information on applications which were successful and unsuccessful.
You're looking at wanting the numbers of COVID claims and how many claims were rejected.
Yes.
I think we'll take that on notice. Yes.
Okay, and any information on people who, you say most people put in their applications online?
Yeah, 94%.
Yes. And do you have any information about people who started an application or a re-application but then didn't finish it, or is that not
We'll see if we've got any data about incomplete applications. And the other, what I should say is the other 6% were visa holders and a particular group of individuals who were required to phone us. So they did not have an online offering, generally that other 6%.
Okay.
And we helped them over the phone.
And Senator, can I also provide, we don't have the exact data in front of us, but this was a very different payment, and we had a bunch of people who thought they had to reapply when their payments were recurring. So a lot of those claims were rejected because they were already on payment and getting paid effectively. So it's an unusual data set in terms of rejection rates.
Okay. All right, so let's get back to my letter and the information.
Sorry, can I just provide, just in relation to, I think, the question about the breakdown of disaster payments, if you actually go to recovery.gov.au, they've actually got that data available online, so right down to local areas. So you can already get that information through the DRAA. It's online.
Okay, I'll see whether that provides everything that I've been asking for. So back to my letter and the documents relating to the contract to Celebrate Australia.
So I can get Mr. Tavira to talk to that. I think it's probably we can't table that information at this time, but we're having a look at that request. I'll get Mr. Tavira to talk about what it is and how it assists us to deal with fraud and criminals.
Thanks, CEO. Thanks, Senator. Chris Birra, Acting Deputy CEO, Payments and Integrity. And so, Senator, we received your request. Thank you. We're looking at sort of what it is that we can provide, including sort of engaging with the company on that. In terms of sort of the capability in the broad, though, and I did
Actually,
read...
before you move on to that, so I don't forget, you say you're considering that, so you intend to get back to me soon, or how long are you going to take?
Yes, Senator, we'll take that as one of the
Questions on notice, and we'll respond.
Okay, although questions on notice, I may not get a response until, you know, the day before next estimates. So
You've written to me. I'm considering the extent to which we can support the request, and we need more time than 48 hours because it is a contract, and there are other important matters around criminal capabilities and fraud that we need to be mindful of in providing any information, in providing that sort of level of detail.
And Senator, I would add that, like, looking into fraud and serious non-compliance is a priority for us. We're very aware that we have a role of assurance over $200 billion of social supports in the Medicare and Centrelink programs, and so the integrity of those outlays is important, but we're also very aware of the importance of customers' information that we hold and the importance of protecting our customers, many of whom are quite vulnerable, including vulnerable to coercion or trickery by fraudsters who want to commit fraud using identity theft. And so these type of investigation tools are very important for us to undertake that fraud protection, and also to protect the information of Australian citizens and protect them from identity theft.
So can you tell me what programs this software is used across?
Yeah, the software is used in relation to serious fraud and criminal investigation matters.
By people who, so is it by people who are receiving payments, or is it, have got a genuine reason to be receiving payments, or is it only people in the circumstances such as you're just talking about, such as in identity theft?
Yeah, only the latter. So we do have a system of compliance in terms of ensuring that people are complying with their mutual obligations under the income support payment, and that we take very seriously making sure people are paid the right amount, they're on the right payment at the right time.
So is this software being used for those?
No, it's not,
No.
Senator. So those compliance reviews are undertaken in concert with the customer, and so we work with them, and a lot of the information that's used in compliance reviews and in reviews to make sure that people's payment is accurate is actually received from the customer. These are instances where, beyond those, where it's suspected or real criminal and fraud matters, and the sort of examples that we've seen, and there is articles in the media on this, are examples of where people have falsely claimed the government disaster relief payments, where they haven't been in the area. We've had instances where people upload images that don't relate even to Australia in order to commit fraud, where people steal the identities of actual customers, including vulnerable people, and hijack payments using their details. And so it's these type of criminal matters and serious non-compliance matters that these capabilities are focused on.
Criminal matters is different to serious non-compliance.
Well, the serious non-compliance...
I mean, I'm concerned about the use of this invasive software for people who are, genuinely your customers.
It's not, Senator.
Yeah, Mr Birra has been clear. It is not used for people who are genuinely our customers.
In fact, it's used to protect them from identity theft. The agency...
I think it's confusing if you call that if you call some of the uses of this software non-compliant.
I think we use the word serious non-compliance, so our view is that serious non-compliance is a deliberate act to try to get some of the government outlays that are associated with social security welfare, and to the extent that we are involved health.
Okay.
But not used in the regular payment accuracy reviews that are undertaken with our customers.
All right. And so in that, in terms of the people that your customers, you can guarantee them that you are not violating their human rights, including their right to privacy.
Now, we publish all information in relation to what their obligations are in terms of particularly reporting changes of circumstances, That's made very clear in terms of when people enter onto payment and in the information we provide. And in fact, we've got a lot of success now in nudging people and presenting information to customers just to remind them to report changes in circumstances that might have result in an adjustment to their payment.
Okay.
And there are some of our review activities which also find that people's payments are lower than what they could have been. And so people keeping their
How often
circumstances up to date, well, it varies because all of this is really predicated on individuals' own circumstances, and that's why it's important for people to engage with us on
Okay,
those.
look, I look forward to having your consideration of the documents, and I need to move on in my limited time left. I want to go back to the issue of people with robo-debts, that I heard the questions that Senator O'Neill asked earlier, but I don't think she covered off exactly how many individual debts have still not been refunded and the total value of those debts.
So, Senator, in terms of refunds, we've now... Is this the number of debts or
Yes.
the number of customers you're
The
asking?
individual debts that haven't been refunded and the total value of those debts.
In terms of in-scope debts, the total number have been refunded is about 519,000, which represents 97.8%.
So how many haven't been refunded?
The total amount to be refunded is...
My data suggests around 9,200 people are yet
9,200 people, and in terms of the value, I think I've got that here, Senator. Oh, we'll take that. We'll take that on notice.
Have you got that there, the value? And in fact, I was interested in what's the largest debt that's still hasn't been refunded.
I don't have the largest debt that's not been refunded.
Do you have the data there as to sort of what the total value of the debts is?
The total value of the refunds is $752 million, of which $740 million has been
Okay, so there's
refunded.
still $12 million that you haven't refunded yet.
That's correct.
And I think it's worth making the point there, that is because we're still sometimes trying to locate customers, sometimes those customers we're dealing with their estates. So some of these, they're not straightforward, necessarily straightforward
And so-
matters, but we are seeking to do them as quickly as we can.
And so of the 9,200 customers approximately who are still awaiting a refund, a number of those are former customers who we're seeking to contact by various means. That includes earlier this year using the civil society action group in order to reach out to those, and we've seen bodies such as Economic Justice Australia put out their social media commentary to those people to contact us. Others are, as the CEO mentioned, people in particular circumstances requiring manual interventions, such as people currently incarcerated who we're working with the facilities around contacting them. And what's important about all of those customers, Senator, is that we now have a marker on their customer record, and so whenever they re-engage with the Centrelink system in the future, that refund will be able to be made to them.
Okay, how much did the government spend on legal fees for the Victorian legal aid case?
Well, Senator, there's two aspects to that. We don't look at internal legal fees on a matter-by-matter basis. And we'll have to take in that we have an in-house legal team that provides us with support in terms of any sort of other costs.
Of what your in-house legal team spent on both the Victorian legal aid case and the Gordon legal case?
Well, as I said, Senator, we don't break that down matter by matter, but we can take the external legal costs on notice.
Okay, and look, and I mean, how many other legal activities would you have had underway at the same time?
Oh, we have a wide range of different types of legal matters underway at different times of different natures.
Okay,
Senator.
can I go to the question that I was asking earlier on today, and was told that you were the right people to talk to it, and that's about people who are on getting income support and their partner their male partner usually. It's women with a male partner puts in a provisional income. They're not lodging their tax returns, and then they do, and surprise, surprise, when they've lodged their tax returns, it shows that they've actually earned a lot more money than they had declared, and then it's the woman then who gets the tax debt, because the presumption is that, you know, having discovered that this man has now earned a lot more money, that the appropriate amount of income support has been paid to the woman. So I'm just wondering how that's being dealt with, and in particular then I would like to have a breakdown year by year of the number of social security claimants who have a family payment debt due to that maintenance income test.
Senator, I'm just going to, I think Mr Egan is now on the phone, so he might be able to give us some insights there, and Ms Faciony might be able to also assist, but Russell?
Yes, I'm here. We don't have a breakdown at this time of the. I think your question goes to the number of customers who have a reduction in their family tax benefit Part A as a result of the application of the income maintenance test. Is that correct?
That's correct.
So the information that I have at the moment is we have approximately 284,000 customers who have had FTB Part A reduced this financial year so far as a result of the application of that test.
Right, but I'm wanting to go to the number of people who then end up with a debt because of that maintenance income test.
We don't have that. We would have to look at how we might provide that because the maintenance income, of course, is just one of several sources of income that is taken into account in the reconciliation process at the end of the family tax benefit year. So we'd have to go back and see whether we can pull out the customers that have had the income maintenance test applied and see how many of those customers have incurred a debt. I'm saying it's not a straightforward thing to do because it is one source of several sources of income for most families.
Okay, and if you could also then take on notice sort of what, in fact, take on notice the details of the debt recovery that's been employed against these customers for these debts. Happy to do that, but the debt recovery arrangements would broadly be consistent with the debt recovery arrangements that are in place for other customers and other family assistance customers of the agency. Essentially, it's one driver of a reconciliation outcome. Okay, I've got two quick final lots of questions. One is about the cashless debit card, and does your agency receive complaints relating to the cashless debit card?
We do receive complaints on a range of matters. Mr Egan, are you able to talk to that, or shall we ask Kirsty?
The cashless debit card, like every other program that we deliver, collects information on customer experience and would record complaints as well as compliments. I don't have information with me at the moment in relation to how many complaints that we might have received, say in the last financial year, but I'm happy to take that on notice.
And so the number of complaints received annually since the card was introduced, and any information you've got about a breakdown for the reason the complaint was made. My final question is completely moving away from that, and it's questions that I began with asking initially about 3 years ago, which is about the Australian Government guidelines on the recognition of sex and gender, and the fact that as I understand it, your IT systems still can only record male and female in the gender field. And in your earlier answers, you said that you were continuing to explore IT solutions to affirm non-binary people. So what's actually happening in this regard?
Senator, I would need to take that on notice. I apologise for taking it on notice if we've taken that on notice before, but unless Mr McCarty's got anything.
And these guidelines were meant, I think, I haven't got the information in front of me, they were meant to be in place about 3 years ago, I think.
We certainly understand that those guidelines are there, that the guidelines required changes to many Commonwealth and other systems, and some of our systems are indeed based on technologies that actually are really good and hard-working, but they have been around since the 70s. So some of those things are being changed as we go, but Mr McCarty can assist us.
Yeah, good evening, Senator. Charles McCarty, Deputy CEO of Transformation Projects Group. So, as the CEO said, many of our systems have been around for a long time, so the core databases that sit within them may not be able to reflect those multiple
that's exactly
genders,
as it is at the moment.
but
Yes.
within the online, so bolted onto the front of those back-end systems. So examples are, the Medicare Express Plus app, Centrelink online services, etc. We do capture those differentiations, so we can actually backtrack if need be and deal with those differences. But what is stored in some of those core back-end systems, it is impossible for us to go back and create another field type.
So what's then happening to...
So as these systems are being replaced, so a good example of that...
So how long is it going to take? I mean, again, I haven't got the exact time, but I know that when it was meant to come into play, you'd already been given about 5 years to be compliant. And so and for people who are non-binary, it is totally inappropriate for them to have to record that their gender in that binary field.
Yeah, so the Centrelink program is a good example of that. So we're in the middle of the Whippet program, which is replacing the Centrelink master program technology, and that runs out until the end of this fiscal year. So what that is doing, it's completely built a new front end for customers. The staff-facing screens that we process in are now in the SAP system rather than our old, what we call ISIS Model 204 system, and it is able to deal with it.
Okay, could you take on notice then the details of what you're doing across all of your systems so that and the expected time that you will be compliant across all of your systems?
Understood.
Thank you.
Thank you very much, Senator Rice. We're now going to move on to outcome 3 in Services Australia, and I understand that Senator Grogan is going to lead with some questions.
My questions are related to the situation with Minda, which is one of South Australia's largest service providers under the NDIS.
Can we just confirm?
And I'm just actually confirming this to see that we've got the right people.
I think we're actually at NDIA.
I think we're moving now to NDIA. Yep. So we'll need to actually, we can just change over.
So one of the part of the line of questioning was for the NDIS Quality and Safeguards Commission.
Yes. So that's in outcome 3. Yeah. So are we okay to excuse Services Australia this evening?
That is the idea of going to outcome 3.
Senator Green has been very patient.
I'll be the first one to be reprimanded if I got it wrong.
Well, no, it's NDIS.
We just had the wrong agency. Yes, we're very helpful, but I can't.
No problem. Thank you very much.
Thank you.
So we'll just need the CEO of the NDIA.
CEO of NDIA is on the line.
I think Martin Hoffman is there.
Can't see the acting commissioner though.
Yes. Have we got the acting commissioner there?
The actuary's there.
So I will go from Senator Grogan to Senator Steele-John, who I know has some questions. And
with Mr. Hoffman has an opening statement.
I'll keep you focused.
Would you please table the statement? We are.
I'm not saying he does. I'm just saying I don't know whether he does or not.
No, I don't, Minister.
Great, thank you. So Senator Grogan, would you like to start with some questions?
Yes. I'm wanting to ask some questions around a South Australian organisation, Minda. It's one of South Australia's largest service providers under the NDIS. And I would imagine you'd be aware that in the last week or so there's been quite a lot of activity in a negative frame going on there. The Chief Executive Officer and the executive manager were notified last Thursday that they had been sacked. And in addition, following that, there's reports that there's a range of other staff members who have resigned from the organisation, including some key managers. On Tuesday night, we asked some questions of the Royal Commission into Violence, Abuse, Neglect and Exploitation of People with a Disability, and they confirmed that they'd had contact with the South Australian Shadow Minister for Human Services, Nat Cook, regarding a request to investigate the service. It has also been reported that on Monday, a midterm quality audit into Minda had commenced. I wonder if you could confirm that that you're aware of that series of events and that the audit was actually kicked off on Monday?
Chair, I think that's probably a question for the Interim Commissioner of the Quality and Safeguards Commission rather than the CEO in the first instance.
So is the Interim Commissioner on
She
the
is,
line?
yes.
Oh, yep, great. Mm-hmm.
Yeah, I think I'd flagged that was where the questioning was going to go.
Yes, it was, yeah. So
yeah.
thank. You're on mute, I think. Commissioner, I think you're on mute.
On mute. Got it now.
She's not on mute. Chair, I think maybe if we go to the CEO, because we can't hear the Acting Commissioner.
Okay, we might, Senator Grogan, you have questions of the Acting CEO?
I think the Commissioner's indicated that she can hear us, but we need, yes, so...
Okay,
yeah.
And that maybe she's going to dial
in.
Okay, great.
Chair, while the Acting Commissioner is doing that, can I just see if perhaps Mr Hoffman, whether you'd like to address any issues in relation to Minda?
Thanks, Minister. Good afternoon, Senators. Martin Hoffman, Chief Executive, NDIA. Certainly, so we've been in touch with the Chair over the past week, in addition to our ongoing engagement with providers. Certainly aware of the change of management there, and in our discussions with the board and now the chair and now the acting CEO, and we're particularly engaged with them on their billing and cash flow requirements. They've engaged KPMG to assist them with that, and we're engaged with them directly to assist. As you noted, the issues about the quality audit is a matter for Samantha Taylor.
So can I just, you've sought the services of KPMG to undertake...
No, sorry, not us. It's announced that Minda has to assist in their billing systems to ensure they're up to date and claiming cash flow from the scheme appropriately and so forth. And we have reached out to Minda and indicated that we'll work directly with them and KPMG to assist in that work.
Okay, and that's in the sort of administrative side of things.
Correct, yes.
Senator, my apologies. Hopefully you can hear me now.
Hear you and see you.
Excellent.
So maybe we could just, Mr Hoffman, have you had any contact with the South Australian government in terms of the situation that's on hand in Minda?
I haven't, Senator. Our provider engagement teams and state engagement teams are regularly involved with their counterparts in the state government, but I'll take on notice the exact details of engagement about the Minda situation.
But Senator, I can confirm too that I've heard directly from Minister Lensing in South Australia, and I would point out though that first and foremost, any allegations of abuse and neglect should be immediately reported to the NDIS Quality and Safeguards Commission. who should always be the first call anybody makes if they have any suspicions or evidence. And I think that might be a good entree into the Acting Commissioner.
Yes, thank you. My apologies for that technological problem. The Commission's been in contact with Minda about the changes to their executive leadership, and we've sought some advice to completely satisfy ourselves that those changes don't affect the organisation's ability to comply with their obligations as a NDIS registered provider. We've got no cause to consider that the changes will have any impact at all on NDIS participants, but we are in that regular contact and indeed have been continuously with Minda. It's one of the largest providers in South Australia, and as you would expect, we have quite a considerable amount to do with that organisation, given the number of participants whom they support. I have been in contact with senior officials in the South Australian government about the changes. They also obviously have an interest and some engagement with the organisation around services that they fund. And we are sharing information through the usual protocols as information comes to us respectively. I can also say that the Commission, there were allegations of, historic allegations of neglect of individuals that have been reported in the media over the last couple of days under the support of Minda. They are allegations that had been reported to the Commission some months ago, and which we had been at the time engaging with Minda on. We were concerned yesterday when we saw those matters resurface, that the issues that we had worked with Minda on to resolve any issues that drove the original anonymous allegations, they had been resolved at the time, but that they had resurfaced. So Commission staff attended various locations in Minda today to be satisfied that there were no ongoing safety issues for those participants, and engaged with multiple participants today, all of whom were very healthy, very well, very happy, which is always good to see. Senator, you also asked about whether the organisation was undertaking an audit this week. That is our understanding. Every registered NDIS provider who is registered through the method of what we refer to as certification, because they deliver supports and services which are higher risk, generally accommodation and other activities such as those, are required to undertake an audit at the mid-period of their registration. That's within 18 months of a registration decision occurring. For Minda, that is around now, and so it's pleasing the organisation is meeting its obligations in that regard to initiate that mid-term audit, which also involves some revision of any of the matters that might have been raised in a previous audit, but it also involves, where it's appropriate, site visits. That audit is then submitted to the Commission when it's concluded to give us assurance that the organisation continues to meet the NDIS practice standards that it's required to meet, and that are relevant to the supports and services that it's registered to deliver. So we will look forward to that audit when it is submitted by the approved quality auditor that they have engaged.
And I'd be keen to understand when that would be submitted. You'd be aware that the Aged Care Quality and Safety Commission went through a process, and Minda went through a process back in 2020, and then they closed down all of their aged care services. And I guess there's a concern that there's some recurring patterns here, and very concerned, one, for the staff who are working at Minda. There's been a significant number of concerns raised, and I believe a a complaint regarding some of the shift patterns and a media article about one staff member who did 4 consecutive shifts. So concerned that this issue could well be a quite challenging one, and really wanting an understanding of how long that audit's going to take, what sort of immediate measures are being put in place to ensure that, one, the clients are well looked after and people who are working there are actually being treated fairly as well.
Senator, there is a significant point of difference between the manner in which the framework for the NDIS works and compared to aged care. In the NDIS, the audits relate to a point in time and inform a decision of the Commission whether or not to register a provider and then to maintain a registration. And they test at a high level whether the organisation is meeting its obligations and complying with NDIS practice standards that relate to the supports and services that it's seeking to register. The Commission approves independent quality auditors that are independent businesses. There are 19 of them that operate across Australia. Train auditors, the audit body, which is selected by the provider, it's their decision, but they can only use an approved auditor. Minda will have engaged an auditor of their choosing. The midterm would be supplied to us. We will review it and determine whether or not the preconditions for registration continue to be in place for Minda. And it's a key monitoring tool for us. However, the Commission doesn't rely on those audits to monitor organisations. We have embedded within our functions a complaints function as well as a reportable incidents function. And those two functions, one which comes from participants and people in the community who might have concerns, being the complaints function, is used to surface issues that might be identified by affecting an individual's experience or an experience of a group of individuals. And the incident reporting function, of course, is something that providers are required to do where they are aware of incidents.
So I wonder if you could just tell us,
arise.
I'm very conscious of the time. I wonder if you could, and I think most people in the room are quite familiar with with those kind of processes. If you could let us know if you've had any of those complaints have been made about Minda and what the sort of timeline and process is going to be to resolve them.
So we've received, because Minda supports over 3,000 NDIS participants, we receive a number of complaints about them and work with the provider and the complainants to resolve those matters. I can't tell you, Senator, whether there are matters that are of the nature you've just described. I would imagine that we will have received complaints or indeed been advised by the organisation themselves of issues within their own outlets which cut to those kinds of matters, and we work to resolve those. The organisation has been, I think it's worth letting the committee know, and these two matters are in the public arena. Minda has been the subject of a compliance notice that the Commission put in place last year around seeking to address, and they were compliant with it, they've met the compliance notice provisions, but seeking to address a number of improvements that we required them to implement in their practices, primarily around medication management, but also other matters. We also have an enduring additional condition of registration, in fact, two, on Minda, one which relates to the manner in which they oversee supports that they provide to people who might live in the community and receive assistance with personal care activities, for example, and the other is a range of is about a range of improvements, ongoing improvements about the way in which they manage mealtime supports and other direct supports to people. They were very significant issues that we've been working with the organisation on for some time. I'm
that
happy
does
to
raise
share
a lot of
with the committee
concern. Yeah, I'm very conscious of the time and wanting to sort of be quite tasky here, really. Those issues are still outstanding and you're still working on them. Has there been any record of any major non-conformance on previous audits? I think the issues you were talking to were not considered to be major non-conformance, is that right?
The Commission can't register an organisation if there are major non-conformances. So, by definition, in registering MINDA, or rather, registering them as a transitioned provider, they would have been in conformance. The auditor would have undertaken an audit and sought, if there were any non-conformances, to have them remedied before they put a report to the Commission.
So you're saying that there are none?
There would have been no major non-conformances at the point that that they submitted an audit report to us to make a decision to register them, no.
Right, so and each of their audit reports have been no major non-conformance?
Well, there has only been one. We've been in South Australia since July 2018. Providers who transitioned from having been registered previously before the Commission were required to renew their registration. So MINDA will have renewed its registration, and so we would have received an audit report at that time, which would have gone through the whole of the organisation's operations in order to make a decision whether to continue with their registration as a transition provider or not.
Cool. And so the minor non-conformance, which were the ones you were referring to earlier, they have a 12-month period to rectify those. How many are outstanding? You referred to a couple of issues. How many?
Well, I referred to a compliance notice. So as part of our ongoing monitoring of an organisation, we can identify particular issues in particular locations which are separate to the audits that I've just described that inform registration. And we might require in the course of monitoring an organisation them to do other things which are much more detailed aspects of review and practice in the course of delivering supports. We put in place a compliance notice. I'm happy to furnish the Commission with information about that notice with which they complied. We asked them to do a number of things in that notice to rectify failings that we'd identified in their practice. Yes,
if you could provide us with that, that would be very useful. But one of the things that is sort of a burning concern is the issue of the understaffing, because obviously that leads directly to the level of care. Are you currently investigating that understaffing issue or looking into that understaffing issue?
So, Senator, I can say that we would continue to work with MINDA on a range of issues that might come up through complaints or reportable incidents. Matters of staffing, rostering and so forth may well be an element of some of those matters. I really am not in a position to give you that information right at this moment. Of course, where the obligation is on a provider to, under the code and as well as practice standards, to deliver supports with care and skill, with staff with the appropriate competencies and the right level of support to manage and provide supports in a competent manner.
Indeed, I think the question is whether they are actually doing that at this point in time, given where they're at. I know that there is concerns from the staff who are working there, and keen to know whether you have those complaints. Maybe you could furnish us with a breakdown of the complaints you currently have on hand for MINDA.
I will explore what the Commission can provide to the committee, given that the information that we collect through complaints and incidents is protected Commission information and may be applicable to an investigation that could be underway. Happy to provide some thematic data about those. The other thing I would mention, Senator, is that I've initiated, under the complaints and reportable incidents rules, an own motion inquiry into aspects of supported accommodation in the NDIS. I've targeted 7 NDIS registered providers who have a large market share of supported accommodation in this sector. Minda is one of the organisations that is captured by the own motion inquiry. I have an independent inquirer who has Mr. Arthur Rogers, who has a very long and pretty illustrious career in disability, and he is undertaking that inquiry for me as the acting commissioner, and that will involve delving into some of the themes, patterns and causes of complaints and reportable incidents within those 7 providers, and as I say, including Minda.
And so what
They've
would be
been
the
very
timeline
open.
for the completion of that?
So Mr. Rogers is due to report to me or the Commissioner in March 2022, and the terms of reference for that own motion inquiry are on our website, and I'm happy to furnish those.
Thank you. That
to
would be
the
great.
committee.
I guess in sort of wrapping up, the concern that Minda has a very large market share in South Australia. There's a significant number of vulnerable people for whom they are providing care and support, and the issues that they've been facing over the last couple of years, even if they are in different elements of their business, which, as you rightly point out, aged care provisions are different to disability provisions, but it does lend itself to a concern that that the care may be at question. And obviously, as I said, we're very concerned about the staffing, very concerned about what that's doing to the staff. There's anxieties being expressed there, but really the care for such a large number of people in South Australia requiring support is of huge concern, and really want an assurance that that the NDIS, NDIA, all of the involved people are actually genuinely looking at this in a very deep rather than a bureaucratic fashion to ensure the care for, and I understand that bureaucratic answers are the genre in here, but there is a reality about the care that's being provided for people on the ground in South Australia who are vulnerable and who are reliant upon the services for their well-being.
Senator, I absolutely agree with you, and I have, when I became aware of the changes in the senior leadership of Minda, I wrote to the chair of the board and asked her for a series of assurances about their ability to comply. It might sound bureaucratic, I accept that, but compliance actually cuts to the concerns that you've just described, and so those assurances are critical. Our team in South Australia is very aware of the scale and impact of Minda and other large providers there, and works very closely with them, very deeply concerned to assure ourselves continuously about the things that you are also concerned about. That's why they spent 5 hours in Minda today, because we, as I said at the beginning, we were concerned about media reports and the fact that they may have resurfaced matters that we had worked with the organisation to resolve some months ago. That was not what they identified when they went on site today. So that makes me feel much more comfortable. So we'll furnish the committee with the material that you've asked for today.
Senator, just a couple of, you raise a lot of very good points that I know are things that are shared by us all, and the fact that we passed the Safeguards Bill, as you know, Anne-Marie Smith Bill last week, I think is a very good demonstration of that. But as you obviously well know, quality and safeguards, whether it's in aged care, disability, is something that is an ongoing process, and we are actually doing a comprehensive review of the quality and safeguards framework next year, and there will be a lot of intersection with the changes to the aged care quality and safeguards framework as well. But I would say that I've heard of a number of these complaints through the media, through media inquiries, and what I would say to anybody, and I know that there's some colleagues have whistleblower sites, sort of websites and things now, but I would ask if any colleague or anybody in the media become aware of any complaints or any issues, please pass them on to the Commission straight away. I'm not saying don't refer to them in here or in the media, but it is far more effective and probably safer for the participants if whoever becomes aware of it actually doesn't wait to go to the media and have things played out in the media, but they go straight to the Commission as well, because otherwise the Commission has got their hands tied behind their back.
Well,
I'm not saying that. That's not saying anything in relation to you, Senator Grogan. It's just more of a general point. Is that people who go to the media, absolutely no problem with that, but please go to the Commission at the same time as soon as not you, but any colleague or any journalist
I would hope
becomes
that's
aware
exactly
of
what
this.
people have done, but I think
I'm not sure it is the case.
Well, and I think one of the challenges we face is that sometimes these processes are very lengthy and take on board the improvements that you're trying to achieve, but the reality of what's actually happening on the ground is a point I know of extreme frustration, and we see situations, as you just referred to, of people actually ending up in very, very dire situations. So I think that therein lies the role for the public commentary on these issues and shedding a light.
I'm not saying there's not, but I'd just say if anybody in this nation has any concerns or has any evidence or is working in the system, 1800 03 5544, ring that number and pass on that to the Commission so they can take immediate action to look into those allegations. Because ultimately, if someone has a concern, they need to go to the Commission or the NDIA so that we can make sure that that person is protected. And if we don't get that information, we can't do that due diligence. So, just a general point, because we all care.
Thank you very much. I'll now turn to Senator Steele-John. Senator Steele-John, are you on the line?
He was.
I'm ready to go.
He was. Here we are. Senator Steele-John, welcome back.
Hello. Now, give me a volume check, Chair. How are we hearing?
We can hear you well. Yep. And we'll hear from you for about 15 minutes.
Okay. Lovely. Thanks, Chair. So my first set of questions will go in relation to the Participant Service Guarantee Bill. And I think the first set will probably go to the Minister, but somebody else can take it if they're better.
Can we get Julie up as well?
Let me just start by saying, having looked through the bill, and I will note that the bill was introduced earlier today in Parliament. I have the opportunity to read through it. I have a concern in relation to some elements of the proposed amendment to the NDIS legislation. I have to be honest, especially the change that relates to allowing the CEO to vary plans of participants. My reading of this change is that it would give broadened powers to the CEO to enable him to potentially change, reduce plan sizes, remove supports without the consent, without requiring the consent of the participant who was affected by that variation. I know this is, and then that's section 47 of the proposed legislation, section 47A, variation of a participant's plan on the request of a participant or the CEO's own initiative. Now, I do notice that in the version that has been implemented, given to the Parliament today, there is a change from the exposure draft, which was given to community for consultation. And that change seems to be the addition of the sentence, each variation must be prepared with the participant. So I'm wanting to get a bit more clarity, first of all, on what is meant procedurally by each variation must be prepared with the participant, particularly what is meant by the word prepared.
Thank you very much, Senator Steele, John. And I think straight to Ms. Yeard. Yeah.
I'll let Julie start.
Senator, it's Julie Yeend. I'm Branch Manager of NDIS Governance Policy and Legislation. The wording in the variation clause reflects the existing wording in section 33 of the Act in relation to the preparation of a participant's plan. The previous draft of the bill, about which there was some commentary during consultations, did not necessarily have the participant knowing in all instances that a variation might be underway. This was prepared, this amendment ensures that there is no possibility of a variation being made without the participant being aware. The involvement of what that would mean is something that we will be working through with the NDIA as far as their operations go, but typically we understand that many variations that have been frustrated in the past in evidence to the Tune Review have come about from casual contact that's regularly made between the NDIA and participants, where they just want to do something fairly small to reflect their current needs. But the only option previously under the current Act has been a complete complete new plan to effect even a small change. So we are intending that involving a participant has the same meaning as currently in section 33, which is the participant will be contacted in the ordinary way that the participant prefers to be told about the variation and to be asked about it.
Okay, so am I to take it then that by prepared in this context, we're actually talking about the participant being informed that the variation has taken place?
Senator, it depends in every instance. There will be some times where there will need to be a discussion with the participant about the particular variation. Other times it will be correction of an error, and in other instances it may be something where the participant is, as you say, just informed.
Okay. And it is the case, isn't it, that there isn't, at least in line with my reading of the legislation, and it has this version of it's only up today, but there is nothing in the bill which constrains the which prevents the variation, one which results in the reduction of support or the removal of a support.
Senator, the intention is that variations are made for the benefit of a participant, and the intention after consultations is that the draft plan administration rules that were sent for consultation, that they be more restricted to what the Tune Review recommended a variation be. So there will be more specificity and less discretion for the NDIA in relation to what a variation will be than has been previously proposed.
But that
Senator, could I just add to that answer, if I may? Really,
Mr. Hoffman, I'll just finish with Miss Yeard, and then I shall come to yourself. So just because it's just my first set of questions in relation to the wording of the legislation. So just in relation to the wording of the legislation, and I hear what you're saying about the intent for the rules, but in terms of the primary document, there is nothing in this bill, in this section of this bill, which prevents or prohibits the CEO from making a variation, which is a variation that removes the support for the participant's plan or reduces the amount of funding allocated to that participant within that plan. Is that correct?
That is correct, Senator.
Thank you.
Sorry, it's Julie. Any such changes?
Sorry, Mr. Hoffman. Mr. Hoffman,
I'm a senior officer and I need to correct that answer.
Mr. Hoffman, I will finish my line of questioning with Ms. Yee, and then I will return to yourself. So just going also to the sections of the bill which deal with, and these are also, I will acknowledge, they are variations on what was given to us in the exposure draft of legislation. So if we go to page 10 of the bill as introduced to the Parliament. I apologise. No, it's page 9. It says that it's a number of areas. It says, find the language here. So it talks about the CEO having to have regard to, and then it lists between A and E issues like regard to the participants' statement of goals and aspirations, regard to the relevant assessments conducted in relation to the participant. It goes on like that through to section E. Can you tell me, Ms. King, when we're talking about this language of regard, what constitutes regard in this context?
Senator, that is to ensure that any variation is still in keeping with the remainder of the Act, that the variation, if it does deal with difference of levels of funding, that it is still reasonable and necessary. So as must the plan in the original been reasonable and necessary, so it must when varied.
When varied, be the same. I would also like to know, so the regard point, and forgive me, this is probably not the right language. I'm not, don't have a legal background myself, but when we're talking about regard, the standard of regard is met when, would the CEO have to demonstrate a linkage between participant goals and aspiration, a link between relevant assessments conducted in relation to participant? I'm just wondering whether it has to be more than simply, oh yes, I regarded them in the process, or do you indeed have to be guided by them?
Senator, I would need to defer to the NDIA. It's an operational question on how it happens. The net result of it must be, however, that the plan remains reasonable and necessary in accordance with the remainder of the Act.
All right. And in the section so it remains reasonable and necessary in relation to the Act. Okay. Subsection 1 of the legislation as currently drafted says that the CEO may, in writing, vary a participant's plan, accept the participant's statement of goals and aspirations if the variation is a change to the statement of participant supports in the circumstances prescribed by the National Disability Insurance rules, or a correction of a minor technical or technical error, or of a kind prescribed by the National Disability Insurance Scheme rules. So in the context of the legislative aspects which support a participant plan, this means, doesn't it, that these varying powers extend, or the powers of variation, extend to all parts of a participant's plan except the participant's statement of goals and aspirations. Is that correct?
Yes, Senator.
All right. So, and that they, in effect, are funding, that's funding that is supports allocated in the plan, everything to do, and everything that flows with that is enabled to be varied under this legislation, except for the goals and the aspirations. Correct?
Yes, Senator, it reflects the nature of the small and variations that have been requested in the past.
Okay, and just to finish up this kind of legislative line of questioning. Just to be clear, when we're talking, if we are talking about everything in the plan except for the goals and aspirations may be varied under this legislation, And when we're talking about the kind of references to prepared with the participant as listed then in the bill, we're actually talking about the ability of the CEO to vary those elements and only to have been required to inform the participant that variation has taken place. Is that correct?
Senator, that's not necessarily the case. It depends on the variation that's been sought. In some instances, it will be more than just a notification, but it's the reason for the use of being involved because of the varying nature of that potential involvement. It could be as small as a notification, but it might be much wider.
Okay, and the section of this bill that deals with the question of what processes may be triggered in relation to a participant request. So leaving the CEO element of this for a second, but just going to the parts of the legislation that deal with the process should the participant request a variation, to ensure that I've understood those correctly. I think that's section, bear with me a moment. Yes, it says that basically, I think the intent of the legislation, correct me if I'm wrong, is to enable, should a participant make a request for a variation, that request may be, about four things then can happen, if I understand the legislation correctly. The variation can be, the request for variation could be granted, the request for variation can be denied, an additional full reassessment of the plan can be granted, or a mixture of all three. Is that a correct understanding of that section of the legislation?
Senator, the first three were correct. The third, and all of those decisions must be made within 21 days. The fourth is when the variation is such that the agency requires more time to determine whether or not the variation should be made. But all of those four things would be known by the participant within 21 days.
Okay, so I will go to the CEO. This is my last legislative question.
Unfortunately, your time has now expired, and I do think it necessary that we go back to Mr. Hoffman, the Chief Executive of the NDIA. I think he wanted to make a statement in regards to some evidence that had been presented to you. So we will hear from Mr. Hoffman. If there's any questions that arise from that, you're welcome to put them on notice, and then we'll go to Senator Hughes. Mr. Hoffman.
Thank you, Chair.
Sorry, excuse me, Senator Steele-John. We're hearing from Mr. Hoffman at this point. Yep, Mr. Hoffman.
Yep.
Thank you, Mr. Chair. Senator, I'll be very brief. The constraints or the control over the variation power of the CEO in respect of funded supports is that any change must still be done in accordance with the Section 34 process, which is not just having regard, but as you know, is being satisfied of those factors in Section 34. And when you look at Section 33 as well, the statement of participant supports, funded supports, is actually prepared with the participant and then decided by the CEO. The same would apply to the variations power in respect of funded supports. So Ms. Yend is an excellent witness, but just that slight addition to the control in terms of the limits on the CEO power was an important point to make. Thank you.
Thank you, Mr. Hoffman. And I don't think Ms. Yend will mind, but Ms. Yend was nodding in affirmation at the evidence that you've just provided to the committee. So I wouldn't do that normally, but thank you very, very much. So there is an opportunity to return to you, Senator Steele-John, but I'm now going to Senator Hughes.
Thank you, Chair, and thank you, Mr. Hoffman. It's unfortunate you're not here in person with us, but I just want to ask a couple of questions, and I will try and keep them quite tight. And if there's things that you would prefer to take on notice to come back, I'm very happy with that. also keeping in mind, hopefully this is going to save us a day of the autism hearing potentially, because we might get enough today going forward. So with regards to the early childhood and the ECEI, obviously we very much welcomed the announcement that the NDIA wouldn't be proceeding with independent assessments. But how will that announcement impact the NDIA's ECEI implementation reset project? And on that, can you provide an updated timeframe for the implementation of the NDIA's early childhood approach?
Thanks very much, Senator. I wish I was in Canberra as well. The early childhood approach reset had a number of recommendations, something like over 30. One of those, of course, was consistent with independent assessments, but removing that doesn't detract from the great other value and improvement we will make in that program. We put an update out on the 11th of October that gives an update to recommendations already in place and recommendations that we will continue to consult, liaise and co-design with going forward over the next year and then the year after that. So it might be best, Senator, just in the interest of time, if I pause there, refer to that public statement and can give further information on notice if you wish.
Excellent. That would be very helpful. So with regards to the Helping with Children with Autism, so HAQA program, could you provide us an update on the status of children who've transitioned to the NDIS from the HAQA program, but also from the autism-specific early learning and care centres?
And yes, but if you just be perhaps more precise, if I may, an update in what sense?
Well, how many are there? Where are they up to now? Right. How many have stayed on the NDIS? How many didn't come across? Do you want me to give that to you on notice so someone can have a look at that?
I think that would be best, so we can be precise about the sort of data sets we need to access.
Excellent.
There.
Yeah, okay.
Thank you.
Complex needs pathway. So we do understand there's a lack of awareness around the complex needs pathway as well as difficulties accessing it. So we have seen one organisation report that the pathway was not used for an autistic man who needs 2 support workers whenever he's not with his parents and has a plan of around $300,000 per year. And we've seen some other reports that people have only been able to access the pathway once they were at a crisis point. So again, you might want these on notice around how many autistic people are currently accessing the complex needs pathway and how many autistic people have been refused access to the complex needs pathway. Any challenges and difficulties people are having accessing the pathway, but also looking for an update around provider of last resort arrangements under the NDIS. And the last one in particular I'm really concerned about because there's more and more stories sort of that are coming through to us around relinquishing children when there's concerns about supports not being appropriate. So obviously when kids are entering that adult stage, provider of last support is really important.
Certainly, happy to take some of the data, or take the data requests, the numbers, etc., on notice and provide those. We are doing a serious piece of work in developing and reviewing the complex support needs pathway, the entry to it, criteria, the supports that's provided, how it's done, by whom it's done, and for whom it is done. That work is ongoing and will be rolling out and continued in consultation and engagement through the end of this year and early next year. I do appreciate that complex support needs area is an important one. In terms of provider of last resort, we work very closely. If someone is at that point, then both our complex support needs staff themselves, the support coordinators involved, our hospital or justice liaison officers can be involved. We'll certainly be seeking to ensure that there are providers, alternate providers, and there are provider exit protocols that we put in place to transfer participants when required, when there is a provider who, for whatever reason, relinquishes support to a particular individual.
Yeah, I think, just as to foreshadow, we might have to have a little bit of a look at that through the autism inquiry, because we're having a number of providers are moving away from dealing with particularly severe behaviours and really leaving these kids who need very significant supports in a lot of trouble because no one will take them. So it is definitely an area of concern. SDAs, Specialist Disability Accommodation. Autistic people, again, those with very complex needs, are likely to need SDA in the robust category. We have had reports, one family, that it took between 2 and 3 years contacting disability organisations in order to find an SDA provider who was willing to build in this category. Again, these are figures you might want to take on notice. How many autistic people are currently receiving SDA support, including and particularly in that robust category? And are you aware of any SDA providers whom are unwilling to supply housing in the robust category? And does the NDIA have figures on the demand versus supply of SDA housing in that robust category?
Senator Hughes, I might ask the CEO, Mr Hoffman, to answer that question. But the issue of SDA in terms of supply and demand is something that I've been focusing on very significantly with the sector and also with the NDIA, because I think there is more work to be done to match supply and demand, and a lot of good work has already been done, but I think more work does need to be done. It's not just the federal government, so it's an issue that I've taken up with states and territory ministers, and we are currently sort of having a look at that with the sector. But in relation, my understanding, Mr Hoffman, I might be wrong, but that there was actually, certainly when I became minister, there was more robust housing than there was demand. But whether it was in the right locations or not, and how accessible it was, I'm not sure. So I might ask the CEO.
Thanks very much, Minister, and we can certainly take some of those questions on notice. We've certainly seen a strong growth, though, in robust accommodation. In the 18 months to June 21, there was almost 100% increase in robust supply from 191 dwellings to 379. And some of those dwellings, of course, will be more than single person. So we are seeing a market response. In terms of supply and demand matching, we're now publishing supply and demand data quarterly at the statistical area 3 level, so allowing that greater granularity of both the demand for and the supply by the sector of robust and other forms of SDA accommodation. I think the other point you made in terms of, we can certainly get data on participants with a primary disability of autism in SDA, and we're pleased to provide that. And we might even be able to do that before the evening finishes, depending on the time. And I think the last point you made there, in terms of providers refusing, I'm not sure that's quite the right construct for SDA.
I said unwilling to supply, so not necessarily refusing. It's what they're willing to supply to the market.
Yeah, indeed. So the providers are developers, suppliers. They choose what accommodation and where to build it. That's the nature of the market. As I said at the start of my answer, we've seen a doubling of the robust supply in the last 18 months. So there certainly are providers willing and actually building in that space.
Okay. I'm actively ignoring the Chair's look at the moment. I just have one last thing that I would like to raise with you. And really this is just for your information, Mr Hoffman, because I'm sure that plenty of people, I'm sure plenty of people will be aghast at this, but I had a mother contact me via someone who's got 2 children as participants, who was told by her planner to be very mindful of what she put on social media as planners were reviewing participants and participants' parents' social media to determine the level of disability. This came to me literally yesterday, so as you can imagine, I'm sat in aghast horror since then. As anyone who's a parent in this room would understand, you share your children's successes, you do not share the failures. And I could give you a couple of stories, which I won't, about my own son that don't go on social media, but certainly we celebrate his successes loudly and wildly. So if you can perhaps just take that on board and perhaps as part of an internal communique, suggest to planners that what parents put on their social media celebrating their children's success does not reflect the level of disability nor the permanency of it.
Senator Hughes, I think, I'll ask the CEO to address that because I'm sure he can, but I'm absolutely confident that that is not policy, it's not accepted procedure.
It's not policy, but that kind of attitude is highly problematic.
Yep. Mr Hoffman, would you like to address
Certainly,
that?
Minister, just to confirm that that is not process, it is not procedure, it is not policy. It is not, does not form evidence that is appropriate or suitable for decision making under the Act. Certainly not aware of that. There's no internal process like that at all. And thank you for raising it.
Thank you, Senator Hughes. Senator Green.
Thanks very much. Does the final version of the disability sector COVID-19 vaccines implementation plan exist?
So can you say that again, Senator Green?
In March, the Department of Health said there would be a disability sector COVID-19 vaccines implementation plan published soon. Is the final version, is it ready? Someone's got some information.
The vaccination plan? That's actually a health plan, and the plans are actually online. We have certainly, so if you're actually asking what DSS have done, the NDIA, the Commission with the sector, we have been working with health on their plan for many, many months. And as you can see that in the results, but I'll stand to be corrected, but that is certainly a question for health.
Yes, Minister. Luke Mansfield, Acting Deputy Secretary, Disability and Care, is best direct to the Department of Health.
Well, let's not get cute. Health was here yesterday. I'm asking you because we're talking about disability vaccines. We've asked them some questions. We've got some questions for you as well. But where is the plan? I just need to know where it is.
Just to clarify, I completely understand your question, but so just to clarify, the policy and the policy implementation is health, not for nationally, including for disability, but we can certainly provide in terms of if you're looking for statistics and facts and figures and information on how our role in implementing that, absolutely we can. It's just the policy itself is a health policy.
But where is it available? I'm surely you know where it is, Mr Mansfield.
I'm not aware whether it's been published on the health website.
We can take that on notice if you like, Senator Green.
That's why I'm asking you.
It says it will be released soon.
That's on the health website?
Yeah.
Yeah.
And the NDIS Commission, let me just have a look.
That's why I'm asking you, because we can't find it published on the health website. So have you seen a copy of it?
We'll take that on notice and talk to health.
But does it exist? This seems like such a ridiculous thing to not be able to answer. I'm sorry, but there should be a final version of the plan, right? In March, you said the government said it was going to be done. Is there a final version of the plan?
I will check during the course of this hearing and get an answer to that question.
The NDIS website says that it's not done. It says that the NDIS Commission will share the implementation plan as soon as it is available. Therefore implying that it's
as I said,
we'll
check
available.
because that is a question for health. So Mr Mansfield has said that he'll check. In fact, I can see his fingers doing the walking right at the moment, so we'll see what we can find for you over tonight.
We'll come back to it. Can I just ask in regards to the reduction of people under the age of 65 living in residential aged care. Is that, how are those numbers counted so we can see the reduction of those people?
What do you mean the reduction of numbers?
Well,
the numbers have been going up, not down, in terms of...
People under the age of 65 living in residential aged care.
Yeah, you're trying to get those down.
I assume they're not going up, Minister. We don't want.
Sorry, are you talking? Sorry, are you talking about the? Sorry, I thought you were talking about the actual participant numbers. Are you talking about vaccination rates now?
No, I'm talking about.
Oh, sorry, I completely misheard you. Didn't hear the young people in aged care.
Young people living under the age of 65 living in residential aged care. Are they? How are those numbers being counted? How are you getting those figures so you can keep track of where that rate is at?
So, Senator, can I ask more information about what you mean by that? So, obviously, between the department, there's a task force that involves the Department of Health, the NDIA, and the Department of Social Services, and we are very, very regularly tracking the progress against the government's plan for getting younger people out of residential aged care. There is data matching that occurs between the Department of Health and the NDIA to determine, which participants are living in residential aged care. And then there is tracking that occurs as people enter and exit residential aged care where they identify with a disability. Is that the question?
Yeah, I want to understand what information you're drawing on to keep track of whether that number is going down. And then is the number going down?
The number is going down. I'm happy to provide you with the latest, the statistics to 30 June 2021. So over the period 30 June 2020 to 30 June 2021, there was a 43% reduction in the number of younger people entering residential aged care when compared to the 12 months prior.
Sorry, you said entering aged care?
Entering.
Yeah.
There was a 23% reduction in the number of people under the age of 45 living in residential aged care.
Entering or living?
Living in residential aged care. And there was a 20% reduction in people under the age of 65 living in residential aged care.
And how many people, and I appreciate this is quite a morbid question, but I'm keen to understand the makeup of the figure, but how many people living in, how many people have left residential aged care who are under the age of 45 have left because they've passed away?
I don't believe that I have that data with me, Senator.
Sure. But it would be captured in the 25%, is that right?
It would be captured in the number of people that have exited aged care. Yes, that's correct. And just to clarify, Senator, in terms of the source of the information, it's Australian Institute of Health and Welfare analysis of Department of Health data. And that uses the latest available information as at 30 June with NDIA data.
Mm-hmm. And if you can also provide us the figures of people who've, under the age of 65, who've left residential aged care because they've passed away.
Yes, Senator.
And because I assume that is part of the percentage that you gave me as well.
It would be part of the percentage, Senator.
Sure. Why are you counting people who've passed away as part of that figure? Because they've left not because they've moved on to other accommodation, or that's not really the goal of understanding the reduction, is it? I mean, sadly, some people do pass away while they're in aged care, but why have you decided to include that as part of the figures that you gave me?
I might just Senator Green, I'm not sure that that's what Mr Mansfield said. He said he didn't have the figures, but so for example, the figures that we do have, 14% of NDIS participants exited to their own family home, either rented or owned. 34% have exited to go into SDA, and 37% have exited to other group residential settings, such as SIL-funded accommodation. So I don't think that, I'm not saying it's not, but I don't think you can make that conclusion yet until we've come back with the data.
Right, but I asked Mr Mansfield if the figures he was giving me did include people who had passed away, and he said yes.
I said that I will check as well,
Okay.
Senator, so I will check.
Check the numbers, but it would include
But
that
it
as well.
includes all of the things that the Minister...
Of course. It just... could you give us a breakdown then of how many are in hospital... how many of those people who have exited have gone, as the Minister was sort of alluding to hospital, NDIS, SDA, group homes, private residence or any other locations? If you can give us the breakdown, not right now, but on notice.
So I've just given you those.
No, those are percentages. I'm keen to understand the numbers. Yeah.
We'll take that
We
on
can-
notice,
we can do
Senator, and see...
Because I don't have the initial numbers. So you can say 13% of whatever, and I don't really know what that means.
I'm happy to provide that, Senator. So
Yeah.
if you like, in terms of people entering, younger people entering residential aged care, it's a decrease from 1,250 to 712.
I'm talking about the people that are leaving, Mr Mansfield.
I'll take on notice.
Yeah. I'm being very deliberate in my questions. I know what I'm asking. Okay, can I just go into another matter? Minister, I don't know if you would have seen a story today. It's only really been brought to my attention. It's just in regards to an NDIS, a woman who I think is a carer for an NDIS participant. I'm just going to talk the Minister through it in a second.
Have you got a name there, Senator Green?
Yeah, I am.
Because I've got some the cases that I'm aware of. I've got here by name. So if you can just give me the participant's name, I'll be able to tell you whether I've got the information or not.
I just want to check whether the article, I do have a copy here, so I could probably just flick that to you. I don't think she's used her last name in the article.
Who was the article by?
It's the Sydney Morning Herald, and it's about Carly, who's a single mother. She's has a 8-year-old son with severe autism. It's only, why don't I just provide a couple of copies and we can go through that. And while we're doing that, I'll just double check a couple of details because I'm not 100% familiar with how this works. But does the NDIS considers the circumstances of a person's primary carer when deciding the level of funding? That's right, isn't it?
That's actually a technical question in terms of assessment, and I might defer to Mr Hoffman.
Sure, thanks.
Thanks, Minister. So, yes, the level and capability of family supports or informal supports, as they're perhaps unfortunately called, is a factor in the circumstances of a participant, leading to the levels of reasonable and necessary care. We are aware of the media case that I think you're referring to.
When I have questions about it, I'll come to you, Mr Hoffman.
Oh, sure.
I just want to wait. I want to give the Minister the benefit of having a copy in front of her as well.
I haven't got the copy, but I've just pulled it up. I think when you're talking about, it was a story in The Age today by Dana Daniel in relation to Carly and her son Lincoln. Is that right?
And we've got some copies coming as well for other committee members. But just so I understand before I ask questions, so I've got this right. If someone is unhappy with an NDIS decision made at review, can they apply under Section 100 of the NDIS Act to appeal that decision?
That's my understanding, yes.
Just
Mr Hoffman?
check with Mr Hoffman.
Yes, to have an internal review of that decision, yes, that's under Section 100, correct.
Or is it an internal review, or is there another type of review that they can?
No, well, it's an internal review done by a different decision maker delegate within the agency than the original decision maker. Past that, it would then go to the AAT for an appeal if that was if the participant wanted to do that.
Is if you request a review under Section 100 of the NDIS Act, is that automatic that you get that internal review? Is it just as soon as someone makes that request, then a review is automatic of that request? Is that how it works, or can the NDIA make a decision not to review?
So there are, yes, where the decision is a reviewable decision, as set out in the Act, then the request for a review of that reviewable decision, RORD, is an automatic entitlement under the Act to the participant. Yes.
Okay, and where...
The distinction is with a participant requested review under Section 8, where a participant at any time can request and this is one of the things that's been changed in the Act because the word review was used in two different senses. But where a participant requests let's call it a small R review, or in the new language of the new Act, potentially subject to Parliament, a reassessment, where a participant requests a reassessment of their plan, that is a Section 48 request. That does the agency, the CEO, my delegates can decide whether to accept that request or not. If they accept it, then the Section 48 reassessment of the plan proceeds. If they decide not to accept the request for a reassessment, that itself is a reviewable decision that triggers the ability for a Section 100 review.
And
I hope that's clear, but that's the way the Act works.
Well, it's probably not clear to the people that need to access it. What if it's not a reviewable decision? What if something's been decided and it's not a reviewable decision? What's the options there for the person?
If it is not one of the defined reviewable decisions, and the list of reviewable decisions is quite lengthy,
yes.
It does cover almost everything, where there was something that we had done or decided that wasn't a reviewable decision, and the participant, for whatever reason, was dissatisfied, then it would be treated as a complaint. They could put a request and a complaint in, and it would go through.
Okay, so I think everyone's got the article now, and just to confirm, so Carly is the single mum to Lincoln, a 7-year-old autistic NDIS participant. Carly's been going through breast cancer treatment, but Lincoln was approved for just 5 hours of NDIS support. The funding is running out, but NDIS denied a request for extra support worker hours so Carly can go through treatment. And the article says that she was ignored when she asked for a review of the decision under Section 100 of the Act. Clearly, this mother is at breaking point. And, having you've just explained the review process to me in quite a lengthy and technical way. I can just imagine what it would be like going through cancer treatment and caring for an 8-year-old son at the same time with autism. I appreciate there are some things that you may not be able to share, and Carly has chosen not to share her last name with this publication. But why would a participant like Carly not be allowed to exercise her right under appeal under Section 100? And Minister, you said that were you aware of this article before I raised it, or aware of the issue and the request from Carly before I raised the article with you?
I think it had been raised with me in passing. But I have just
in passing, when like preparing for estimates, like this might come up, or in
I
passing,
I get reports every day.
we really need
So
to
I get
help
reports
this
every
woman.
day from my staff about current issues and also current issues that have been raised in the media. So I do get regularly updated, and of course anything that we get, we do seek advice from the Commission or the NDIA or the department as necessary. But I can just say, so I have just asked while you were talking, and my understanding is that Carly was contacted yesterday, and we were expecting the review officer to call her yesterday, but I haven't got any update on that. But can I just say, these situations, and particularly Carly's circumstance, are incredibly challenging. They're difficult, and there are other support services that we could look at referring Carly to, as well as the NDIA. But I understand there is an existing plan, and the reviewing officer will talk to her today. Mr. Hoffman, have you got any additional advice on that you can share?
Thanks, Minister. I might ask Mr. McNaughton to talk about this in terms of, without going into the private and specific details of the case, but the process and timelines Mr. McNaughton can talk to. Thank you.
Thanks.
Yes, thank you, Senator. Scott McNaughton, General Manager of National Delivery. I'm aware of the case, Senator, and certainly thoughts are with Carly as she's going through this challenging battle with health. She hasn't been denied a Section 100, been working through that process with her. I can't obviously go into the detail, protect her privacy, but we have been seeking the additional information we've needed to assist with the application. Our review officers have been in contact with her support coordinator and herself. There was another conversation with Carly just today. We expect to finalise the review by the end of this week. And as the Minister said, that will include a review of the NDIS plan, but also making sure that any other external mainstream supports that we can provide for Carly during this difficult time will also be provided.
Sure.
I can also just add that...
Mr. Hoffman, can I just... We don't have a lot of time tonight, and I do have some more questions about this. I've got some general questions I can come to, but just on this particular case, when did... if you can come back to me, Minister, I would like to know when you became aware and if you intervened at all. And just from an NDIA point of view, I understand that you received or may have received advice that Carly was talking to Meryl Swanson, her local member, about this issue. And it seems that she didn't really get... Sorry?
Do you know when?
For you, Minister? Or?
Yeah, so, just in terms of Ms Swanson, do you know, have you got the details there? And
in the article it says that she was ignored until she told the NDIA that she was talking to Federal Labor MP Meryl Swanson. And so it appears...
I'll go back, well...
This is what it says. I'm wondering if it came to you
in...
first or whether it had to be raised...
Well, as I said, this story only was only published today at 12:30 today. So it appears that this is, well, this story's only been out for in the public for several hours, it appears.
So that's when you knew about it, Minister?
So I'll take that on notice. I said earlier on, I'll take that on notice and check for you. It's not a problem.
And when did, Mr Hoffman, if you perhaps could let us know, or let Mr McNaughton, you seem to have quite a bit of information, when did you decide to action the Section 100 request?
Senator, the Section 100 request was initially lodged back in end of August. We sought additional information from the support coordinator and the participant during that period. There was, as you can imagine, we often seek additional functional information to support the review. In mid-October, there was additional information from the support coordinator and the mother that there would be additional functional assessments forthcoming. We received that information on the 21st of October. and we have since acted from getting that information on the 21st of October, have been working with the Senior Review Officer on updating that. And I understand the conversation today with the Review Officer and Carly went well, and they'll have a final decision by the end of the week.
I've just got a bit more information here in terms of your request, Senator Green. We're not aware of any letter from Ms Swanson. However, my office did receive the media inquiry from the Sydney Morning Herald on Tuesday this week and sought advice from the NDIA on Tuesday.
Okay.
But can I just also just point, so you've raised this article here, I think, and Mr Shorten is actually quoted in this article saying...
Well, I haven't asked you a question about
but
Mr.
sorry, it's all relevant.
No,
so
well,
not only
it's-
were they refused their right of review, well, I think from what we've heard today from the NDIA, that is actually factually incorrect. They were not refused, she was not refused a right to
Mr.
review.
Reynolds,
You've circulated this and I'm just...
No, now you're ad-libbing and now you're just trying to...
Well, Senator Green, you can't have it both ways. You've actually given it this to me to comment,
No, I
so
can-
I'm reading it and
The
now
way
I'm commenting
that
on
no,
it.
excuse me. The way that I will have it is that I will ask you questions and you will answer those questions.
Excuse me,
Like-
Senator Green. The reason we table documents is to make sure that there's a correct and accurate characterisation of the document, and in this case, the media article by senators. This is not a reflection on
But
you,
if
but it
there's
is
no
common
need-
practice
there
for
is
some
no
senators to misrepresent media reports and other things. I think it's totally appropriate
Well,
that Senator
that's not what
Reynolds,
the
now
Minister
that
is
she
doing,
has
Chair,
a
with
copy
respect.
of the media report, correct the record where necessary now that that's been circulated.
That's-
So
If we could
thank
just
you,
make it
Chair.
brief, please.
We
So
will
I'll make it
disagree.
very brief,
I disagree.
Chair. So
and
in
I can
relation...
call point of
there's a
order if
process for
necessary.
disagreeing. Please
There is
continue.
not, this is
So-
an open opportunity
Please
for you
continue,
to pick apart
Minister,
the article.
because
Well, look,
Read it
thank
into
you,
the
Chair.
record,
So
yeah.
in relation to the document that Senator
Seriously?
Green has tabled, I've now had the opportunity
Yep.
to review it. And as I've said, I don't believe I got a letter from Meryl Swanson, which is one of the questions from Senator Green. And I can also identify here where Mr Shorten has claimed that they were refused a right of review by the NDIA. And we've now heard evidence from the NDIA tonight that that was not the case. They were not refused a review.
Thank you. Senator Green.
Minister, have you met with Liam Danner's parents yet?
No, I have not. I have extended an offer to do so several times through my Chief of Staff, and I have an open invitation. And Mr Danaher indicated he would advise me when the time was right, and the time was, as I understand it, when he got the final report from the NDIA, which, as you know, has been subject of discussion between himself, his lawyers and the NDIA.
And when are we... So he has received that final report?
Well, my understanding, I'll defer to, because it was an NDIA report, and I understand that the NDIA did submit the final report to Mr Danaher earlier this week, but I will ask Mr Hoffman to confirm those details.
Yes, Senator, end of last week actually, but yes, it is, the final report has been provided to the family.
And what is the process, I guess, from there? Is it I mean, I'm sure that Mr Danner is keen to understand what went so horribly wrong for Liam, and would certainly appreciate the information in that report. Is it the case that that report on consent of Liam's parents will then be made public, or what is the process from there?
I will certainly defer to Mr Hoffman on the process in this, because this is something that was led by the NDIA. Mr Hoffman?
So we have provided that, as I said, at the end of last week. As part of that, we were very pleased to offer to meet and discuss it if the family wished. And I would imagine as part of those discussions, matters about release would be discussed then.
Senator Green, I'm just going to seek your cooperation. We've now got 10 minutes until 7 p.m.
Sure.
Senator Steele-John does have some questions specific to the Minister.
Well then, two things. First of all, I asked about the disability implementation plan if before 7 o'clock someone could come back on that, just hold that thought. And then, my final question about Liam and his parents was just that I wanted to understand, Minister, if you had seen a copy of the report, have you seen a copy of the report?
Yes, Senator Green, I got a copy of the report yesterday, and so I did read the report yesterday, yes.
Have you haven't reached out to Liam's parents since receiving a copy of the report?
Not yet, because I'm still, it's a very considerable report.
Yep.
So I've only started reading it yesterday, so I will certainly do that. And Mr Danher also knows that he...
Through your Chief of Staff, or will you do that personally?
Thank you very much, Senator. If I might, sorry to interrupt this, but...
This is a really
I think, Senator
issue.
Green, you understand
Very
exactly the
sensitive.
predicament that I'm into, and I'm seeking your cooperation so that you can support Senator Steele-John.
I'm trying
Nothing
to support
do with
the Minister
myself.
letting her
Senator Steele-John, if you
answer
could
Chair,
begin.
with indulgence, just I've got a couple of other
So
questions.
Senator Reynolds, we are finishing at 7
that's
p.m.
fine.
as a courtesy to yourself.
Thank you.
Yes, Senator Steele-John.
Thank you. Thank you, Chair. Minister, as you've no doubt heard from disabled people and our families during your time in the role, NDIS plans, the contents of those plans, the supports in them, they're our life. What's in those plans and what's not in those plans shapes our everyday existence. And so the contents of those plans are really important to us. As I'm sure you've heard from people,
yes.
My concern, my really deeply and authentically held concern with the Participant Guarantee Bill in relation to Section 47 is that the relevant section empowers the CEO to change that vital plan without a disabled person, without the participant or their delegated authority on their plan, from having the opportunity to say yes or no to whether they want their plan to be changed. That is the core of my concern, because it does matter so much to disabled people as to the contents of that plan. It's the difference between getting you out of bed in the morning, being able to do that, or not. So I just wanted to reflect that back to you and ask you, in terms of the legislation that you have proposed, can you see the problem at the heart of that that proposal? Do you kind of, does that make sense to you, that nature of that concern there?
Well, look, Senator Steele-John, thank you very much, and can I thank you most sincerely for your engagement with me, with the department, and with the inquiry to come up on this. I absolutely understand what you're saying, and if I was an NDIS participant, and this was my life and my way of engaging with society and about exercising choice and control over my own life, I absolutely understand what you're saying. And I understand why people have concerns, which is why we have made a change from the exposure bill to the bill that has been implemented. I would suggest, this committee is going to be doing an inquiry, further inquiry on the bill, and I think that this is something that is very important to further examine. But can I just make the point, and I think Ms Yind did make the point, which is a very important one, is that this amendment is actually no different to existing processes, as the CEO has outlined, because the NDIA both the NDIA or a participant can request a review, or in this case we're talking about in case of a variation. But the NDIA is still the delegated authority responsible for making a reasonable and necessary decision, and it is not the participants. It is not for the participant to decide whether to accept the decision or not. And there are processes that exist which would still be available to them if they weren't happy. So I do understand, but again, ultimately this is an insurance scheme and somebody has to make the decision. and that decision in the legislation is already the NDIA. So I think, while I understand the concern, I think clearly we've got more to do to explain this further to participants and to their, those who look after, care for them, or actually represent them. So it is actually no different, and ultimately, no insurance scheme ever has a participant who actually is the decision maker on their own plan.
So, Minister, I think the nature of the concern here, putting aside whether the process is the same, it's the granting of the power to vary as opposed to the power to make a change to the plan, as opposed to the power to ask that the plan be reviewed, which is a different outcome. But I want to ask you another set of questions, please, before you have to leave. So it's in relation to the becoming a participant rules that have been put out in draft form, particularly the section that goes to a proposal to kind of limit the fluctuating and episodic clarifications to psychosocial disabilities, and to clarify them. I am concerned that there is a potential risk here that people with fluctuating or, say, episodic impairments that may spring from a psychosocial disability, a non-psychosocial disability, just to be clear, may be excluded from the scheme or face the potential from exclusion from the scheme based on these rules, because there are, of course, disabilities that fluctuate or are episodic in their impairment impact, which are not psychosocial in nature. So I'm thinking in particular of muscular dystrophy, chronic fatigue syndrome. In a recent AAT case, I believe there was even a finding that types of kidney disease can result in these types of episodic fluctuating impairments. So is it the intent of the legislation to exclude people with fluctuating impairments from accessing the scheme?
Look, Senator Steele, John, this part of the reforms that are in the bill have been extensively consulted with the mental health sector, and we've had almost, in fact, not universal support for these. My understanding is no, but I will defer to Ms Yeen for the technicalities in relation to your question.
Thank you, Minister. It's Julie Yeen, Branch Manager, NDIS Governance, Policy and Legislation. Senator Steele, John, you would probably be aware that the NDIS already has a number of participants that are on with the sorts of disabilities that you describe. There is no intention that the rules in relation to psychosocial disability being fluctuating and being considered permanent. The explanatory memorandum makes clear that that is in no way to limit other people with disabilities that are not psychosocial but are fluctuating or episodic from also being able to become participants. While there are specific mention of psychosocial, because it is understood, I understand that condition often presents fluctuating and that has been a concern for entry to the scheme. There is no intention to limit other fluctuating conditions from being considered permanent and thus entering the scheme.
Thank you, Ms Yeen. Now, there has historically been a tension, and this is, if the Minister hasn't left the table, this will go to the Minister if that's okay. The Minister will be aware that there's historically been a bit of a question mark over if there is a dispute as to the purpose of a piece of legislation, whether the intention of the explanatory memorandum or the intention of the bill itself predominates in a question of resolving that dispute. My concern springs from, notwithstanding what you've contributed, Ms. Yeen, the wording of the rule, sorry, not the legislation, the rule, I think there is a potential that it could be interpreted by a scheme delegate because it is specific to psychosocial disability as therefore excluding non-psychosocial disabilities of a fluctuating nature. Based on that, I'm wondering whether there's been any consideration, Minister, by the government of simply including the language of fluctuating and episodic in the non-psychosocial section of the new rules, and whether that's something that the government would be willing to undertake, because then that would state clearly in both sections of the rules that fluctuating and episodic is intended to be included.
I don't believe that we have, because these particular amendments were absolutely to deal with issues that have been raised in relation to psychosocial disability. And explanatory, and coming back to your first point about EMs, they absolutely do inform the application of the legislation. And I know that it is the subject of some debate sometimes in this place, but I think there is no question that it is used to inform the application.
Yes, but because, I mean, this is, I know disabled people and their families, rather than be subject to debate, would just really like certainty in relation to whether they can access what they need through their plan. And I think complete certainty would be provided by, if it is your intent, as Ms. Yeen has stated, not to exclude people that have fluctuating and episodic disabilities of nature, would it not be the best thing simply to say that in the rules and remove the ambiguity?
Senator Steele-John, my strong suspicion in this is that it could well be subject to unintended consequences if we threw this in at the last minute with no great consideration or consultation. These amendments have been subject of extensive consultation with the sector, and I think they've been very carefully designed. So I would certainly welcome if the committee wanted to review this further as part of the inquiry into the bill, but I would be very hesitant about baking something into legislation that had not been properly considered, because as we've seen for the legislation that's now 8 years old, there was a lot of things that probably in hindsight should have been in the rules so that they could be more readily changed. But now we've got this legislation baked in that's had a lot of unintended consequences and complexities for participants. So I'm not saying no, I'm just saying I certainly wouldn't favour putting it in this bill at this time.
The last thing I'll say, because I know you have to go, Minister, is simply that given these are quite significant, like the number of folks with psychosocial disabilities that need support is a very significant cohort, and it is good to hear that extensive consultation has been done with that element of the community. It is also the case that people with MS, that people with other conditions potentially may be impacted as an unintentional byproduct of this amendment, are also incredibly important and need to be reflected in these conversations. And I that you have consulted with psychosocial disability advocates and peak bodies. What I haven't heard from you, though, is whether you have consulted with representative organisations from the muscular dystrophy and chronic fatigue communities, and other potentially affected communities, as to whether they would see value, not in amending the psychosocial section, but simply to reflect the clarifications offered in the psychosocial section in the non-psychosocial section, to ensure that there is no accidental, because that is my concern, that as worded at the moment, potentially accidentally, you are saying to people with muscular dystrophy, for instance, and other such episodic physical conditions, you're creating a baseline that may mean that delegates of the scheme working under stress, or indeed decision makers at the AAT level, may actually say, you weren't included in this section here, in the relevant, mirror section, therefore you cannot get the supports that you need.
Look, Senator Steele-John, as far as I know that you're the first one in relation to this bill that's actually raised this. We'll go back and have a look to see whether we've had any other feedback. But again, this, what is now in the amended bill that's now before the House of Reps, is a result of a very specific issue that was identified and has been consulted. So look, if you want to raise this with the committee in their inquiry, but again, I've got to say I would not be in favour for this bill to actually put in some last-minute amendments, because there are so many fluctuating health and disability conditions that I think that this probably is something that deserves further consideration, and possibly as part of the co-design assessment process, in fact. But
okay. Well, we'll keep talking about it, Minister, and I understand you have to leave. So I will raise this with the Community Affairs Committee inquiry process.
And I look forward to seeing that, because obviously it is a very insignificant issue, Senator. And so thank you.
Thank you.
Senator Steele-John, while I have you, there are a number of options available to the committee. We're about to break for the 1 hour dinner break. One option available to you is to put on notice any remaining questions that you might have for the National Disability Insurance Agency and the NDIS Quality and Safeguards Commission. But Senator Ruston is returning at 8 p.m. and we can ask officials to stay, and you can continue your line of questioning after 8. I just want to draw to your attention as well that we are returning to outcome 2 and then outcome 3 in the Department of Social Services and outcome 4. So how would you like to proceed?
Well, I can put my questions to the agency on notice, Chair. My questions to the Quality and Safeguards Commission might be a little bit more tricky. Are you saying that basically I've got to choose, like there's no way to kind of go to dinner a little bit later and I can just bang out these Quality and Safeguards?
Oh, no, that is absolutely valuable to you. So at 8 p.m. we can return. Senator Ruston will be at the table and you can ask your questions to the Quality and Safeguards Commission. And then at the conclusion of that, because there are no other senators have questions, then we return back to outcome 2 and then to outcome 3 and outcome 4, but we will necessarily reduce the time that is available for those other outcomes.
Okay. Well, look, I'll need to just quickly consult with my office. So can I let you know as to... It
doesn't make so much of a difference to me, but it does mean that officials may perhaps be hanging around longer than they need to.
Okay. Well, look, I will put my questions to the Quality and Safeguards Commission on notice.
Thank you.
I'll put them on notice, Chair, and let the good people go home.
That's very, very generous of you. And
I'm sure there's a lot of smiling officials. Thank you, Senator Steele-John.
Well, for the information of the committee, we will bring to a conclusion then the evidence from Services Australia, and we thank officials for their attendance and their participation and endurance, and the NDIA. And just to reiterate, we will return at 8 p.m. with Senator Ruston at the table, and we'll move back to outcome 2 in the Department of Social Services, then outcome 3, then outcome 4.
Chair, can I just thank you very much for you and the committee members for your consideration today. And can I just also note that a couple of the questions that Senator Green asked about Carly, I've got some further information from my office about contact, so I will pass that. Is it appropriate to pass it through to you or directly to Senator, perhaps through you?
The Secretary.
Yeah, so we'll get that to you tonight.
And just
Senator
Green queried that information in regards to where to access the disability vaccination plan. I hope I've characterised that the right way. So if officials could let the Secretariat know that as soon as possible as well, that'd be much appreciated.
Just a point of clarification, it's the implementation plan.
Yeah, thank you very much, Senator Grogan.
Contacted health.
Great. Okay, thank you very much. We'll now adjourn and we'll return at 8 p.m.
Thank you.
Thank you. I welcome back Senator Ruston, the Minister for Social Services and Other Things. And we will begin with, I was going to give the call to Senator Patrick, but he's not here, so I'm going to give the call to Senator Gallagher.
Thank you. Thank you, Chair. I have we're in outcome 2, aren't we?
We are, yes,
Yep.
that's right.
Okay.
So we've returned to outcome 2 and then we'll move through outcome 2, outcome 3, outcome 4.
Because I've only got 15 minutes, I actually probably have I have more than 15 minutes on this, so I've got to cut to the chase. But it's about the DES or midterm evaluation, and I've asked a number of questions about this in the last 2 or 3 estimates rounds. So,
Yeah, outcome 3.
is that outcome 3?
Yep.
Oh,
We might move through, that might be incentive enough to move through outcome
All right.
2. Senator McAllister?
Great, okay. My questions all relate to domestic and family violence, and I am hopeful that I can whip through them very quickly.
okay.
I wanted to ask about 1800 Respect and the contract there. Ms Heffron-Webb, you've previously told the committee that this would be completed by April this year. That deadline's obviously come and gone. When will the tender be completed?
So the tender will be completed very shortly.
Very shortly.
So we extended the tender process. I think we may have discussed this last time due to the Respect at Work report, which recommended that 1800 Respect take active role in responding to complaints of sexual harassment. So that meant we had to undertake an additional step in the process and go to the short list of tenderers to seek their advice on how they would expand their proposal to deal with that. That's been completed. We are at very late stage and expect an announcement shortly.
I've been told that organisations were advised that they would be informed about the outcome of the tender by the end of June. Is that correct? Originally. I mean, obviously that date's passed.
So it advised by us, or
Yes.
are you...
And for clarity, they were then advised that the tender process would be completed by the end of August. Is that also correct? That there was a deadline of June and then a deadline of August?
I'm just not sure where that advice has come from. Is that subcontractors of Medibank who have said that, or...?
Nope, organisations that have been tendering for the work. Okay, might not be true.
Yeah, I'm not aware about that. I don't know if Mr Bennett has any advice about that.
Senator, nothing to add to what Ms Heffron-Webb said.
Right, so just to get the timeline straight, you decided... You feel... I don't actually recall this being discussed in the last estimate.
Perhaps it wasn't, I'm sorry.
But at least by May this year, you'd worked out that the Respect at Work recommendations meant you had to adjust the terms of the contract. Correct. You went back to organisations. What did you tell them about the deadline at that time?
I don't think we've given, I have not given a deadline associated with the process because it's a procurement process, but certainly at the budget after the announcement associated with the Respect at Work, we got probity advice about the best way to handle the issue. The advice was because the procurement process was underway and that we were dealing with the second stage, that we would recontact those at the second stage associated with this variation associated with the procurement, and that has added a period of time to where we're up to, taking into account that Ms Heffron-Webb says that we expect to finalise in the near term.
You've previously advised, in an answer to a question on notice, that the current contract was extended in 2020 to ensure that there was a continuing service until the tender process was complete. That contract finishes on the 31st of January next year, is that correct?
That's the current end date.
Do you consider that a further contract extension will be required?
Yes. Just for continuity, not because we won't have completed the tender, but for continuity of service.
Right, and how long do you anticipate that extension will be?
I think we're currently in discussions about that. So several months, I would anticipate, to ensure, basically to ensure we have continuity of service.
Okay. I mean, look, there are more than 30 full-time staff, or FTE, in Victoria alone that are effectively at the moment have no job security past the 31st of January. Is there anything that you want to tell them about their positions and their roles and their capacity?
So I believe that they will have been advised about an extension, but perhaps not yet, but very shortly they will be advised about an extension to that agreement.
Mr Bennett, do you think that staff in Victoria who work in these existing provider will be aware of the arrangements? Ms Heffron-Webb says they've either been advised or they're shortly to be advised of an extension. What's your understanding of the situation?
My understanding is consistent with Ms Heffron-Webb.
So you don't know whether they've been
No,
advised?
sorry, Senator, if I could add further. So we are discussing with Medibank associated with the current service, and I expect that they are communicating with their staff associated with how we're communicating to them.
And what would have been communicated? I mean, Ms Heffron-Webb says they may or may not have been told that there'll be an extension. What do you think that the existing provider understands about the situation?
The existing provider is aware of the extension. What we're saying is we're not 100% sure if they have communicated that to their staff.
On a different question... Sorry?
Sorry, just coughing.
Oh, bless you.
No, it wasn't a sneeze, it was just a cough. But it wasn't COVID. I had a test this morning.
That's right. I too have asthma, Anne, and it's very uncomfortable.
No, you don't have to if you go to have a test.
Sorry.
No, I wasn't having a test because I had
Sorry.
a cough. No, to go home. I have to have a test to go home.
Sorry.
Actually, I could say that. I could leave.
No.
Yeah, that would be...
Earlier today, you reassured me that there were no circumstances where you could imagine moving domestic violence victims onto the cashless debit card, Minister. Can I just check whether that extends to people who may be seeking a crisis payment from Centrelink? Are there any circumstances where a person seeking a crisis payment would be forced to obtain that via the CDC if they were in a CDC area?
Not that I'm aware of.
Okay. I ask because I have heard anecdotal reports of domestic violence victims who are on government benefits, are moved into accommodation located in a trial site when they approach a domestic violence service provider for assistance, and then are forced onto the cashless debit card because they've moved from an area where the CDC is not in force, they've sought accommodation assistance essentially, moved into an area where it is in force, and then are forced onto the CDC. Is that something... I can't verify that, but can I ask whether that is something that is possible under existing guidelines?
I would have to check on that, Senator.
Is it technically possible that that could be what happens to a person?
I mean, a person who relocates to a cashless debit card site and changes their address because they're permanently staying in that new site potentially may receive notification that that's a cashless debit card site. That's the only circumstance. So if they just went for a few nights because they were placed in a crisis accommodation service, they wouldn't be changing their permanent address.
Let me check on that and get back to you so that we're giving you exact information, Senator.
Well, you'd agree it's a problem because it presents a significant disincentive for a person to seek assistance, doesn't it? If we have people who are receiving benefits and the consequence of them receiving support for longer term or transitional accommodation is that they're forced onto the CDC, it potentially provides a disincentive for them to seek that support. You'd agree?
What I'd like to do is to seek some advice and come back to you because I don't necessarily think that would be the case, but let me find out because I want to make sure that I'm absolutely accurate in my response to you, Senator.
Yeah, okay. Well, I mean, I think logically what I've put to you sounds credible within the terms and it sounds consistent with
Well,
the answer
not
Ms.
necessarily.
Webb has provided.
If somebody possibly just moved to the site and that we were unaware that they were escaping just domestic violence, then if we don't know that, then we can't be, you can't do anything. However, what I would like to check is, and if you're not changing your permanent address, then you wouldn't, there would be no action. But let me just check in full detail. But I would suggest they would not be required, but let me check.
Just a couple of final questions before I wrap up, Chair. Minister, the current national plan expires in June next year. You've previously given an indication that a draft plan would be made public in the final quarter of this year. Is that still your expectation?
Yes.
So is the department drafting that plan at the moment?
So at the moment, the department is in the final stages of drafting. The process that we've obviously got the NPAG and we've also got the Aboriginal and Torres Strait Islander Council, both of which we will be seeking for that draft plan to be provided to for their comment. And then once that process has been gone through, we'll be taking it through the Women's Safety Ministers task force, which the meeting currently we're in the process of trying to organise one, but it definitely will be in November. And once that particular group has had the chance to have a look at it, then it will be made available for.
Sorry, so there'll be a meeting of the Women Safety Ministers Task Force, which is the ministers, not the officials group, and you expect that will take place in November, should it be possible?
Well, no, we're saying it will, but I just can't give you the date because I don't think the date's actually locked down. There are a few dates that we're looking at. But obviously we will give the ministers from the states and territories the opportunity to have a look at the draft plan. Then we will meet to discuss the draft plan to make sure that that everybody's,
in November.
Yep. And then as soon, and once, I would obviously seek at that time the approval of the ministers for it to be released.
As a draft?
Yes.
And then there'll be a public consultation on the draft?
I'm not in... what actually will happen from there? I mean, obviously we're very, very keen to seek feedback. I'm just making sure that I use my words right. I mean, what is defined by public consultation? We're very keen to talk to stakeholders, obviously, to make sure that we have the plan reflects what the consultation, what their views of the consultation is. But obviously we sort of bookended to some extent. We want to make sure that we've got the maximum amount of opportunity for people to comment on the draft plan. We need to move it from a draft plan into the final plan. We obviously need to make sure that we've got the targeted action plans, both the 5-year plan and working with the Aboriginal and Torres Strait Islander Council to make sure the Indigenous plan. So there's a lot of things that need to occur for us to meet that deadline. But we will be making sure that we provide as much opportunity for comment as we possibly can, but still making sure that we meet that deadline of the 1st of July.
Oh, I see. So the 1st of July next year.
Which is when, obviously, the current plan expires, and we do not want to leave a period where the current...
Okay. Your comments remind me that I don't think that the idea, for example, of a 5-year action plan is really something that we've discussed publicly, or at least in this forum before. Are you anticipating having... What do you imagine is the length of the national plan?
It's a 10-year plan.
It'll be a 10-year plan. And what's the idea about the 5-year plan?
Well, the last national plan was 12 years and had 4 action plans, as you would be well aware. Yep. So this time, because of the experience of the 3 years, the suggestion was that it be longer. That 5 years was a better period of time for the action plans. But the action plans are the individual plans of all the jurisdictions about what they are doing within their particular areas of responsibility. Obviously, the federal government is very keen to take a very strong role around prevention because it's a population-wide issue. Working with the private sector to make sure that we're embedding understanding about this issue more broadly. Whereas, obviously, as you're also aware, the frontline services are something that states and territories are very much taking the lead on.
Okay. You've previously indicated that you support the calls from First Nations women for a standalone plan for Aboriginal and Torres Strait Islander women. I note, though, that in some contexts you've said, well, for example, in this article that I have from Women's Agenda, but you've made comments about this on many occasions, it says that it reports that you support the development of a standalone national plan to reduce violence against Aboriginal and Torres Strait Islander women and children, but your quoted language is, we absolutely support a dedicated self-determined action plan. Can you just explain to me, within the framework you've just outlined, is it an action plan or is it a standalone plan?
The next national plan to end violence against women and their children is a plan that will encompass all Australians. But what we heard very loud and clear, particularly in discussions with people like June Oscar, Marsha Langdon, Sandra Creamer, is that they wanted real and tangible action on the ground about issues that would actually address the issues that confronted their people. And so what they asked for was an action plan. So there will be a general action plan, the 5-year action plan, that will be more broadly, deal with all issues of domestic violence, and there will be a standalone separate action plan, based on capability building within the community-controlled sector, making sure that we are building capacity and capability into that sector, making sure that we move to as a true co-design model with Aboriginal and Torres Strait Islander people to make sure that that action plan actually reflects the particular issues that they want to see addressed to address the issues in their population. So, very much dedicated, practical, real initiatives on the ground that Indigenous people believe will make a difference.
I understand. Look, just one final question. You said earlier that the primary prevention function, you imagine, will be focused on working with the private sector. What do you mean by that?
No, Senator, I don't think I actually said that. What I said was that one of the roles I think that is very important for the federal government or the Commonwealth government are to focus on things that are at a whole of population level. Clearly things like our Stop It at the Start campaign, and working with states and territories for national consistency on definitions, on legislation, on language and those sorts of things. What I was referring to when I was talking about the private sector is if we are going to really address this issue and change the dial in terms of changing Australia's attitude to family, domestic and sexual violence, we need to make sure that every Australian understands what domestic violence, sexual and family violence is. They need to understand, they need to see what, be able to identify it. We need to provide them with the tools to make sure that they are able to assist in changing this dial in Australia, because no government, no amount of money is going to change to end violence against women and their children. The only way we do this is on a whole of population level. And we're very keen to work with the private sector to make sure that they have got programs built into their businesses so that they can support their employees, to make sure that they can support their customers. It is a very, I think the next national plan needs to work ways that we can get every single Australian to actually understand what family, domestic and sexual violence is, and let every Australian understand how that they can participate in ending it.
Okay. Thank you, Chair.
Thank you very much. So we'll now move to Senator McCarthy. Senator McCarthy, can you hear us well? Great.
I can. Can you hear me?
Excellent. Over to you.
Thank you, Chair. I'd like to go to the Northern Territory in terms of the cashless debit card. How many offices does Indue have here in the Northern Territory?
Senator, Indue doesn't have any offices in the Northern Territory.
And how many staff does Indue have then based in the Territory, and where would they be based even if you don't have the offices?
Senator, I'm not aware that Indue has staff based in the Territory. Services Australia are undertaking the rollout of the cashless debit card in the Territory. They are performing all the functions of community engagement, of frontline services, of helping people transition to the card, etc. So they're doing that in their Services Australia offices throughout the territory, in their agents and their remote visiting teams, etc.
And Senator McCarthy, obviously with the new arrangement and partnership with the Traditional Credit Union, the Traditional Credit Union will also be providing support to their customers who wish to use the Traditional Credit Union as the issuer of the cashless debit card in the Northern Territory as well.
How many ATMs does Inju have in the Northern Territory?
Senator, the card can't be used to withdraw cash, so it's not used at ATMs.
So can I just ask why the Minderoo Foundation is part of the CDC Technology Working Group?
That's arose out of the involvement of Mr. Forrest in the original report calling for a cashless debit card that was undertaken back in, I think, 2014-15. He, you will remember, was a strong advocate and so has continued to have interest in this work and has asked the Minderoo Foundation to continue engaging with this piece of work.
And who is the Minderoo representative?
I'm not aware. I don't know if my colleague, Ms McClarty, knows who the Minderoo representative is.
Yep. I'll just find that. Bruce Mansfield.
So what's Minderoo's expertise, though, in the product level blocking technology?
They've previously undertaken scoping work. I believe they released a report a few years ago about this issue. I might see if Ms McClarty has more detail on that.
I don't have any more information on that, but yes, they did release a report a few years ago.
The other thing, Senator McCarthy, that may be of interest is Mr Mansfield used to work for EFTPOS, so has, obviously a very, very good understanding and expertise in the understanding of the interface that EFTPOS provides in our financial and banking and transaction system in Australia.
So would you consider that Mr Mansfield's expertise is also expertise in retail, or just
Well, as I said, Mr Mansfield worked for EFTPOS, and the product level blocking development is very much around making sure that the interface between EFTPOS and the store and EFTPOS and the customer is interfaced in such a way as that it's a seamless experience, and so he would be definitely somebody with a huge amount of expertise in this area.
So what is Minderoo's expertise as a financial institution to be on this technology working group? You've given me the CV of Mr Mansfield, but what about the actual Minderoo organisation?
As I said, they have previously undertaken research work on this matter and I believe have published a report in the past.
Okay, do you want to just give us the date of the publication of that report?
I'll take that on notice, Senator.
Thank you. What is the CDC Technology Working Group's line of reporting to the Minister?
They report to the department, Senator.
And what technology solutions have been put forward by the group? What CDC enhancements have been put forward?
Senator, that is a very big question and a very detailed question. I don't know if anybody is here that can take you through the technological explanation around how product level blocking works. I'm not sure if anybody is here. It's also a very difficult concept to get your head around without actually a presentation, but somebody...
So essentially they have been discussing, I guess, the challenges and solutions in implementation of product level blocking. In order to implement product level blocking, it involves changes to bank systems, FPOS systems and point of sale systems, and so that group works through issues, challenges that arise in the development of that technology and the implementation of that technology, and so helps the department understand the state of play more generally in the payment sector, and any kind of system-wide issues that we need to be taking into account as we're progressing the product level blocking project. I don't know if Mr. Bonham has...
That's actually not the question I asked, though, Ms. Heffron-Webb. If you don't know, please just take the question on notice. I'm asking what technology solutions have been put forward by the group. The Minister said the line of reporting is not to her, it's to you, the department. If you could take that question on notice, please.
I mean, Senator, one of the things that I'm more than happy to offer is to actually provide you with a briefing around how product level blocking actually works and how it uses, the main highway that is Australia's transaction banking system. It's absolutely fascinating. I think to try and provide that in a Word document would be extremely difficult. But if you would like a briefing on it, I'm be happy to arrange one for you.
Thank you, Minister. There would be reports provided to the department. I mean, please share those reports from the Technology Working Group. Can I just go to the next question? In response to a question on notices at 30th of September 2020, $50,818.23 had been paid to cashless debit card account holders in interest. This was funded by the Department of Social Services. Why does DSS pay interest on the indue accounts of CDC card holders? And will this be the case if other financial institutions come on board? And what's the current figure for interest paid by DSS to CDC account holders?
Thank you, Senator. Total value paid of interest paid up to 24th of September 2021 is $95,213.
That's this year?
Yeah. I think we only commenced paying interest. Yeah, we commenced on 1 July 2020, so it's since 1 July 2020.
900 and, sorry, I missed.
95,000.
It's 95,000 or 995,000?
95,000 and $213.
So why does DSS pay interest on the indue accounts of CDC card holders?
Senator, I'm sort of a little bit of a loss. You don't want us to pay interest on people's
I'm just
asking.
I'm asking you why.
Well, because it's a normal practice to do so. And in fact, the interest rate on the CDC for at call is actually, it's just at the moment above what somebody would be able to receive as an interest payment on any other at call account that they would have with any other bank.
So will it be the case for other financial institutions who come on board?
Yes, that's right. Interest will be paid on all CDC accounts.
And how much interest does Inju earn on CDC accounts?
It earns no interest on the CDC accounts.
So what's the department doing to monitor for gendered impacts of the CDC?
So, Senator, we collect data on the client, the participants of the CDC. We undertake evaluation, as I think I spoke about earlier. So we are conscious of the gender distribution of the participant group and any issues that kind of arise in terms of issues that particularly affect women that are raised with us, we address, or we work with communities to understand more and see what support services might be required. I'm not sure what gendered impacts exactly you're talking about, though.
Well, what are the issues you're talking about that affect women? Are we talking about the questions that were raised by Senator McAllister?
No, I mean, we receive a lot of feedback from women about the kind of the financial control and the value that they place on the financial control that they have due to implementation of the cashless debit card. I think that's reflected in the evaluation. That I think women were more likely to value the cashless debit card. So those are the types of impacts we receive. I'm just not sure if there's other matters you wanted me to discuss.
No, this was part of your anticipation prior to the CDC commencing, so I was interested to know what work had been done in that area. You know, you've raised some of those issues there. I'd like to go to women's safety, and I am conscious that some of those issues were raised by Senator McAllister. But what processes are in place for ensuring that women seeking exemption or exit from the CDC program on the grounds of domestic violence are offered Centrelink social work support?
So Centrelink social work support is provided in all cases of women impacted by domestic violence to help them navigate the situation, apply for relevant payments, etc. Women on the CDC would also receive that support, and they would be informed about exemption processes or exit processes in the course of that support.
So do Services Australia remote servicing teams include social workers?
It's a question for Services Australia. Sorry, I don't know whether they do in all cases.
So what arrangements has the department made for access to legal help for CDC participants by gender, by region, in which the CDC is operating?
There's been no additional legal support provided, specifically related to the cashless debit card.
Has the department engaged women's legal services, Aboriginal and Torres Strait Islander Family Violence Prevention Legal Services, the Aboriginal and Torres Strait Islander Legal Services and Legal Aid Commissions in tailored arrangements to ensure access to community legal education, legal advice, legal assistance, including representation for CDC participants by gender?
So we haven't had an engagement with those. I think you listed a number of services specifically around their legal services you listed. We haven't had an engagement with them specifically around cashless debit card. We have engaged with those service sectors in the course of our broader work on women's safety. And of course the Department of Attorney General has extensive engagement with the women's legal services, Aboriginal, Torres Strait Islander legal services, etc.
Okay, thank you, Chair.
Senator, I would just like to clarify my earlier response in relation to the interest. Interest was commenced to be paid on 1 July 2020, but it was backdated to 1 July 2019.
Thank you.
Thank you very much, Senator McCarthy. I'll go now to Senator Green.
Thank you. I just have some follow-up from the questions I asked this morning. There was a couple of things that you were going to come back to me about. I haven't forgotten. Maybe you have. It was a long time ago. The budget for the cashless debit card policy and technology branch. Have we got that figure? I asked that question at 9:30 this morning.
I do have that figure.
Great.
It is $5.966 million.
$5.966 million.
I have ASL costs
Yes,
numbers
thank
as
you.
well. So across the two branches, it's 57.5 ASL and 21 contractors. I would just flag that the branches don't just focus on cashless debit card, they also undertake work on income management. So they cover both.
Yep.
Okay.
And I think, do you mean the basics card?
Yes.
Yeah.
Yeah. So they have responsibility for the legislation supporting income management, which is paid through the basics card, and cashless debit card.
And cashless debit card.
And I think we emailed through the structure of the policy branch.
Yeah. Are there any other sections of the department that deal with income management?
Only in an ancillary way, like legals or things like that, but that's all that works on cashless debit card and income management.
Okay. I also asked, well, I think maybe Senator Gallagher, we were curious if you had gotten to the bottom of this contract that's held with Health,
Yes.
the cashless debit card contract.
So this is, they've procured a consultant 55.5 to undertake consultation on the alcohol and other drugs services for the four cashless debit card communities of Ceduna, Kimberley, Goldfields, sorry, it's late, and Bundaberg, Harvey Bay. So it is, as I suggested at the time, I thought it might be. So it's a consultation with those communities about their alcohol and other drugs needs.
Okay.
It's not actually related to the cashless debit card in the way the contract sort of sounds on AusTender.
Well, it is sort of, I guess.
It's in those sites.
Yeah. Okay. Is the department undertaking or have any other contracts around market research around the cashless debit card or focus groups?
Not that I'm aware of market research or focus groups, no.
The department file list that you provided has a file that is called EF20/58 Social Welfare Development Advice, Routine Operational Cashless Debit Card Provider for NT and Cape York Market Research. What's that about?
I believe that may have been a scoping study that the Traditional Credit Union undertook. If it's the one I'm thinking of, is it CN 3735023?
Is that the contract number, do you mean?
The AusTender number.
I've got a document number. I'm talking about a document that's on your document list.
Like a file list.
Yep. I haven't got the file list with me, so I'm just looking for help.
Yeah.
We probably have it somewhere.
No, I'm not sure.
No, that's a number.
Yeah. EF20/58. It says market research. I know someone might be able to help you.
Getting lots of shaking of heads. I'll take it on notice and
Okay, you
try
don't
and
know
provide
what
you
it's about?
with the. I don't know what it's about.
Okay. Why would there be a file related to market research for the cashless debit card?
As I said, the project I'm aware of is a scoping study that the Traditional Credit Union was contracted to do to investigate the capability for them to deliver the cashless debit card. That's the only contract I can think of that might have been labelled market research, but otherwise I don't know.
Okay. Yeah, if you could come back with that one. And then just the last follow-up from this morning. I think, Minister, did talk about how many age pensioners are currently on the card. Just want to take you to the data summary supplied to the committee. It breaks down recipients or card holders based on their payment type. There's obviously a list of payments there. Oz Study Care Payment, Disability Support Pension, Job Seeker, Parenting Allowance, Special Benefit, Youth Allowance, and then it says other payments with a little footnote there. Has someone got that document in front of you, the summary that was provided to the committee?
I'm just getting it, sorry. Is your question what the other payments would be?
Yes, I'd like to know what the other payments are. Because I think there's possibly a footnote there that has not travelled through to the...
Sorry, I don't have any.
So it might actually explain what the other payments are.
Okay.
Senator, is that this document?
Is it on data?
Is it that document?
No, it's a little table. It's on. Is it on data? .gov?
Extract of cashless debit card data summary supplied to the committee. So we may have pulled that together. But what does other payments?
So which table is it? Sorry, Senator.
Look, I've got that much paper that I've got from you guys. It's the extract from cashless debit card data summary supplied to the committee by DSS. Number of cashless debit card participants by original CDC location as at the 24th of September 2001.
2001 or 2021?
Sorry, 2021.
Yes, I am.
Anyway, I think we might move on. Can I get an answer to that question? What would
Sure.
other payments relate to?
Yeah, we'll come back to you with that, Senator. I mean, there are some payments like widow and stuff that have,
No,
small
widow's on
numbers of
there.
people.
Widow allowance.
Oh, it's on there? Okay.
Special benefit.
I just don't know. I'll have to come back to you.
There's 22 people there in other payments from the Cape York region and 5 from the Goldfields region.
So earlier
That
I
seems to-
provided advice that there was 25 age pensioners on the cashless debit card.
There's 25.
Yep. So that would suggest that might be without.
Yeah, so every other payment type is labelled correctly, well, labelled for what it is, but then age pensions put into other payments. Is that right?
I don't have the table that you have,
Yeah.
sorry, Senator. So.
Okay. Well, can you come back to us about what other payments might be included, or whether that is just a reference to age pension?
But just to be absolutely clear, there is only one age pensioner that has been placed on the cashless debit card through the FRC. Every other one is a voluntary person on the
So
cashless
one
debit card.
age pensioner has been forced onto the
Through the
cashless debit
FRC,
card.
the Families and Responsibilities Commission under the Cape York, and it's actually explicit in the
Yeah.
legislation, Senator Green, which is actually another one of those sort of misinformation that's
Thanks
been
for
put out there.
clarifying that.
That this was actually universally agreed within the Parliament at the request of the Cape York Institute and through the Families and Responsibilities Commission. That they have total self-determination in this area, Senator. So I think it's a little disingenuous to suggest that the federal government had anything to do with this. Is a matter for the Commission. And it also mirrors the legislation that was put in place by the Labor government in relation to that self-determination, Senator Green.
Very defensive.
No, not defensive at all. I just
Yeah.
would be really, really
I think
appreciate if you'd stop
You've
lying
said
as a
that
party.
aged care pensioners can't go on the card.
Senator, in the case, well, if somebody I've never said they can't voluntarily go on the card. They can. Anybody can voluntarily go on, well, not anybody, but you know, certainly if somebody wanted to go on there, we'd be happy for them to go on there. But, you know, to suggest in some way that the federal government is forcing age pensioners onto the cashless debit card, you know is a lie. Your colleagues in the other place know is a lie. And I just find it really quite extraordinary that you can just sit there and lie. I just don't know how you've got the gall to do it. But anyway,
I think it's
you
about trust,
clearly are.
Minister. I don't think people have a lot of trust in your government.
Well, it's put on
No,
We've exhausted our questions for outcome 2, Chair, just to let you know, and we do have questions for outcome 3.
Fantastic. There being no other questions for outcome 2, we will close outcome 2 and now move to outcome 3, and then we'll move to outcome 4. So, Senator Gallagher, you had some
Thank
questions.
you. Yeah, I did. I'll just wait for the official do the swap.
You boaty boys.
Mr. Who's this? Mansfield? Mansfield. Okay. I've got some questions about the Disability Employment Services review that was done, the contract. Okay. How would I pronounce your surname?
Taria Sastamoinen.
Sastamoinen. Okay. I don't know that I've talked about this contract with you before. I think it was with Mr. Flavel. Okay. This is the saga of the contract that I've been talking about for the last 3 estimates to try and get to the bottom of. Can I register my sincere displeasure that questions on notice that were about 100 days overdue were lodged at 11:54 last night in terms of answers to questions I have? That's one of my first points. And that the fact of the questions that were answered about 100 days late and at literally 5 minutes to midnight. I'm not joking about that. Yeah, literally 6 minutes to midnight. Most of them did not, in fact, all of them avoided answering the questions I'd asked about it. So, a stock take of this, of where I'm at, is that I've come across this contract. It was signed off originally, Mr. Griggs, before your time, as $1 million exercise. This was the note that the Secretary signed off, potentially going up to $1.5 million, to do a mid-term review of the Disability Employment Services program. It ended up costing $3.3 million and had a $1.7 million research component, which was not part of the request for tender or any of the documents that I've received since under various questions on notice, and there's been FOIs about this. And I don't believe that the Commonwealth procurement rules have been followed in relation to this. It looks to me like you quite legitimately went out to do a contract on a mid-term review for the Disability Employment Services, and then at some point you worked out that you wanted a research component, which was not outlined in the request for tender documents, of $880,000. You then doubled that to $1.76 million, and you took internal procurement advice about what rules you had to follow. So, where do we start? One, have you told the truth that procurement rules have been followed and that you're not trying to bury another procurement project within an existing procurement project, because that's what it looks like to me. Because I can't see how the research component, which is 1.76 million, that was never disclosed in the request for tender, relates to the midterm review of the Disability Employment Services Program. And your answers to me about what it was, when you have answered in a general sense, say that it was a mixture of research materials, presentation, charts and modelling, and also an analysis relating to income support payment populations, including demographic features, spatial distribution and rates of payment and supplements. And it related to the significant change in the number of payment recipients resulting from the COVID-19 pandemic and how this experience contrasted with previous economic downturns. I don't know how that relates to the Disability Employment Services midterm review, which was the original request, which was what you originally went out to market for. So I don't know, Mr. Griggs, if whether there's an opportunity for you to have a look at this, because you know, and I'm happy for Mr. Flavel to tell me I'm wrong, but it looks dodgy to me. It looks like you've gone out with a legitimate contract and then you've tagged things onto it without going through another procurement exercise. And my reading of the procurement rules are that you have to go out and seek, go through the request for tenders under the procurement rules. You can't just tag on, essentially, a more than doubling of the contract. And I accept that it's before your time, Mr. Griggs, and you won't be across it. But unless Mr. Flavel can convince me otherwise, and we've had 3 estimates hearings on it, and you've delayed answering questions on notice, and I know The Guardian has had FOIs on this, and that you've wound the clock down on that in terms of how you provided advice. So it does appear on the surface to me that DSS has been, well, to be polite, playing a bit of a game over this contract. So tell me I'm wrong, Mr. Flavel.
Well, Senator, I think I'd say a couple of things. Firstly, it is consistent with the Commonwealth procurement guidelines.
Can I stop you there and say, but that is your own advice. You never went out and sought other advice. You internally, apparently, and no one will provide me with the information, you went to an internal officer and said, is this compliant with the procurement advice? And apparently they said yes, because that's the answer I got to one of the questions.
Yeah, and that's a reasonably standard process. There's no requirement to go out for external validation of compliance with the Commonwealth procurement guidelines.
But you won't provide us with the advice.
I'm happy to take that on notice.
No, you have taken it on notice. You took it on notice last time. This is my frustration, Mr. Flavel.
The question about the procurement guidelines?
Yes.
Do you have the
and
question?
The advice. Like, can you provide the advice that you got about the procurement? It was absolutely a question I asked, and I got a question which did not answer that. I got the answer, I can understand that we could provide that advice to you on notice. It's question on notice DSS SQ 21 000484. We don't have it here with us. And the answer is the Department of Social Services had regard to the Commonwealth procurement rules, but did not take advice from outside the department in relation to the procurement. So I have asked for it. And that's the answer, which is, go away, you're not getting it, and believe us.
Well, I'm happy to look at what can be provided.
Well, if you can provide it now, then you were lying or refusing to answer on the question I asked 3 months ago.
Well, Senator, I've said I've taken on notice to look at what can be provided under it. I think in terms of the contract itself, my recollection is that it was quite clear in terms of the contract that it was for both a review of the Disability Employment Service arrangements as well as specific research into the impact that COVID was having on people with a partial capacity to work. And so in that sense, I don't think the way you've characterised it to sort of say that it was somehow different is correct.
Well, there is no reference to research component in the request for quotation, because we've got that under FOI, surprisingly. And it does not talk about a research component. The research component comes in at the point that the contract is signed off, and you have a component in the work output for a research component of 800,000 or 880,000, which then gets doubled somehow without actually going back out to market. Like, what it looks like to me is that you've got market research happening within another contract which was for a midterm review.
Market research.
Well, of COVID and its impact and whatever else. I mean, you essentially admit that in one of the questions on notice that got answered at 6 minutes to midnight last night, where you essentially say there is a research component to the contract.
Yeah, and sorry, Senator, the point I was making was that research into people with a partial capacity of work is really part of the same set of issues that are involved in the effectiveness of the disability employment services.
Okay.
They're all about trying to ensure that you maximise the capacity of people with disability to engage in the labour force.
Well, why didn't it appear in the request for quotation when you went out to market then?
I'm not sure.
If it was a legitimate component.
I'm not sure, Senator. It also predated my time in role. So.
Okay. Well, can I ask, like, honestly, I know it's relatively small in the big context of things, but I feel certainly frustrated at the extent that I've had to go to extract answers on this. And I feel like there is some level of obstruction in terms of the information that is being provided. I would really, Mr. Griggs, ask that you have a look at the whole saga from beginning to end, and at the next time we meet, or if there's another opportunity somehow, to say that you have run the ruler over this and that it does meet the Commonwealth procurement guidelines or the rules. And if it doesn't, we just admit that it doesn't, and that it could have been done a better way. Yep. Like, no one's going to jail over this, and I'm not accusing anyone of doing anything willfully, you know. But I do think that the procurement rules are there for a reason, and that you go out to tender for a reason, and that we have transparency for a reason, because it actually stops the potential for corrupt conduct.
Yep.
But if you are burying a contract within another contract, that opens up questions around that. That's the point I'm trying to make.
Yep. Understood. I'll have a look at it.
Thank you. And I'm happy to provide you with whatever you need from my point of view, but there are at least 2 FOIs from The Guardian and a number of questions from me about a contract that started as $1 million and ended up at 3.3 million to Boston Consulting Group. Thank you.
Thank you, Senator Gallagher. Are there any more questions in outcome 3? There being no other questions in outcome 3, we'll move to outcome 4. Senator Grogan.
Thank you. The questions I have go to the National Housing and Homelessness Agreement. This one. During a speech, Minister Zucker gave in the House in March, he stated that there were inadequate lines of oversight in the National Housing and Homelessness Agreement. Would you agree with that statement?
So what was the context of...
it was in a speech he gave regarding housing and homelessness, funnily enough, part of a debate, and he made reference to the fact that he felt that there was insufficient oversight. And I'm just wondering if you had any, if there'd been anything that has sort of generated from that.
Look, I'm unaware of that particular statement by Minister Sukkar, but in a broader context, this may be what he was meaning, and it's something that I've often raised in here in answers to questions. Is the lack of information that the Commonwealth is able to get access to get a broader understanding around issues around housing stocks, community and social housing stocks, issues around, homelessness services and the like. I know I've certainly been on the record on a number of occasions, indicating that, I would like to be able to get a better national picture on some of these issues, and that, I have been a little bit frustrated at the lack of information that I have been able to get from the states. We certainly don't want the states to be going out there and collecting another data set. That's not what we want, but it would be really good to be able to get a sort of a high-level national snapshot of the issues that sit within that agreement.
Because I would say that it's been an ongoing problem. There's a whole range of expectations within that agreement that have not been met and continue to not be met. And which is why that statement from him was an interesting one, given the renegotiation is coming up next year, as to what the plan then is to actually make sure that renegotiation includes getting to a point of actually starting to see some outcomes.
Yeah, no, look, as I said, I'm only making those comments from, I don't know what Minister Sukkar was meaning by the comments that you're talking about, but I certainly agree that a greater level of, clarity around some of the issues, would be certainly of benefit to us all.
Yeah. Now, has the Minister's Office approached the department at all around gaining any advice in relation to greater oversight, changes, the upcoming renegotiations?
Senator, not that I recall. The current agreement expires on the 30th of June 2023. There will be a process of review of the agreement by the Productivity Commission.
Which starts next year?
Which will be next year, and is due for completion about a year prior to the current agreement lapsing. So
my sense is that would be pretty close to being on hand, given the timeframe that Productivity Commission requires. That you would be at least starting to think about the kind of process.
Mid-year next year is when the PC will report back on the NAHA.
Yeah.
And then obviously that gives 12 months in which to renegotiate the new NAHA. And, I think, greater clarity around the effectiveness of the spending, where there is, excess demand. It is a subject of quite a amount of conversation over recent times.
So I would assume that you would have turned your minds to what the scope of that. Obviously, the Productivity Commission is going to do its piece, but obviously you would be thinking surely at this point given that it is a renegotiation, what elements you would want to see brought in to that renegotiation? I would have thought. Or not really?
Yeah, well, I think probably the greatest issue, as I said, is the fact that, we really don't have, as a federal government, or certainly to my satisfaction, the kind of information that would provide me with the substantiation of the effectiveness of the expenditure of the money. We're talking about, $1.6 billion a year.
It's a lot of money.
It's a lot of money. But there's a lot of demand out there for the kind of services and that are being provided under this agreement. So, one of the things that I have certainly been working with the states and territories on in recent months is in relation to trying to get additional information around this particular issue and the issues that sit in the NAHA. We certainly have been making some progress, but it is probably singular. The data collection around this has probably been the biggest issue for me now. Minister Sukkar, who has responsibility, day-to-day responsibility of this, obviously would have some more granular detail. But for me, it is very much probably the most important thing I think that we need as a federal government so that we can get greater understanding of what's working, what's not working, what's being effective, where it's being spent, so that we do know what we need to be doing to renegotiate.
So I'm just confirming that he hasn't come to the department for any advice on what amendments could be made to allay his concerns that he's expressed in the Parliament.
Yeah, not to my recollection, Senator.
No, okay.
But, you know, certainly, you know, as we work our way forward, you know, with the review of the PC Commission, you know, we do understand that it's, you know...
There was one other thing that he raised, if I may, about the indexing of payments, which he's quite proud of the fact that it was himself who actually made that happen. But National Shelter, post the budget this last year, has raised concerns that it's being indexed at a low wage cost index, and therefore claimed that it's not keeping pace. You would be aware of the National Housing and Homeless Agreement, yeah?
Yep.
That they were concerned at the indexation point, that it is at the low wage cost index, and they're saying that it doesn't keep pace. Is that something else that you are going to have a look at?
Well, Senator, these are payments to the state governments, to the extent that state governments then...
But it is the indexation that I'm talking about, not what the states do with it after. It's the indexation of the Commonwealth Index, is it?
Yep, and it's used as a general wage price index, which is a pretty standard arrangement for most Commonwealth state agreements.
And was negotiated when the NAHA was first negotiated a number of years ago.
And so would that be something that you would be looking at in the review or no?
Well, any new arrangement to this nature, obviously, the states and territories can raise any number of issues that they'd like to have considered as part of the renegotiation. That's what it is. It's renegotiation.
As can the Commonwealth, in terms of trying to get the best agreement you can, right?
Yeah, absolutely. And as I say, getting the data so that we can get some real clarity around what's happening in this area. So
would you be considering adjusting the indexation?
Well, I think that I'm happy to speak to Minister Sukkar around the broader issue there, but I don't necessarily think that anything's off the table in relation to the renegotiation, and obviously will be significantly informed by the PC review about the issues that they are likely to suggest need to be reconsidered.
Indeed, yeah. So in the 2019-20 financial year, about 30% of the clients assisted in the special homeless service were Indigenous. Does that tally with your numbers? And from the Australian Institute of Health and Welfare, they're saying that number is increasing by approximately 6% each year. So it's an expanding need. And we've talked about the fact that there could be improvements to that agreement. But I'm interested to know how you intend to address that the improvement of outcomes for Indigenous people, which is one of the key aspects of the agreement.
Well, I mean, obviously, as I said, anything that's contained in the agreement, obviously be considered. But I don't know whether you would like to, closing the gap, measures are also something that gets, considered more broadly, and the federal government has made a very strong commitment in conjunction with the National Leadership Group in relation to closing the gap targets. But I don't know whether there's anything specific around that sits within our area or... No,
again, I mean, Indigenous people are identified as a priority cohort under the National Housing and Homelessness Agreement, but the states are responsible for the frontline funding and delivery of those homelessness services, so the SHSs you referred to, and the Commonwealth makes a contribution to that. In fact, makes a dollar for dollar. That's a requirement under the NAHA, that it's a matching contribution.
But you'd have to say it doesn't appear to be achieving its goals.
I think it would be better for us to go away and look at the data that you've mentioned. I've got sort of static data at 2019-20, just in terms of any changes to the composition for that cohort.
Okay, can you bring us back then, or take on notice, to bring us some statistics of sort of like the last 5 years, how that cohort is faring? Because on all the indicators that it would seem that they are faring worse, which is obviously concerning. But given that you're about to go into a negotiation, a renegotiation, surely these are the kind of things that should be being brought to the fore to be considered in that, to actually try and get to stop this path and actually start getting some better outcomes.
Yeah, sure, we're more than happy to take that on board.
Yeah.
And also I can probably speak to the NIAA in relation to some of the things there.
We need to look at it through the lens of Target 9 and the closing the gap agreement.
Yeah.
Yeah. So, has there been in the last agreement, were there any core targets that were looking to improve the outcomes there?
And the one we're currently in, you mean, Senator?
Sorry?
You mean the current agreement?
Yeah.
The one that's operational? I might ask Mr Sloan just to talk about the targets.
Troy Sloan, Group Manager, Regions Housing and Homelessness. So, as Mr Flavor was saying, there was, in the agreement itself, if you go to Part 4, Clause 31, talks about the objectives and outcomes that are covered, that are the goals or the national performance indicators. So they talk about things such as the total number of dwellings relative to population, the stock of affordable rental housing relative to population, the stock of social housing dwellings relative to target population for social housing, increase in the proportion of social housing occupants housed in homes that meet their needs, an increase in the number of social housing occupants with the greatest need as a proportion of all new allocations, an increase in the proportion...
I'm not sure we need to read the whole agreement.
No worries.
At 9:15. I guess I'm trying to get to if there were any solid activities undertaken that were trying to improve the outcomes here and how they have actually fared. Noting, of course, that the renegotiation will include an evaluation, but surely at this point in the game you'd have a pretty clear picture of whether things were working, whether there'd been any activities that were actually bearing fruit.
And I think that's the point, Senator Grogan, that I was actually making earlier is the fact that we really don't have the kind of data and information that would satisfy me that I could actually give you the answers to those. But I think you make a very good point, and it's what I've been making for a long time. We do need this information because, first of all, to understand the efficacy of the existing agreement, but also to identify where, the failures are in the agreement. And I think, as you point out, if you look at other statistics that have come about by other means, it's pretty clear that, some of these measures are drifting. And, in your reference to, the closing the gap 9.
And I think, Senator, there was both parties, all parties recognised that the data that we had in this area wasn't as good as we would like, and hence there was an agreement to establish the data improvement plan, which was agreed in April this year by Treasurers, with the idea that by July 2023, there will be a set of new indicators, data that will be able to help us look at the outcomes that are being achieved in this space.
Just on that point, how regularly are the performance reports on the agreement provided?
So under the agreement, by the end of October each year, states have to provide what are called statements of assurance, and that sets out, within that there's things about, they have to show expenditure on the priority cohorts. They've got to list how much money they've spent and how much money of ours they've spent on homelessness versus housing housing outcomes. So yeah, that's 31 October
Are states
each year.
exceeding expectations under the agreement?
They are providing the data that is required.
But the data is to measure performance. So which states are performing against the agreement and which ones aren't?
Mainly the issue, and I think we've talked about this before and the Minister's already mentioned it, the data is that is required in a statement of assurance is more around what they're spending
and in what categories they're spending it in.
So I don't doubt that they're spending it.
But yeah, which I think is probably part of the problem, right? We're counting widgets, not human beings. And I think that's probably part of the challenge. And obviously, leading into a year of renegotiation, it's an opportunity. This agreement's been around for a long time, and it's certainly not delivering for Indigenous people. And the growth, and obviously we'll see the figures when you bring them back, but it's certainly not looking very good at all. And I think, and there's also, there doesn't appear to be in the budget, there's no funding for the remote or any other Indigenous housing in the 2021-22 budget that goes past 2023.
So the Northern Territory Remote Housing Agreement expires, I think, in June 23. So that'll be renegotiated.
So is that lack of funding pass due to the renegotiation? Is that due to
actually, I think there is a funding. I think there is an ongoing funding line of 110 million a year for the NT Remote Housing Agreement.
Yeah, that's correct. There,
it was in the budget.
Yeah. My figures show in 2021 it's 185 million, and in 2023 it's 110, as the Secretary said.
Yeah.
Yep.
So there was 550 over 5 years for remote housing in the NT, and then some one-off contributions. Is that right?
There is the 550, and as I said, that's my recall from my last job is that's going forward at 110 a year. There were 3 states that had one-off payments: West Australia, South Australia, and Queensland, in relation to remote housing.
Senator Grogan, if you want to prosecute this tomorrow, National Indigenous Australians Agency is actually on for estimates tomorrow, and this actually issue, you may be able to get more granular detail from them.
Okay. Yeah, so obviously not seeing it. I have to look back at the lines in the budget paper, but I wasn't seeing that money going anything past 2023.
I'll check that, Senator.
If you wouldn't mind, and maybe come back to us, that would be very helpful.
Senator Grogan, you have now had the allotted time. We're at the evening.
I think I'm the only one left standing.
Sorry,
but I'm happy to keep going.
I'm
Senator
standing
Smith.
as well.
Yeah.
Just keen to get an indication of whether you've got a few more questions, or you'd like to go to the break and return in 15 minutes' time, or.
Oh no, I think we can get to the end of this, and
I'm starting to like you.
We don't.
No break required.
We don't talk about timing because that usually jinxes it.
That's right.
So,
we will
I'm assuming
go
that
to the
means a few more
fullness of
questions.
the rest of my questions, and I think you'll be quite content with how that goes.
We'll see.
Good South Australian senator.
The states and territories have their publicly available housing and homelessness strategies, which say that they're supposed to improve their data collection and reporting. Has the department or the minister got anything around a federal piece to knit into that? Because it builds off the states, but an overarching federal piece. I mean, I get that there may be some tensions in that, but no.
In relation to?
In relation to the agreement, to the NAHA, of a national piece of housing and homelessness. At the moment, it builds up from the states, and you've already expressed some of those challenges.
The states and territories take responsibility for this particular area of administration, and the NAHA is, I suppose, the negotiation and the mechanism by which the federal government provides the states and territories with the funding to undertake these activities. I mean, certainly, Minister Sukkar meets with the housing ministers, and the federal government would be and remains very keen just about all of our policy areas to get national consistency on many issues. But in terms of the actual the strategy and the policy as it relates to housing and housing, community housing and homelessness, does sit very much with the states.
Has the Minister requested any advice on such a strategy?
I don't think so, no.
Don't think so?
Certainly check for you.
Yeah.
But, yeah, if you wouldn't mind, that would be good. I think I'm about done. I would like some further detail on the funding for remote housing, as we discussed, and those other numbers. That would be most helpful.
Whether there's a program for tomorrow, we can grab for you just to have a look and see whether it works for you tomorrow, because I'm assuming you're not going home till tomorrow night.
Reverse the NIAA.
So you may be able to pop into NIAA tomorrow, and they may be able to give you some extra. But we will certainly have taken on notice all the questions you've asked of us. But there may be some more that you can get from NIAA tomorrow.
Yeah. You might want to check out his speech from March.
I will now. Spend all day reading my college speeches from the other place.
Thank you very much for your time. Really appreciate it.
Thank you.
Are there any other questions for outcome 4? There being no other questions for outcome 4, I'd just like to extend a belated welcome to Mr Griggs, whose first estimates it is as Secretary of the Department. So congratulations, and thank you very much for your very positive influence over today's proceedings, because we're finishing at close to 9:30 and not 11 o'clock. There being no other questions from colleagues, the committee's consideration of the social services portfolio is now concluded. On behalf of the committee, I thank Minister Ruston and other officers and officials from the Department of Social Services and other agencies who have given evidence today, and extend our appreciation, of course, to the Secretariat staff. Thank you very much, and the hearing is adjourned.
Thanks, Chair.